Good morning, ladies and gentlemen. Thank you so much for being here today. It is an early start to the day, but what an amazing day is going to unfold in front of us. So as I welcome each and every one of you here today, you know, in the words of yesteryear author Miles J. Stanford, who says that health is a state of the body and wellness is a state of the mind. So a hearty good morning to all of you. As I look around this room, I'm wishing for each and every one of you, all of us, pink of health in mind, body, and physically, just feeling energetic this morning. So everybody, we're talking about wellness, we're talking about health. What say we go ahead and put our hands together, a special wellness clap, if I may. All right, so everybody, this is how it goes. It goes like this. Wait. We'll do it together. But I love the enthusiasm, so which means we're already feeling energetic. But this is how it goes. It goes. And then we're going to shout, yes. Look at this. They say rhythm, the circadian rhythm. We'll talk about that later. But rhythm is one of the things that gets you in healthy mind and body. And we've got the rhythm going. So, perfect. Thank you, everybody. So we're going to do this 3 times. 1, 2, 1, 2, 3. We'll do that thrice. And then together, in one voice, we're going to call out health and wellness. Are we ready? So, you know, we're kind of invigorating our body and truly finding our arrival this morning. So everybody, on the count of 3, let's create our rhythm together. Everybody. Okay? Like they say, let's pick ourselves up, tilt a little forward, get ready to do this. On the count of 3 then. 3, 2, 1. I heard it. You don't have to shout any louder. We're feeling all the vibes this morning. It is truly a special morning that we gather here today, you know, and all of us being in one room this morning, it's really refreshing to see all of you joining us here today, because after what seemed like ages of unending virtual meetings and working from home, we appreciate and acknowledge that all of you could join us here in person today. And it's also beautiful because we've got many participants who join us online as well. So a warm welcome to all of you. Thank you so much for making sure that your time right now is to talk about and listen to and indulge in this beautiful space. It is a movement and we're going to stride into it together. So while working from home in the last 2 years, it came with its own share of chaos, didn't it? It came with various recipes where you had to blend work and your personal life at home as well. And you kind of prepared a smoothie that was unique to each one of us. So ladies and gentlemen, talking about smoothies and recipes, I invited all of you right here into the ballroom while you were having breakfast. I hope you had yourself a good cup of tea, coffee. Yes, big smile, nods all around, thumbs up as well. Was it a good start to the day? Always good. So, you know, we're all about making and creating healthy habits. And while we kickstart this morning, I'd like to introduce myself. I am Keisha Lobo. My pronouns are she, her. And on behalf of Great Place to Work Institute India and HDFC ERGO General Insurance, I'd like to welcome each and every one of you to the Health and Wellness Summit. A huge round of applause. I'm going to be your host today, and it's my pleasure to be your guide throughout the various insightful sessions of the day. You know, we unveiled the wellness framework in 2020, right before the pandemic. We preempted the importance of well-being while studying many organizations over the years. We realized that an organization is truly a great place to work when it also focuses on overall employee well-being as a key component of workplace culture. And this was the genesis for developing the framework to understand what truly drives a culture of holistic wellness in an organization. So, keeping this in mind, Great Place to Work and HDFC ERGO have come together to drive this movement to make India a healthy place to work for all and ensure that well-being, now listen to that well-being becomes a priority agenda in the boardrooms and that leaders take the initiative to build a culture of holistic wellness. The theme, ladies and gentlemen, for the summit is championing well-being, making health a habit. I'm going to repeat that and you may as well with me. Championing well-being, making health a habit. The pandemic may be behind us, but it did bring the realization that health and overall well-being is not something that can be taken lightly or compromised. In fact, it brought to the forefront the need to prioritize health and wellness as a part of our everyday life. So while employers have taken note of this and have put practices and strategies in action, the need of the hour is to ensure every individual makes well-being a priority, champions it, and makes health a habit. We believe that consistency is key to making a habit, and we want the same to be implemented for well-being in workplaces. So before we kickstart the summit, we've got a few quick announcements. We will be taking a lot of stretch breaks, so get ready to move around a bit. Remember, moving around is always good because sitting is not that great for a long period of time. Also, we've got some safety announcements. Can we please have from the JW Marriott Sahar? We have Vaibhav Chachad, who joins us on stage. Welcome. A loud round of applause. Let's do that every time we have somebody joining us.
Good morning, ladies and gentlemen. Welcome to JW Marriott Mumbai Sahar. My name is Vaibhav Chachad and I am the Loss Prevention Executive. Your safety and security is prime concern to us, and I'm here to brief you on safety and security procedures and what action you need to take in case of an emergency. We have fire alarm and public address system, which is manned 24 hours a day and providing coverage in all areas of the hotel. On hearing fire alarms like hooters or public address system on a fire situation, please don't get panic. You will be assisted by the hotel staff to guide you to the assembly point at the reserve garden, which is to the main entry gate of the hotel. Thank you so much for your kind attention and have a safe conference ahead.
Thank you so much, Vaibhav. All right, well, feeling safe is always priority. And with that, we move forward. Remember, we've got some experiential activities by Step, Set, Go in the lobby. We'll share with you more about that as we move forward today. But remember to spot them and to participate as well. And you will also find a QR code on your delegate badge. We'll, again, move into that during the course of the day, so stay tuned. But now, ladies and gentlemen, we'd like the opportunity to express our heartfelt gratitude to our partner, Step, Set, Go, who have really supported us by joining this movement. If you put your hands together for them, then they can hear it and know that we're going to be joining them during the course of the day. So, without further ado, let's set the ball rolling for the Health and Wellness Summit. As you have heard, Great Place to Work Institute India partnered with HDFC ERGO General Insurance to spearhead the movement of making India a healthy place to work for all and drive the ecosystem to create a change in workplace wellness. So for the opening address, I would now like to welcome on the stage Ms. Preeti Malhotra, Practice Head of the Wellness Practice at Great Place to Work Institute India, to share with us the journey behind the birth of this movement and what inspires our theme for this year's summit. As she walks onto stage, let me share with you that Preeti has been at Great Place to Work for over 11 years. She wears multiple hats and has been practice head for the wellness business. Ladies and gentlemen, please put your hands together as we welcome on the stage Preeti Malhotra.
Thank you, Keisha, and a very, very good morning to all of you. Thank you for joining us. I know some people I was meeting before I walked in and they said I flew in at 7. Some people flew in last night. We have a whole host of people who've logged in. This is a special day. And I just wanted to take a few moments to just share with you how have we planned this day for you. Of course, you would have seen the agenda, the fact that you are here. We all believe in well-being, so I don't think we have to belabor that point. But like Keisha shared, that we realized, and I think at Great Place to Work, we have a little bit of this advantage that data starts showing, right? And this was probably 2017 or 18, that we started seeing that employee well-being was among the top 5 parameters that employees looked at when they said our organization is a great place to work. And then we looked a little further and we realized that there was no one framework which covered well-being holistically. And I'm sure all of us in this room, you are practitioners, you're aware. And we started seeing changes globally, right? The global wellness movement started, the global wellness summit started. Our act of insurance changed in 2017 when they started covering mental health. And all of this, and I'm not going to give any more data, but I think when we look at the numbers at the country level, both for individuals and in our organizations, they're not pretty, right? So Keisha was trying to introduce me saying, I've been here 11 years. My first 7 years were not talking about well-being. So I think the only thing I can say is the last 3 years have been more fulfilling than the first 7 years. Not that the first 7 years were not, sort of, or 7 or 8 rather, were into partnering each of you in creating a great workplace culture. But well-being really sits at the heart of it, yeah? So that's the reason we chose well-being. We decided to start this practice, which was founded with the movement of making India a healthy place to work for all. And we are so, so glad when we found HDFC ERGO with exactly the same thought, right? And for both our organizations, it's really not business. I don't think it adds anything to our top line in that sense, but it is everything for each one of us, right? And that's why the theme. Because this is one thing which is not an option. When we say well-being, well-being is not an option. And I'm sure all of us are like, as we were walking in thinking, did I do this, did I do that? A lot of us create our strategies, follow it by calendar year, some do financial year, and when we talk to companies, sometimes people say, you know what, we are picking this next year. That's not an option. We're already late. And even if we've picked it this year, we can't say, okay, we did well-being last year and next year, you know, we will focus on something else. So that something else can keep getting added, but the only thing that remains consistent, and we have to have it in our strategies, in our personal habits, and it has to be consistent, right? So we can't say, okay, we revamped our technology and we are home for some time till the next upgrade comes, but this is every day. And it's not easy, and I'm not saying we are there yet. I'm personally also a culprit, right? Most of us are reactive when it comes to health. So we thought, what could we do to make it a part of our daily lives, our organizations? When we think of health, it's not that one more thing I have to do. And we designed today with that thought in mind. All our sessions are designed in a manner where at least we start on that journey. So I would really welcome you to indulge. And now that you are here, you know, for some time, forget what's happening at office and take this day for yourselves. And yeah, there are learnings which you'll go back and apply because many of you lead well-being for your own organizations. But use this day today to really see how are you really incorporating it in your own lives, and that's really our effort. So starting maybe right from choosing Keisha, yeah? Many of you would know her as RJ Keisha on her radio shows and all of that. I don't know how many of you know that she's also a health and movement practitioner. She has worked with kids, you know, rescued from human trafficking. She has, you know, helped them deal with trauma through movement therapy. So even when we were choosing our host, we said, you know, it has to be someone who is in the space. So right from our host to the first session, we are so, so delighted to have Dr. Devi Shetty join us for our opening keynote. So every session that you see has come in with a thought. Every corporate leader who will come on stage is a practitioner. They have created a great workplace. And that's the difference in our events, right? This is not like any other event. Anyone who comes up on stage has earned that seat to come on the stage because they have done that. They have created a culture of holistic well-being. So every person who comes and speaks to us today is either an expert in that space or has created this. And the idea is that everyone in the room has also done this in their organization, right? So we'll together learn. We will have enough opportunity in every session to ask questions, to interact, to share our learnings, so that together, when we step out, we are all, richer, not just in knowledge, but something that we can take back and apply. I will take just a few moments to say what have we done, what are the three things that, 3 areas when we looked at the practice. One is for self, right? Well-being is so personal. What works for me may not work for you, and that's why we had that well-being hack for everyone, so that can be what works for each person. For me, it's also coffee, which is not so much well-being, and I was told that the coffee corner is put behind. Unlike most other conferences, the juice bar is ahead because it's a health and well-being conference. So I have to walk up to that corner. But, every little thing was at least thought through. And I'm not saying it's perfect. We would love to have your feedback to let us know what can we do better. So what you see here on the screen is for the organizations, of course, I think many of you have experienced it. There's a framework, but we start with self. So there is a little tool we have on self-assessment. And quite a few thousand people, about 50,000 people have already taken it. They represent, I think, about more than 6 lakh individuals. And that's one QR code that you'll get to apply. I don't want you to take it right away, but the QR code on your table, right, that will take you to the well-being indicator. So it can be a fun thing. It's not heavy. Your individual data is not going in there. I think there is one mandatory field there, which is an age bracket. Again, not to worry about age, but it is just, that was the benchmark we kept. That if I'll touch 50 in a few years. So I'm saying before I do that, how do I compare to my age group? So it's a little self-assessment you can take any time in the day. You can just scan that QR code on your table and see how do you compare. And hopefully, as we go out, if you have picked one habit, you may want to do it again after 6 months and see how we are doing. It is just a nudge for us to really see where are we on our fitness, on our resilience, on our social interactions. And it was very interesting when we ran it. And we saw, especially early pandemic, right? There is one statement which says, I'm able to say no to high pressure demands. And we had people saying, oh, we have an open culture. We want our people to say no. And then we looked at, the leadership team. And even they were struggling. So about 45% people in the leadership team said that I'm able to say no. And that kind of gave an indicator that what would be happening to all the others. So all of us are struggling for our daily, stresses. It could be work, it could be personal, you could be a caregiver. There's just so much happening every day. And while we can get an RPA to take care of some of the systems, we are still not robots, we are humans. And that's why something like this as a nudge really helps us to see where we are and then take those little actions to strengthen, and the QR code on your lanyards, so that you don't have to jump to right now, but that's a permanent thing. It'll take you to a landing page which will have everything that we do today. You will have that at any point of time. You can share it with people who are not in the room, so that anytime you want to take an activity, join us for something, have a thought where you want to collaborate, all of those will be available on that page, and you can keep telling us what we can do together and strengthening the ecosystem. So that's why we've created that. Just 2 more minutes to say some organizations have started their journey, right? So these are the ones in the last couple of years who have been recognized as best workplaces in health and wellness. And we are so sure that there's so many more, right? In the room, outside, online, whom you are logged in. And are we all taking that as a priority and putting that out there? Because now this is top 3 or top 2 actually when employees choose where we want to work next. So are we really taking that center stage? These are some organizations who've started sensitizing their managers. There are many more, but this is just a masterclass we have for wellness champions, and that's a journey that we are taking. Yeah. What we really request you, and our appeal to you today is join the movement. If you didn't see your name out there, I think it just needs to be there. Yeah. Like I said, this is one thing which is not an option. So if you have only limited time and you can do only one thing this year, choose health. Because if that is one thing we choose and spend our time on, then I think everything else follows. And there is enough and more research, ours and more across the world, which tells us that well-being is the lead indicator. So that's my appeal to you today. You are here, indulge yourself, choose health today and every day. Enjoy your day. Thank you. And once again, we are very, very, very delighted that Dr. Devi Shetty is joining us for the opening keynote. And I would like to request our CEO Yashaswini Ramaswamy to just come up on stage and introduce and welcome Dr. Devi Shetty. Thank you.
Yeah, I think this is okay. I'll request you for that. Good morning, everyone. What a wonderful room it is. I think from the stage here, all of us are looking so beautiful. And thank you for joining us today. And Preeti, what a wonderful way to start with the tone and the context that you set for us. So I think for me, I couldn't have had a better person to introduce to all of you. Dr. Devi Shetty is a role model to so many and a personal hero that I look up to personally. So it's my absolute honor and privilege to introduce him. Of course, as cliche goes, he's a man who needs no introduction, but I will be failing in my duty if I don't take this opportunity to welcome him and talk about his journey a bit. Dr. Shetty, thank you so much for joining us today in spite of your schedule.
I simply cannot resist your offer, as you know. Thank you very much for the opportunity.
Thank you, thank you. I know I'm standing between you and Dr. Shetty, so I'm not going to take too much of time, but very, very quickly, Dr. Shetty, as we all know, is an Indian entrepreneur and a cardiac surgeon who's the chairman and founder of Narayana Health, a chain of 21 medical centers in India. He has performed more than 16,000 heart operations. In 2004, he was awarded the Padma Shri, the 4th highest civilian award, followed by the Padma Bhushan in 2012, the 3rd highest civilian award by the Government of India for his contribution to the field of affordable healthcare. A lot of us are addicted to Netflix, and that is an interesting one because there is an episode about his life and the work on Netflix TV series, and it's called The Surgeon's Cut. So if you haven't seen it, please do, and it's wonderful the way they really walk us through his journey. Another interesting fact, he has successfully performed the first neonatal heart surgery in our country way back in 1992 on a 21-day-old baby, Ronnie. In Kolkata, he has also operated on Mother Teresa after she had a heart attack and subsequently served her as a personal physician. He is walking history, ladies and gentlemen. In 2009, the Wall Street Journal newspaper described him as the Henry Ford of heart surgery. Another scheme which is very historic to our country and close to my heart, the Yashaswini scheme, was introduced. It is a low-cost health insurance scheme designed by Dr. Shetty and the government of Karnataka for the poor farmers of our state, and currently it serves about 4 million people. I know there is a limitation of time. I could go on, but I'm very mindful of this space that I'm occupying. And may I request everybody in this room and everybody who's joined us virtually, may I please request you to stand up and give this gentleman the honor that he deserves, that he's made our country so proud.
Thanks. Thanks, Yashaswini. Thank you.
Thank you, Dr. Shetty, and over to you.
Thank you. Thanks. Since you are waiting to hear from a heart specialist, it is natural that you would expect me to talk about your health more important than anything else. So let me not disappoint you and address some of the vital information all of us must have about our own health. Now, in the last few years, since the rapid emergence of social media and the cyber news and news coming from all over, all sorts of sources available in your phone, one thing which gives a jolt to everyone, especially the middle-aged people, the aggressive entrepreneurs, is the news of young, fit bodybuilders with the six-packs, celebrities suddenly dying in the gym or during the performance or at the place of work. So-called sudden heart attack. And then again there is a debate which goes on and on for a few days, and as usual this is forgotten. Now, as a doctor, I make it a point to emphasize that there is nothing called sudden heart attack. All these celebrities, all these gym trainers, all these people, successful entrepreneurs, suddenly die a premature death. It is not a sudden cardiac arrest. If only they went through a proper checkup 10 years earlier, their death could have been predicted. It is known that if they ignore their health, they will land in trouble. Unfortunately, we Indians always feel that if I feel fit, I am a fit person. The reality is not the case. It doesn't, how you feel about your fitness has nothing to do with how fit you are. You may stand in front of me and say that, look, Doc, I climbed Mount Everest 3 times in 1 month. I am a fit person. I will definitely congratulate you. But I will tell him or her that if you want me to tell you that you are a fit person, you must produce your blood test report, and I want a ECG, I want an echocardiogram, I want a CT scan report of your heart and an ultrasound of your stomach. I want these 5 tests. If you show me those test reports, I will certify that you are a fit person. Otherwise, for me, without those tests at your age, if you are 40, 35, 50, whatever, everyone is an unfit person unless proven otherwise. Why why I am so confident in making the statement? I'm confident because it is the number of young, fit people who come for heart surgery, angioplasty, is unbelievable. It is like an epidemic of heart problems. Why this is happening? One reason could be we are genetically 3 times more vulnerable for heart disease than Caucasians. The second reason is that we develop heart attack a decade earlier than our counterparts in other parts of the world. When I used to work in England, most of my patients who underwent bypass grafting were old retired people. In India, it is not the case. In my practice, it is not the young son bringing his old father for a heart operation. It is the old father bringing the young son for a bypass grafting. It is ironic. So I'm not trying to scare you or spoil your day early morning talking about this, but this is the reality. But there is a solution. The solution is most of the heart attacks can be prevented. Most of the heart diseases can be postponed. And most people with the heart disease can lead a virtually normal life with some restrictions on the diet and the lifestyle. And they celebrate their 70th or 80th birthday peacefully, provided they understand the problem. The basic understanding all of you must have is that more than 50% of the heart patients who undergo heart operation or angioplasty or any of those, they never had symptoms. This is called silent ischemia, which leads to silent heart attack. So this is the reason why we emphasize that just because you are feeling fit, that doesn't mean you are fit. Now, what you need to do, everyone past the age of 30, whether they like it or not, must undergo these 5 tests I spoke about. 10, 15 years ago, we didn't have tools to diagnose 5%, 10% blockages in the coronary arteries. Today, we have phenomenal tools. We can pick up early heart disease 10 years ahead. And when you detect it at their stage, some minor modification in your lifestyle, these diseases can be virtually prevented from progressing. So the message I'm giving it to all of you is that please go for a health checkup. See the doctors when you don't need to see the doctors. I do get large number of people in their 50s and 60s sitting in front of me with a completely damaged heart. And they make a very bold statement or a very, very proud statement that, Doc, I'm now 60 years old. I never saw a doctor in my life. Please do not consider it as a badge of honor for not seeing a doctor. So it is very important that everyone, irrespective of how fit you are, go for a preventive checkup. Now, next advice I have for all of you, or you may like to ask me, what is the ideal diet? You don't need to make major drastic changes in your diet. One question which most of you want to know is, which is the best oil? Is it olive oil better or a coconut oil, whatever? My message to all of you is that all oils are bad. There is nothing to choose from. Some oils appear to be good based on their marketing budget. So restrict the intake of oil and take whatever oil you like the taste, but restrict the quantity. The red meat is uniformly shown to be bad, and cigarette, tobacco in any format is definitely proven that it is bad for your heart. So this is something you should avoid. And I recommend all of you to practice yoga. Yoga is the best gift given by God to this world. Let me talk about my personal experience. I used to be a bodybuilder and I used to be a very strong proponent of martial art. Around 10 years ago, I started developing pain in my knee, and my wife asked me to go for the yoga exercise through her yoga teacher. And I just laughed at her, saying that, look, I'm a fit person with big muscles, and why will I go for the yoga? It's not meant for me. But the pain went on for more than 6 months to 1 year. Then as a surgeon, I need to stand for 8 hours, 10 hours. So I just couldn't control it. Finally, I consulted a yoga teacher, and he started teaching me yoga exercises. Within I think less than 2 months or 3 months, the pain in my knee disappeared. And today, if you ask me which knee was hurting me, I have forgotten. And I can quote number of instances in my life and in my family members and my patients. Yoga is something, if you really want to be celebrating your 80th birthday without a wheelchair, one of the definite route to go is through yoga. And I recommend all of you to wear a smart watch like me. You can watch any watch, wear any watch, and count the number of steps. That will give you a kind of an indication about how physically active you are. Whenever it is possible for you to stand in front of sitting, stand and work, do your work. If you can walk instead of standing, walk. Instead of walking, if you can climb, you climb. And whenever you take a call, mobile, you spend a lot of time on your mobile phone, have a earphone and start walking. You will be surprised at the number of steps you can take when you're walking. So essentially, try to be on your feet most of the time, and lead a very, very active life, physically active life. And to remain fit and healthy, most important thing what you need to do is to be spiritual. It is very, very important for all of us to be spiritual, because life is very tough. There are no certainties in whatever we do. I'm not saying you need to be religious, but be spiritual. Always believe that there is someone up there who is going to take care of us, and he will ensure that we are protected. That is a very, very strong source for keeping the sanity and keep going and enjoying the life. This is one simple advice I have for all of you. And I would like to end with a good news. The good news is that India is going to be the first country in the world to dissociate healthcare from affluence. India will prove to the world that the wealth of the nation has nothing to do with the quality of healthcare its citizens can enjoy. And India will do it within the next 5 to 7 years. I know it is an unbelievable prediction, as people in business, you know how the world runs. When countries like US, countries like in Europe are struggling to offer healthcare to the citizens, how a country like India with 1.3 billion population can do it. We can do it because we are 1.3 billion people. We produce 24 million babies a year. We produce the largest number of doctors in the world. And most of the doctors we produce are not ordinary doctors. Indian doctors are recognized across the world as some of the best doctors. There was a study conducted by Harvard Medical School, which did a survey of Americans, and they clearly showed that Americans who are taken care by expat doctors, mainly Indians, lived longer than the Americans who are taken care by American doctors. So we have proven as how good doctors we are. And we produce one of the largest number of nurses in the world. We produce over 2 lakh nurses every year. We produce largest number of the medical technicians in the world. We are the pharmacy for the world. We have all the ingredients for delivering a phenomenal healthcare. But why that is not happening? It is not happening because government is covering the BPL card holders. Genuinely poor people are under the care by the government. And the rich people go for the health insurance, or they can afford to pay for it. There is about 300 million missing middle who do not have the they are not eligible for the BPL scheme.
Dr. Shetty, actually the sounds just paused for a second.
Sorry, sorry.
Thank you.
The missing middle will have a affordable health insurance.
Dr. Shetty, could we request you to go back a little about a few seconds ago, where you were talking about that India had the maximum number of nurses and we have access to the best healthcare. Thank you.
Okay. Thank you. So in healthcare is essentially delivered by people, and we train those people in very large numbers. So we don't need to depend on other countries for doctors, nurses, and technicians. Now, our biggest problem was the missing middle, about 300 million people who do not have the health insurance. And they're not eligible for the government health schemes. So it is a matter of time before a health insurance will appear for the missing middle, because government is very keen to promote this health insurance. This insurance will bring about the similar transformation what we have seen in mobile communication. Today, we all use mobile phone without really bothering about how much it costs. It is so inexpensive. Why it is so inexpensive? Because more than 900 million Indians are using the mobile phone. And today people are spending 400 to 500 rupees per month just to speak on the mobile phone. If they can spend a similar amount of money for the healthcare, we will be able to cover the entire population. And this transformation will happen much, much faster than what we think it will take. Because this is a very amazing country where magical things happen in an amazing speed. We have gone from no radio to color TVs with a few hundred channels in less than 30 years. We have gone from no phone to the most modern mobile phone in less than 20 years. So this is a country which defies all the logics and show that a lot of amazing things can happen in an amazing short duration of time. So this is the possibility, and we are privileged to be living in this great country, and I'm extremely grateful to you for giving me the opportunity. Thank you.
Thank you so much, Dr. Devi Shetty. Sir, with your permission, can we open the floor to 1 or 2 questions, if time permitting?
Yeah, I'm okay with 2 questions.
Appreciate it. Thank you. So we're coming across to you. Raise your hand, time permitting. We've got to make the most of every single second. Yes, we've got a question. Can you?
Maybe a bit direct question, sir, but most of us are really scared to go to doctor because nowadays the hospitals have become commercial centers and we really don't know we are really sick or they want to make money and achieve their targets. How do we ensure that we are actually being consulting to the right person and we are being advised to take the right care?
My advice for all of you is that in every aspect of your life, you take second opinion and third opinion. You first talk to your friends, then the relatives and professionals. Same thing, if you are advised to undergo a procedure, as long as it's not an emergency procedure, please get the second or a third opinion. Today, you can consult the best doctors in the country from your bedroom, from your drawing room, with your mobile phone. And this is possible. And do not hesitate in getting the second and third opinion. And feel free to ask any questions you want. And today, Google does give you some advice. May not be all the advisors are right. You can go through all the sites. And if you have a medical illness, do not behave like your grandparents. Today, information about every disease is available in internet, and you are smart enough to understand and ask the right questions. Do not have any hesitation in asking the questions to the doctors. And if the doctors do not answer your question, there are doctors who will be available in your own city who will answer your questions.
One final question.
Very good morning, Dr. Sir. Thank you for giving experts insights on a lot of things we believed that were true, because I personally am amongst the lot of people who never see doctor unless and until we have some symptoms, and we used to feel very proud of it. Now, I mean, traditionally we have been told that unless, if you feel something, then only see the doctor. So why you suggest this change of this thing? Is it due to the changing lifestyle, eating habits, or what it is? Thank you.
Thanks. See, when we got the independence, our life expectancy was about 40 years, late 40s. Today it is 72 or 73 years. How do you think all this happened? This happened because of the amazing things what healthcare can do. And the greatest handicap of healthcare provider is the delayed presentation by the disease, by anybody with the disease. I can give you hundreds of examples. People come for routine examination and we find a early stage cancer in the kidney. And they undergo surgery and in 3 days they are out of the hospital, they are cured. Same patient comes to you after 1 year. With all the cancer would have spread to the brain and the liver and all over the place. It is too late. Then you may spend millions of dollars. See, I understand that you go to a doctor, doctor may find something. It is better they find something in you at an early stage than later. So it is very, very important that we detect the disease at an early stage. That is the reason, because if the disease is detected early, it can be cured. If it can't be cured, we can at least postpone give you a good quality life for whatever years left. So this is the advantage of a early detection. About the hospitals exploiting the patients, I understand the concern, and you may be right sometime, but the scenario is going to dramatically change. The insurance what I am talking about is going to be not the traditional health insurance. It is going to be managed care. Managed care is a different concept of health insurance, which is practiced by Kaiser Permanente in US, which is one of the largest managed care providers. Essentially, the hospitals will become the health insurance entity, and they will collect a premium from you at the beginning. and they work very, very hard for 365 days to make sure that you don't fall sick. Because if you fall sick, they lose the money. And they have an interest in ensuring that you're fit. Then your interest is aligned with the hospital's interest. Then they will not do unnecessary procedures, because if they do the procedure, they're going to lose money. So unless the interest of the hospital and the doctors are aligned with your interest, we will always have this conflict of interest. Thank you.
This was amazing. Thank you so much. The applause is loud, and we come forward with much appreciation. So thank you very much for investing this time in us today. Thank you. Ladies and gentlemen, Dr. Devi Prasad Shetty.
Thank you. Thank you.
Well, I think all of us just need to take a deep breath in. That was so much to assimilate. Put down your points, because you know, after a session like that, you need to know that, you know, we've all been advised to not be reactive, but be responsive when it comes to our health and wellness. So I can see a lot of people putting down notes, and I'm hoping, you know, that's the step you're going to take forward to make sure that we keep checking up on where we're at in our health and wellness. So after that amazing keynote address, we'd also like you to very quickly note down that another thing that you could do is also take the wellness indicator test that Preeti Malhotra shared about earlier in her session. And so all of you, make sure that you go ahead, scan the QR code, and which is on your table, and take that wellness indicator test. Okay, well, kind of stressing on wellness is no single person or employer's responsibility. It demands collective action and accountability. So as one group, let's get and move forward to a, you know, to a future where we are healthier and feeling better in mind and body. So with that same thought in mind, the famous author Helen Keller once said, "Alone we can do little, together we can do so much." This quote has stood the test of time forever and still holds relevance today. So one of the statements from our Workplace Wellness Index is, leadership management admits their mistakes. Leaders are key levers for driving change in an organization, and we see that when leaders are vulnerable and honest to admit their mistakes, it creates a sense of psychological safety in the workplace. Yes, nod if you agree with that, right? So in the journey of creating this ecosystem around overall well-being, many organizations have suffered by putting health and wellness on the back burner. And what has resulted is lower employee productivity and in turn, lower sustained business performance. So back in 2020, Great Place to Work India realized that well-being can no longer be a choice for employers. It has to be a community-driven effort. This led to the launch of India's only public study in workplace wellness. And now, HDFC, ERGO and Great Place to Work India has joined hands to fuel this movement. So we are inspired by the commitment of HDFC ERGO's leadership team to genuinely make a difference in the lives of their employees, customers, and all their stakeholders. We truly believe that this partnership will enable us to enhance the reach and amplify the impact that this movement intends to make. So now, ladies and gentlemen, before we welcome our leaders onto stage, I think it's time for a quick AV. Let's take a look.
As the world succumbed to the COVID-19 pandemic, workplaces too suffered. The tremors of fear and helplessness were such that its effects would resonate among us for decades. We will never be able to recover from the losses completely. While many companies had counter strategies in place and prioritized health and safety of their employees, many failed to cope with the chaos and were caught unprepared. The challenges we met expose that we take normality for granted and that we should be prepared for the future. This is where we realized that a strong primary health care is essential for all. Learning from the lessons of the past, HDFC ERGO takes great pride to announce a unique initiative in partnership with Great Place to Work India that spearheads the movement of making India a healthy place to work for all. Together with industry leaders and community members who will commence a dialogue that would facilitate continued progress and change with various enablers that would be implemented in due course through a collective effort of the formed community. Wellness Index Benchmark, a comprehensive research-based framework for organizations to create a culture of holistic well-being. Well-being Indicator, a self-assessment tool for individuals so that they could take ownership of their own well-being, and an ecosystem that would recognize and steer best practices among companies to ensure health and wellness in workplaces. We appeal you to join hands with us and be a part of the annual research conducted by Great Place to Work India. This would help us achieve the momentous task of creating a culture of well-being, share and exchange best practices, interact with health and wellness experts, access to benefits for self and family, and contributing to the larger community. So join us in our quest to shape and transform the workplace landscape of India. Let's make India a healthy place to work. Let's make India future ready.
I think we're definitely on track with that one. You know, ladies and gentlemen, what say we kind of take Dr. Devi Shetty's words slightly seriously right now. And everybody, let's start moving. So just 10 steps around your table. Everybody stand up before we welcome our leaders onto stage. Walk around your table. I'm going to count down. 10, 9, move from your place. 8, 7, 6, yes, move around, say hi to whoever you make eye contact with. You can reach out, you can say hi as well. Shake hands, I can see that. That's always great. We've done a few more than 10 seconds. That's great. Last 5, 4, 3, 2, 1. We're loving the smiles and we're loving the fact that people have moved away from their table. That's always good. Come on back to your seats, ladies and gentlemen. We're collecting our steps, and remember, we've got Step Set Go. We'll talk about that a little later today. But right now for our next session, I would like to invite onto stage Yashaswini Ramaswamy, CEO of Great Place to Work Institute India, and Anuj Tyagi, Deputy Managing Director, HDFC ERGO, to help us understand how the power of a community can be instrumental in making India a healthy place to work for all. So as our speakers join us on stage, allow me to share with you a brief introduction. Welcome on the stage. Yashaswini is recognized as one of India's leading serial entrepreneurs. She combines deep expertise in organizational behavior, artificial intelligence, and investment management to bring analytical rigor to business transformation projects. She represented India in the Fortune Most Powerful Women program and received the Times Power Women Award for excellence in entrepreneurship. Please welcome her onto stage. Thank you for joining us. And Anuj hails from a science background with a specialization in chemistry and a PG diploma in business management. He has about 22 years of work experience in insurance and banking and joined HDFC ERGO in 2008 as head of the corporate business group. He was appointed as a whole-time director, designated as executive director and CBO of the company in May 2016, and has been designated as the deputy managing director since April 2021. Please put your hands together and welcome on the stage Anuj. We've got our leaders on stage, Yashaswini and Anuj. We're inviting you to take this session forward. We're all looking forward.
Hi, can you hear?
Can you hear us?
Yeah, okay.
Thank you. Hi, Yashaswini, how are you?
Great. Let me just shift
Where have
the
you
chair
been?
a bit.
Yeah, she's already going away from me. I'm going to ask you a lot of questions. I'm seeing you after a long, long time. Where have you been?
Where have I been? Well, I think one interesting data is I'm based out of Bangalore, like you know.
Right.
And I've been in Bangalore, I think, for about 10, 11 days since the 25th of September.
Really?
Yeah, so been traveling.
कहाँ थे?
कहाँ नहीं थे?
हाँ तो बताओ ना.
So I think the last couple of months have been so interesting. I think traveled US, London, India, multiple countries. But I think everywhere that I go, people are just so happy to be back in the room like this. We're welcoming each other. There is a term called revenge travel that we're getting to hear. But there's a lot of talk on well-being. But enough about me. What about you? Aap kahan the? And you know, it has taken us this stage for us to meet. And have this conversation.
I've been here. Obviously, you know, as you rightly said, the revenge travel has come back, and when you look around, the world has changed. People have become more anxious about you know, how healthy they are. Yeah. But unfortunately, this is where it stops, right? People keep talking about, I don't know, the new terminologies that we hear: brain fog, COVID fog, long COVID, short COVID. But honestly, this is where it stops, right? So yeah, I've been pretty much part of this. I'm still an insurer, as you last know. But enough of it. So since you've been traveling and you know, post-COVID, you've spent, you've been to so many countries.
Yeah.
I think for our benefit, what has changed around us? Do you see a huge mental change? What really are those noticeable changes in the world?
I think that's a great question. I think everything has changed. And I think a lot of you will also agree with me, Anuj, is some things have changed permanently. I think just look at the event that we're having today, right? So say 3 years ago, we'd say that we will have an event which is phygital, which is physical and digital audience. I don't think we would have even accepted it. I think we've become more complex as a society. This hyper-connectedness has created a sense of urgency. I think a lot of data that we're collecting at the Institute tell us that issues around employee burnout, issues around mental health, issues around just well-being, whether it's physical, spiritual. I think what Dr. Devi Shetty said was brilliant, right? That we feel we're fit, but actually are we fit? So I think the demands of the job are here. There's a lot of stuff that we're trying to learn and implement as we go along, because the so-called new normal as we know it is new. So I think as leaders we're trying to define what a healthy workplace should be in this new normal. The hybrid work environment is here to stay. You know, we've also navigated conversations around the great resignation. And the resilience in us has made it into a great reset. So the mind is always working, we're always on the go. I think expectations of each of us has increased. If you look at the quarter results, Anuj, the businesses are performing well. Our financial results are good. So there's something beautifully happening, especially in India. I know I travel the world, but if I come back to India, the sense of communityship, the sense of belongingness, the sense to maybe jugaad, I don't know, but just get things done. I think I just love the way the Indian workforce has come together. And let me just throw that back to you, Anuj.
Oh, really?
You, you won't have it easy.
I thought I'm the one who's going to ask
No,
the
you won't have it
questions,
easy. You manage more than 10,000 employees day in and day out. And for you to be a role model, I mean, it's tough. How has it been for you?
Well, role model, I don't know. It is tough. And, you know, you said one thing very beautifully, that the businesses are growing post-COVID.
Yes.
India is the shining star across the world. And businesses are not growing because the economy is growing. Businesses or economy would grow because people by and large are feeling connected to the businesses. And one of the very perceptible changes that I've noticed now in businesses, at least in our organization and the ecosystem that we operate in, that the organizations have started coming forward and have started feeling for the employees, have started feeling for the larger ecosystem. So, you know, it was, you know, at least in HDFC ERGO, we've always been very passionate about the health and well-being of our employees.
Yeah.
We actually didn't realize that it could be further extended to a larger ecosystem. So we work with close to 170,000 advisors who sell our businesses. We work with a larger set of partnerships. We've actually extended the health and wellness to these people, right? So during COVID, or when we emerged out of COVID, we realized that it's our responsibility to also not only take care of our employees, but also take care of the larger set of people who work with us. So how do you disseminate information? How do you make people aware of how to stay healthy, and how staying healthy is directly proportional to whatever is your definition of flourishing?
Yeah.
It's not easy, right? Because everybody in the group, everybody in the leadership across the world does it, says it, practicing it, standing in front of the people and showing that you actually do it, ensuring that it becomes part of your core responsibility. That's where the difficult part is. और उसके लिए करना पड़ता है, मेहनत करनी पड़ती है. So, you know, I make it a point that, and it's very personal, right? I'm not saying that it works, but I make it a point that the diet that I'm on, it gets at least propagated in the organization through a word of mouth. Right or wrong, the workout that I'm doing it gets propagated in the organization. And I just hope that at least 10 people will see me doing something, and you know, it'll catch on. So I find it very interesting when, you know, hundreds and hundreds of my advisors out of this 170,000 pool will come and say to me, "Acha sir, aap next mountain kaun sa chadhne ja rahe hain?"
Oh, wow.
Now it makes me very happy that people are asking me, and it gives me a moment to talk about the next mountain I'm climbing. But what makes me extremely happy is that these people at least know that there is somebody who's extremely, you know, passionate about the fitness, and then they'll ask you, "Sir, मैं mountain तो नहीं चढ़ सकता." तो I said, flat की सीढ़ियाँ तो चढ़ सकता है, apartment की सीढ़ियाँ तो चढ़ सकता है. तो that's what I'm doing, and let's see if it helps.
No, I don't know, but ladies and gentlemen, I must admit, the first time when I met Anuj, we don't know each other since Adam, but I think we hit it off so well, and simply because he role models it. In fact, I remember coming away from the meeting saying, "Oh my God, this man is fit. And, you know, I need to do something about it." And you know what Dr. Devi Shetty said again, right? That if you can sit, stand. If you can stand, walk. If you can walk, climb. And if you can climb, run.
Yeah.
I don't know.
So this reminds me, you know, there are few things you read and hear which leaves a very lasting impression in your mind. Everybody knows, and healthy mind stays in healthy body, and all this, that, and the other. Two things I remember very specifically, that for us to stay happy in life, it's a sequence. A healthy body, so physical fitness, mental fitness, emotional fitness, and then comes the financial fitness. So if you have to achieve financial fitness, you have to go through this CD, right? So we don't, I mean, we read it, but we don't practice this. And, you know, talking of practitioners, I remember, you know, I'm reading, I just finished Dr. Mandela's autobiography. I mean, the more you read about him, more you realize that we're nobody. These are one of the greatest people that the planet Earth has seen. And what really stands out, that this man was in prison in prime of his life for 27 years.
Yes.
And 27 years he used to work out in his cell. And somebody asked him, "Dr. Mandela, you don't even get food." This was the apartheid, right? At its peak, you don't even get food, but you work out. He says, "If I have to fight for my country, I need to have a healthy mind. And for me to have a healthy mind, I need to have a healthy body. I would work out." We don't realize it. हम सिर्फ बातें करते रह जाते हैं. So that's where.
No, absolutely. And I think we've seen that. I think there is a lot of talk also. I think Preeti in her introductory address said that nowadays there's a lot of awareness. Even when employees have to join a particular organization, you'll be surprised at the number of questions we get at the interview on what is your policy around wellness, what is your policy around work-life balance. And I think the pandemic has done that with us. I mean, if I talk about me, we had an unfortunate death in my family. during the second wave, and if a lot of us remember, the second wave was tragic. And you know, these kind of instances, it really makes you reflect and think about priorities of life, you know, whether our life should be about this quarter and quarter run on the treadmill, whether that employee of the month, employee of the quarter award really, you know, so I think we have seen that even from a psychology, from an organization behavior standpoint, that a lot of us have actually during the pandemic and post that taken a step back to evaluate some of our priorities, and absolutely there is no doubt that health is center stage, and if there is one choice that we need to make, it is about health and well-being.
Sure.
And if you want to translate that into a workplace, I mean, we're 1.35 billion people, and we heard about the 30 million, the missing middle. The missing middle. And we are talking about making India a healthy place to work for all. That's our vision. How does that translate to you? What do you see in the area of insurance, some of the creativity and innovation panning out? How do you think your organization can actually support and innovate in a space like this?
Yeah, so let me just answer it in two parts, Yashashwini, and that's a great question. There is a lot of innovation happening in the insurance world,
Okay.
right? The 30 million missing middle, the insurance companies, 300 million missing middle, 30 crore missing middle, the insurance companies as well as the providers are already racking their brains on a regular basis. How do you bring them in? But before that, the below poverty line citizens of the country which are covered by various insurance schemes, it's a clear testimony that the insurance industry at a large is truly committed to ensuring that no financial bankruptcy in any family happens because of lack of insurance. I personally believe that the financial inclusion in the country can never be completed only with a bank account unless there is also a parallel insurance scheme standing with it, right? Because that's where, I mean, it's a world data that maximum family bankruptcies happen because of lack of medical insurance specifically. So the industry is committed. I mean, it is today the largest product segment as far as the general insurance industry of, it should be about 250,000 crore this year. It's the largest segment. And we clearly are, I mean, we are one of the largest health insurance companies, retail health insurance companies in the country. We're committed to it. And more innovation will happen. We've actually taken a step forward, Yashashwini, and this takes us to why this initiative and how did we kind of the two organizations came together. We realized that as insurance companies, our job, our responsibility is actually beyond products. Have I tried to become a part of your daily life? Have I become an entity where you think of me on a regular basis? So when you're buying health insurance from me, you're not only buying health insurance, you're also expecting me to be a part of your wellness journey, right? So that has been the objective of the organization. How do we stretch it a step forward and possibly become one of the only insurance companies, one of the few insurance companies in the world where you'll think of me every day. You don't think of an insurance company at 6 a.m. every day, right? Hopefully you will think someday. जो हम कर रहे हैं. तो हमें लगा हम क्या करें इसके लिए. The other thing is personally it has pained us a great lot when the families attribute our stress to our workplace. I think to us as leader, it's a matter of shame. The families do not attribute workplaces to the happiness, but families will certainly attribute the workplace to the stress and the heart illnesses that our citizens are feeling. So we've been talking about it, we've been thinking about it, कि हम क्या करें, कैसे करें, how do we create? तो हमने सबसे पहले, you practice what you preach. So we started a massive program in the organization where we made it almost mandatory for all our employees to go for a medical checkup. Right. Dr. Shetty said it, right? We have, initially the take-up rate was very low, and it's obviously, it's pretty expensive, but that's a budget the organization has never cut on. We would want, and it's a 10,000 plus people organization, including the families, a large part of universe gets medically checked every year. Initially, it was an organization's exercise being done, people would come, people would not come. Slowly and slowly, we as leaders took it as part of our KPI कि भाई आपकी टीम में लोग जा रहे हैं कि नहीं जा रहे हैं. And guess what? Every year, and I don't feel happy when I say this, but I also feel very happy because that the timely interventions happen every year. There are multiple cases of the so-called healthy people that Dr. Shetty spoke about, young healthy people who get diagnosed well in time of something which could have been supercritical. And the organization then intervenes because then you have a mechanism to address this. So we've realized we've formed it more as a muhim, more as a initiative, evolution. I mean, more as a complete initiative in the organization कि भाई हर आदमी को ये कराना है. When we were doing it, we realized that the same problem every corporate in the country is grappling with.
Sure.
And that's when the two of us, the two organizations kind of gotten together. And so
I think it was a no-brainer for me personally, Anuj, when both of our organizations came together. I think, see, at the end of the day, there needs to be a sense of purpose. There needs to be a sense of being. And for us to truly today, in today's times, say that we are a great place to work, we cannot ignore well-being. I mean, the whole macro environment, whether we become digital, whether there is fatigue in the system, or whether we're now suddenly hyper-connected and global, you know, the intercultural complexities. So I think I'm personally very excited that both of our organizations shook the hand. This is a first step, and this room and the people joining us virtually, I think, is a testimony to us, I think, probably taking the first step. And I hope this movement only grows, and we are seeing so many innovative practices. Again, if you look at the India thread, a lot of the leaders have actually come out, and this is the era that I call of communityship and authentic leadership. And authentic leadership is practicing honesty minus self-righteousness plus vulnerability. And a lot of the employees today are looking up to their leaders as role models to practice authentic leadership. You know, there are sessions about Ask Me Anything, where you actually have no agenda and you encourage your employees. I think a lot of the best workplaces that we recognize at the Institute, they have such creative programs. The whole dialogue about wellness leave, about EAPs, about being there for the employee, about also encouraging them to help build a psychologically safe environment. I think we're seeing all of this, and I think our partnership is probably needed and maybe a little late, because I was thinking we should have probably started this a little earlier, but I'm just hoping that this becomes bigger.
No, absolutely. The beginning has happened, Yashashwini, and our, as you rightly said, it's just it's the first step in that direction.
Yes.
And you appropriately, choose the word movement. It is a movement, and this movement will not be complete unless the leadership team in the room, the leadership team watching us online, and a larger set of people who've still not been associated with this movement, they take this pledge, they take this all upon themselves to ensure that the employee health and wellness becomes a very supercritical part of our KPIs,
yes,
along with those financial ratios that have become, or the other ratios that have become part of our KPI. The employee fitness health ratio should also become a part of our KPI, and we would only request the larger audience, the larger set of people to come join us. And I am sure all of us leaders will be very happy going back home when our families will associate health and happiness with the workplace, not only the stress with the workplace. This is our request.
Yeah, absolutely.
Let's just hope it turns true.
Absolutely. And some of us in the rooms that we have these meetings, these radical thoughts come up, right? Why does the company declare balance sheets and profits? Can we also declare the health index of your organization, and can that be a measurement for you to be a truly great workplace? I think I'm going to conclude probably with a few ideas, and then I'll throw it back to you, Anuj. I personally believe at the Institute, and all of us, we call ourselves Graters, we believe that every organization that is coming forward to be certified as a great workplace is also contributing to nation building. You know, I don't want to sound like a politician, but I certainly feel that if the employers today are more mindful, they are more responsible, and they are taking the initiative on improving mental health, on improving well-being. Our employees are also citizens of the country, and we are such a young nation, and the aspirations of us as a country is so high. There are talks about us being the third world largest economy and so on and so forth. So I think as a country we're so future ready. So I think while we say it is the C-suite that needs to walk the talk, I think it's probably the responsibility of all of us here in this room and those joining us virtually. I don't know where to look at them. I'll maybe look at the camera and say hi. But I think it's everybody's responsibility to take that oath, to say that we will be healthy, not only for our families, but for the society and for our country, because it is us, to this generation, to make that change happen. Any concluding thoughts?
No,
Anuj, on that?
absolutely. You've already concluded, Yashashwini, but at the cost of
He's such a
repetition,
gentleman, right? He's saying you already concluded.
at the cost of repetition, it is our collective responsibility to ensure that people in our area of influence, and look, this set of people, they have a very large area of sphere of influence. Yeah, you are the leaders. As much as we propagate the importance of health and wellness, it is truly the nation building. We all hear, you know, greats like Dr. Shetty on a regular basis, but the reality of life is that you also need people next door who you idolize, who you try to emulate on a regular basis. So if we all can be those set of people next door who will stay healthy, will ensure that we create a very healthy atmosphere around around us, the organizations will flourish, the businesses will flourish, the nation will flourish. And I don't even bring in the whole element of studies being done that healthy workforce leads to productivity going up and the profit. I don't even want to bring that in, because that automatically comes in. The movement will only be successful if we all realize that it's our responsibility, it's our duty to ensure that we provide a healthy workplace to people around us. So to all the policymakers in the organization, that's our request.
Absolutely.
That's our humble submission. But practice before we preach. Thank you.
Yeah. Thank you, ladies and gentlemen. And yes.
Thank you so much. You know, you've kind of made sure that the responsibility you're showing us, that it starts out here, but everybody in the room kind of joins you in realizing that this movement can't stop and on the stage, but goes out into the room as well. So everybody, please put your hands together as we thank Yashaswini, Anuj. You know, there was such gentleness in the way that you all shared this vision with us, but I know that we're all empowered. So thank you very much. Also stepping forward, do we have a launch of that we're all looking forward to? So everybody, you know, we had the clap that we did together where we said health and wellness. Everybody knows that? So this is the last time we'll do the clap, because from health and wellness, we're going to be seeing something else right now. So on the count of 3, this is how it goes for everybody who joined us a little late. And on stage as well, our presenters, can you please help us? So it goes like this: 1, 2, 1. So everybody start clapping with me. 1, 2. Health and wellness, all right? So that sounds so simple, but we're going to do it one more time, and we're all going to raise our voices, because that's what we're heading towards, right? Health and wellness, but the unfolding will happen on stage right now. So everybody on the count of 3 then. 3, 2, 1, go!
Health and wellness.
We love it. It was like this. Thank you so much. The wellness confluence. So when I say wellness, you say confluence. Wellness? Much louder. When you say wellness, I say confluence. Well, confluence. All right, let's build it up, because when a movement starts out, it starts out slow, it starts out gently, but we build it up together. So, you know, all of us do acknowledge that there's been this gap between intent and action that has to be bridged by creating a healthy workplace. So thank you, Yashaswini and Anuj, for motivating each one of us to solidify our commitment to creating healthy workplaces. And as I look around, we're heading towards a healthier community. So the question I want to pose to you right now, to all of us in the audience, is, are we too late, or it's never too late to embark on this journey? So we'll move on to our next session, but before that, I'm going to request you to, everybody's got an agenda on your table. Please pick up the agenda, turn it around, there's a QR code, scan it. Go ahead, scan it right now. And quickly, get your cell phones out. I'm hoping they're on silent. Scan your QR code. And once you do, everybody scanned it? Once you do, you can give feedback for the first two sessions that happened today, the one with Dr. Devi Prasad Shetty and the one that happened right now, the unfolding where we, you know, had this stepping forward into the movement with Yashaswini and Anuj. So everybody, while you're going to go ahead and give your feedback, we're going to hold you to that, we move on. And we have a quick poll coming your way. Everybody, I know you're busy with giving the feedback right now, so maybe I'll give you a couple of seconds to do that. Everybody, eyes on screen. That's a first when it comes to audience, where we saying, okay, look down at your phones. All right, last 5, 4, 3, 2, 1. And quickly, you know, we've been talking about lifestyle, we've been talking about health. We want to ask you, thumbs up, thumbs okay, or thumbs down, if you think that drinking water is very, very important. The amount of water you consume, is it very important, or is it okay? Thumbs up, thumbs side, or thumbs down? Big thumbs up. So everybody, open up the bottle of water in front of you right now. Open it up, pour a little bit into the glass, and take a sip. Take a couple of mindful sips quickly. We want to truly enjoy every single part of this session here today. A mindful sip, enjoy that sip of water, and keep remembering to consume water right through the day. Well, as we move forward right now with that poll being completed, remember the QR code behind the agenda allows you to give feedback for every single session, and we want you to participate, to do that, to give your feedback. So moving on, when we talk about co-creating a well-being ecosystem at our workplaces, we cannot undermine the importance of leaders who take initiative and accountability. In organizations with a top-down approach, employees often look up to their leaders for inspiration. And it's up to these leaders to take charge and drive change. When it comes to wellness, such initiatives are bound to fail if teams work in silos. As our speakers said in the earlier sessions, wellness is no single individual or team's responsibility. Today, wellness is as strategic and objective for leaders as revenue and profitability. There is a need for leaders to build a culture of holistic well-being and to spread the well-being movement not just across their workplace, but also beyond organizational boundaries. So ladies and gentlemen, if you are ready right now to elaborate on how leadership matters in designing this culture, I would like to invite onto stage Dr. Rahul Kalia, Head of Health, Wellness and Medical Services at Bosch India, Charu Thapar, Executive Director, Property and Asset Management, APAC at JLL, and Manish Gupta, CEO and Founder at Indigens. While Rahul and Charu join us on stage, Manish will join us virtually. Now, this CEO panel will be anchored by Anuj Tyagi, who joins us once again, Deputy Managing Director at HDFC ERGO. Post this CEO panel, we will keep some time for audience questions. So please make sure that you're taking down notes, that you are putting your questions and thoughts down on paper. So as our speakers are on stage right now, a brief moment to introduce them. Dr. Rahul Kalia has 20 years of diverse experience in EMS, healthcare, corporate health, and consulting, and currently focusing on enhancing employee health, wellness, and happiness. He is an avid speaker on the pursuit of physical and emotional health and has actively advised many leading organizations during the pandemic. It's wonderful to have you here with us. Please put your hands together for Dr. Rahul Kalia. Our next speaker, Charu, has over 25 years of experience in real estate, especially in property and asset management. At JLL, her focus is on providing uniform technology-based delivery solutions to clients, increasing market presence, and enhancing services around the human experience. She also oversees emerging markets, including India, Indonesia, Thailand, Vietnam, and the Philippines. A warm welcome. Thank you so much for being here with us today. And as one of the co-founders and CEO of Indigens, joining us virtually, Manish is responsible for the company's strategy and global operations. Among a multitude of responsibilities, he has vast experience in multinational organizational development and is acknowledged as a thought leader in conceptualizing solutions to address current and future challenges for the global healthcare industry. Please put your hands together as we have Manish join us on stage. So right now, ladies and gentlemen, handing over to our panelists, Rahul, Charu, Manish, and moderating the session, Anuj. It's going to be quite an investment of our time. Ladies and gentlemen, we now hand over to Mr. Tyagi. Sir.
Can you hear me? Yeah, perfect. Dr. Kalia, Charu, Manish, thank you very much for joining us. It's truly a delight, and it's certainly a discussion that I'm personally looking forward to, because there's nothing better than hearing from the practitioners, hearing from the leaders, what they have done in their organization to make health and wellness come above the surface. These people have been the true champions of making the employee making the workplace healthy and more happier. So we will obviously gain a lot from their practices. But before I start, I certainly want to throw a question to each one of you. In one or two sentences, please tell me, what does health and wellness mean to you? We start with Charu.
Thanks a lot. So, for me personally, it is about being the whole. You can't break it up into parts. It is your whole being. It is, and I think both of you spoke about it in the earlier discussion, it is mental peace and wellness. It is your physical health. It is nourishing your soul. And, if you break the day apart into three main parts, ensuring that, you bring wellness through good sleep, good quality diet, and it is also important to permeate it to the teams you work with, and the younger generation, your children, etc., because that's who you're going to hand the baton over to, right? So it is incumbent on us to ensure that all these aspects are carried forward, in a holistic manner. And personally, I'm a yoga practitioner. I think we're great to be in the land where it originated. Very easy to do wherever you are, wherever you're traveling, and always encourage people to follow any form of wellness.
Brilliant. Dr. Rahul, health and wellness for you?
Well, at two levels, personally, the two words seem inseparable, depending upon which dictionary you refer, which literature you refer, which nationality you speak to. Some call it wellness, some call it well-being, some call it health and wellness. At a very personal level, it is, the boundaries are overlapping. But if I was to put an organizational lens to it, we can do a lot. We can also spread ourselves thin. So to start from the start, we actually split this. Health for me, just to define it, to picket fence this one, health for me is the core of your existence, the known conditions of diabetes, the hypertension, the conditions of cardiovascular risk Dr. Shetty spoke about earlier. But at the same time, emergencies, taking care of the first aid cases, taking care of saving lives, maybe medical or trauma accidents. So we, picket fence health in that parlance, because the amount of effort you need for that is relatively different. We already have the leaders in the industry who are sensitized to the health needs of the patients. I see a lot of known faces in this group, in this crowd. I'm sure all of you have a health and wellness center, either put in a corner in your organization or right in the center of your entrance on accessible ground floor. And that's because people see the need for health to be taken care of. So that's for me the health bit. On the wellness bit is the sprinkling of all the other initiatives and solutions. Charu, you spoke about yoga. It's so important. But when you put again an organizational lens, is yoga the only thing? Of course, it's one of the very good things. But in addition to that, different people have different needs. So understanding those for us is in the wellness parlance, to sprinkle in both physical, emotional, social, and financial. Of course, that's not under my parlance, but still, it's so important to address that particular aspect, and we bundle that under the wellness definition.
Well said. Thank you, Rahul. Manish, thank you very much for joining us online. I don't know if you can see me. I can certainly see you. We all can see you. But your take on what does health and wellness mean to you personally before we actually shift to what all you've been doing in the organization?
Sure. First of all, thank you for the invite, and apologies for not being there in person. So at a very personal level, I believe that there are two things which finally drive a fulfilled life, right? One of them is clearly having a good health. And the second most important thing, or actually I won't even put these in ranking, but together a very good social life, right? Along being healthy. These are the two probably the most important things above a certain level of prosperity, which most of the people working in companies like ours would anyway have crossed. Right? So those are the two very important things for leading a fulfilled life. Now, from a company perspective, without getting into details of what we did, one of the very important things, even when we started the company, which is now more than around 24 years back, we said we wanted to create something which stands out, global, differentiated, but also while doing that, we want to have fun, right? And you can't have fun if you can't, one is tolerate each other or people in the company, right? We're just going for your bonuses, upsides, whatever it is. So which meant that there needs to be a very cordial, nice environment inside the company, right? That was one very important thing from a cultural perspective we called out very early on in the company and stayed with that. From our perspective, health and wellness emerged as one of the themes from that where we focus on, and especially after we got to a certain scale, there were many more people in the company. We realized that if you really want to have a great environment, very deep focus on health and wellness is an important thing. And I am happy to talk about how we think about health and wellness in a much broader way and how it has evolved over all these years later.
Thank you, Manish. It's so interesting and fascinating to see Charu, Rahul, Manish, everyone in the room and on the video, how business leaders have started giving importance to health and well-being of themselves first and also their employees. So I'm not surprised, and I don't have a doubt that this movement very soon is going to become very, very large, because the frequency at which staying healthy is being spoken now in workplaces is no joke. It has become very, very serious now, and people are practicing it. I mean, you see people in the room, you see people like Rahul, Charu and Manish who are very passionately talking about what they are doing. But let me just continue with this and I come back to you, Manish. Indegene has taken those early strides as far as the employee health, wellness, well-being is concerned. And clearly, as you've spoken, you are somebody who also leads you also lead by the example. We are very curious to know, A, how has this journey been? And B, what are the challenges you would have come across while making health and wellness a priority for your leadership team such that it gets percolated downwards?
Sure, sure. So for us, it started, and I'm again saying when I say started in a much more institutionalized way, right? Probably around 13, 14 years back, we serviced global healthcare industry, right? Which means most of our clients are in US, Europe, and these are all healthcare organizations, primarily life science organizations. So every life science company pretty much is our large life science companies are our clients, which means that we do odd hours, right, late evenings. That's just the nature of the business, and you can't do much about that. And that was causing some bit of stress. And we stepped back and said, as a company, that listen, there is some bit of things we can do to make this better, but the nature of the business and operating model is something we can't change. But what can we do, right? So we came up with this thing called indigene cares. Essentially, that let's try to remove any other stress you have in the system, right? Make things easy for you. That might be as simple as concierge services, crash facilities, all those kind of things. And obviously things like yoga sessions, meditation that got thrown in, right, as part of this whole thing. Somewhere in 2014-15, we had a few, and at that time I think we were 1,000 people or whatever it is, somewhere in that ballpark. And we had some very unfortunate incidents where we lost a fairly young colleague, actually two of them, in a short period of time. And that's when, that was a big shock for us. And we said, listen, we are working and helping the global healthcare industry and doing really things for them to drive better outcomes with patients. And we just cannot afford to have stuff like that, or or at least we should be better than the industry as far as the employees are concerned. So we called out, and when we stepped back, we looked at things. And if you think about the healthcare continuum, and I've been in this space for 24 years, you always hear about the preventive part, which is where your lot of the environmental, social, right, physical, some bit of exercise, the whole, all that falls into the preventive thing. Which we started doing, right, very early on in the cycle. And but what we also realized is that you need to do, in spite of all this stuff, the reality is we are human beings. If we would do it, if all of us did whatever is the right thing to do, then nobody will have heart disease, probably cancers won't exist, you'll eat right, you do all the things. But in spite of all the knowledge, we will do some things which are not fitting in, and also a function of our genes. So we said we will make interventions on a medical basis, right? So we set up practice, and we called it My Health Matters, which did a lot of the preventive thing. But we also started doing things on the intervention side, which meant that for employees, we started doing blood tests, we started doing cardiac screening, diabetes screening, women, over time we added the whole women's health screening component. And the way we help our clients to drive better outcomes with their patients, right, which means with the regular interventions, following up with them, right, reminders, and all, by the way, in a completely confidential way. For example, I would not have access to any of that data, right? All these are interventions built in the right way with HIPAA compliant and all this stuff. Again, whatever we do for the industry, we start doing it for our employees. Right, connecting them to doctors. We provided various, we onboarded various partners on the board for consultation, for lab tests, right, and bunch of things like that. Now, over time, what we started seeing is that at least over a 2-3 year period, at least the incidence as a percentage on hypertension, diabetes, we could impact. Now, the impact is not in very large numbers, but we could see that it's coming down, right, by regular interventions. It's as simple as somebody being followed up and said, you go to visit a doctor, right, and sensitizing them. If you're a diabetic, you know what these are things you should do, not do, getting complete reminders. So those things could impact various metrics. A couple of years back, we also added the whole counseling, mental health related issues was becoming an issue, right? We were reading that everywhere. So we added that in a very significant way, where employees could reach out, have various things. And that was extremely handy in COVID, at least, right? It is handy now also. At any given point in time, 10% of our employees, and we are slightly more than 5,000 people, are availing of these counseling services. And again, it's very maintained in a completely professional way where your confidentiality and everything is protected, right? So broadly, that's been our journey, and it's still a journey. We are obviously learning new things, implementing them. We have the advantage of obviously learning from global best practices, what our clients are doing, like it across the world.
Thank you, Anish. I can clearly see how passionate you are, and one, how deep the entire health and wellness initiative in the organization has been. And I think as a country, as a movement, we truly need leaders and ambassador organizations like yourselves to spread this awareness about the responsibility of leadership and organization towards the health and well-being of our employees. And on this point, Charu, I come to you now. JLL, it's the health and well-being for the employees is absolutely non-negotiable as far as the organization is concerned. And we all have, we all are now grappling with this hybrid workplace system. Obviously, along with the physical health, the mental health and wellness has also come into fore now. So I have two questions from you. One is, A, how important it is for the leaders to be a role model if we truly want the organization to be a happy and healthy workplace. And B, where do you see the whole mental illness issue awareness at this stage in the ecosystem?
Great, thanks again. Superb question. I think about the leaders leading from the front, all of us agree, right? You spoke about it in your panel, you mentioned it, Manish mentioned it. It's I think, non-negotiable any longer. Leaders have to not only try and lead a healthy life, but also talk about it. You said it right, that if you're climbing a mountain, you tell 10 people and those 10 people tell another 10 people. Same thing, our entire leadership team is very well aligned. And we talk about what our personal goals are, right? We talk about it to our teams. We encourage them to form personal goals. So for example, even when you're starting any meeting, you not, of course, financial numbers, profit is important, but you start with, how are you feeling? How are you doing with your goal? You set a target, you're going to walk so much, you're going to lose so much weight, or whatever it is, right? Everyone has their different targets. So culturally sensitizing people to change the tenor of the conversations we are having with our people. With regard to hybrid and long distance, even through the pandemic, as you know, a lot of the work that we do is on behalf of our clients. So when everyone was, safely accosted at homes, our teams were working, right? So much like, I'm not saying like the medical, but much like them, we had people staying over in buildings and assets because they had clients to manage, right? And that was very, very hard. During those times is when you really thank technology, because that came to our rescue to reach those people and continue to encourage them. And I think that's carried forward because hybrid is here to stay. Right. Most companies have flexi policies. They're allowing people to determine their workday. They're allowing people to determine how they want to work, when they want to come in, their priorities, etc. And I think technology in that sense is leading the way because it is a great connector. I mean, look at our panel today. We are 25% virtual, and equally the messaging is as emphatic. So, as a company, we have 4 very clear pillars which uphold this wellness. So physical, mental, financial, of course, right? So, training, grooming young people, how to look after what they're earning. And the 4th very important pillar for our organization is the environmental wellness, right? So a lot of focus goes on to that. So I think this whole thing creates a ecosystem where people are committed to themselves, to their families, right? Because you don't come alone to work. You come to work with your family, with that, on your mind, and that's where your emotion is attached to. So I think all of that constitutes that entire wellness for our firm. You spoke about EAP programs, etc. All of that very well embedded. All of that available to people virtually should they want to choose, available to them in the physical form if they choose. changing the way we are interviewing people, you know, not just about their caliber and their certificates, but also talking about what are their goals in life, what are their wellness goals, what do they do to keep themselves fit, etc. Right? Have started, you know, getting introduced into how we are selecting people to come in. So, you know, the entire cycle is becoming more healthy, I would like to say.
Sure. And do you see your leaders resonating with the larger population in the organization? Do you see people coming forward and adopting healthy practices and realizing the importance of staying healthy?
Yeah, absolutely, you know, and it is really difficult because it's not as if we are all sitting in one office, right? We are in different parts of the country, different assets, and it's really nice if you go to, you know, a different city and you're walking an asset and someone comes to say, you know, ma'am, you were talking about that asana, I do it like this, you know, this is my tip for you, just like you have people coming up to you. So somewhere it's resonating, right? The other thing, and I think a lot of your companies perhaps have participated in these walkathons where you form teams and through the apps you have the number of steps you've done, and my God, it is intense, right? So my team had people from different parts of the country and they would actually ping, you've not done your 10,000 steps today, come on, get on with it. It's 8 p.m., right? So I just think that not only fosters great bonhomie and camaraderie, but also encourages people to continue the good practice, right? And they see the benefits, they see that it helps them calm down, you're listening to music or whatever you're doing, even on calls, right? Our offices are designed in that manner, right?
Absolutely. No, I can imagine creating competition is the best way to actually popularize a practice, and the health index for the country is, in a way, is a competition, right? We are actually creating a competition amongst the corporates who emerges as the healthiest, happiest organization in the country, and for all you know, it could take a different and bigger shape. Let's see, fingers crossed. Rahul, I come to you now. I've been, you know, when we were chatting, I was chatting with Rahul, and when I read your profile, I was very intrigued that here is an organization which has taken health and wellness to a different level. You know, it is not only a doctor sitting in a corner and taking care of the employees when they have stomach ache or headache or whatever. Here is an organization which is actually saying that you have a person who's responsible, so to say, to ensure that the employees are healthy and employees are, you know, taken care of as far as their well-being is concerned. So my question to you, and you are a medical practitioner, so I will not miss this opportunity to ask you a question which is related to the field. My question to you is, where do you see the mental health index of the country in your opinion today? Do you see the corporates are creating an environment where employees come forward and share their mental issues? And do you see the society ever becoming matured enough where mental health will also be kept at par with physical health? 3 questions. Answer in whichever order you want to.
Well, it's not 3 questions, it's 1 question. You know, mental health. You know, we choose to call it emotional health. The word mental is associated with a bit of a taboo, a subconscious taboo. People say he's a nutcase, he's mental. I'm sorry I use those expressions, but it's very important to say it as you see it. So we choose to call it emotional health. You know, we help people manage their emotions. We are sitting on a ticking time bomb as far as emotional health issues in the country are concerned. There are many statistics floating around, but I find in absence of authentic data, data gets made up by smart people sitting behind fancy computers. It's assumed numbers, right? We pick up a number from the Western world where it's an insurance-driven market, and hence the numbers are a little more well, acute than in the Asian healthcare industry, if I may. The most recent numbers that I referred were somewhere in 17 or 18, where we had 200 million Indians suffering from mental health disorders.
Really?
Out of which, close to 90 million had anxiety and depression, which are the entry points into many other mental health issues. Now, 1.4 billion, it was 1.3 billion in 2017. I haven't seen more authentic data since. Now, the numbers by themselves don't mean much, but it's to emphasize on the magnitude of problem that we have. We've all very avidly seen the COVID trackers, I'm sure, the past 3 years. How many cases are there in Bangalore? How many cases are there in Delhi? How many cases are there in Bombay? You know, we all became data scientists.
Right.
It took COVID for us to start looking at numbers. You know? And of course, thanks to COVID, there's one thing that I thank COVID for, is that it's made the emotional health issues rise up above the surface. You know, the tip of the iceberg. It is still the tip of the iceberg. Now, do I see this continuing as a problem? I mean, one of the parts of the questions that you asked were, what is it that the industry is doing and where is it likely to go? I see it's a long drawn journey. The first step is acknowledgement, and that's what this group is doing, right? I mean, I'm here because it's a group of like-minded people who are trying to make a difference, and we definitely are working very hard at making the difference. You can't solve something that you don't identify as a problem. I think India, the India INC, if I may, is in that process, recognizing the magnitude of problems, saying that yes, we have a problem. Do we have solutions for all the elements? No, we don't. But will we get solutions? Yes, we will. Now, India is 5 to 7 years behind in the wellness industry, 5 to 7 years behind, if I may use a reference of the US wellness industry. But we can't transplant initiatives from there to here. There's so many cultural, so many social challenges. You know, even the healthcare is structured very differently. So what that means is that we will have to customize. Innovation is too big a word. I don't think there are too many innovations happening in this space. There's more customization. We will have to customize solutions for our community and our workforces. Now, I deal with this at two levels again, reactive and proactive. What do we see today? A lot of uptake of reactive solutions. You know, counseling. It's at least been recognized as an important step. Who benefits from the counseling? Somebody who already has a problem. The 200 million, if I may use that reference, you know, for want of better expressions. What about the base of the pyramid, the invisible part of the pyramid, where people don't even know that they have a problem? How do we support them? You know, we did a small, very, very naive exercise at Bosch, where we looked at the data, because without data, it's difficult to put that weight behind this initiative. And we looked at the very basic data. You know, more than 50% of the people we reviewed, we did a health index exercise internally to quantify the magnitude of both cardiovascular and emotional distress. Not to our surprise, but definitely to the surprise of the larger group, 50% plus had early signs of anxiety and depression. Doesn't mean that all 50% need counseling, doesn't mean all 50% need acute support, but it unearthed for us maybe a bit of the base of the pyramid. We haven't yet seen the whole iceberg. We haven't yet seen the whole iceberg, but at least it gives us enough confidence that we're headed in the right direction. So that's the reactive and the proactive part. Now, this conversation around emotional health would be incomplete if we don't speak about leaders. You know, Anuj, you spoke about leading by example. Such a splendid concept, you know. Monkey see, monkey do. I mean, I speak about my kids and to parents who reach out for guidance on children issues. And I said, kids don't do what you tell them to do. Kids do what you do. Organizations, groups are similar. You know, we get inspired by each other, and nothing better than being inspired by somebody who you look up to. Now, another point that I've noticed in my discussions with various leadership groups over the past around 10, 12 years is that not all leaders are physically fit or visibly fit. Some leaders are musicians, some leaders play tabla, some leaders are avid writers and painters. Is that not wellness? It's a big part of emotional health and emotional wellness. A lot of leaders are shy by personality. They put a very clear divide between their personal and their professional lives. And they're not comfortable sharing on social platforms that I went on for 5 games of squash today morning and I lost in 3, but I gave good fight. No, they're not very comfortable doing that. So a lot of this is also transition for the leadership groups, for them to become a bit more visible. They may not look fit in our definition of it, and Dr. Devi Shetty put it so well. You know, there is something more or beyond the looks. They may not look fit, but at least them declaring or sharing that they are on their journey towards their fitness. You know, what are you doing about that? So leading by example is great. But for there to be a tone from the top, there has to be a tone for the top. Somebody has to tell them how to be fit. I find a lot of leadership groups are actually very poorly informed, because a lot of initiatives where a lot of experts come in the community, a lot of focus has been towards the larger population, the larger workforce groups, because you're all concerned about employee health and well-being and their productivity. Seldom do we turn the gaze upwards, and that upward conversion, I think, is very, very important, and it's a bit of a missing link in the industry today. At Bosch, we've invested a lot of time in planning and strategizing this. So we are not only looking towards the employees and their families. For us, an employee is not just an employee, and COVID taught us that, right? The unit of an employee has changed. It's become a family. You know, we can't treat an employee in isolation. You know, a child getting bullied at school is not just going to impact the child; it's going to impact both the parents and their interactions with their colleagues at work, and so on and so forth. So for us, it's the definition of unit has changed. Not only are we focusing on that, we're also focusing upwards, if I may use that expression, where the conversion of our leadership's approach is happening. It's a dynamic goal. It's never, you'll never have enough.
Sure. No, absolutely, truly. And I'm, you know, as I said, for me, Rahul, practitioners like yourselves who are going to make a difference to the corporate India, where we are not only helping people, we are also, when they have a problem or when they have an issue, we are also helping people realize how to identify an issue. And I think most importantly, if you look at the conversation which is happening since morning, it's also about fixing the responsibility and accountability at the leadership level. And this also, I don't know if you noticed, ladies and gentlemen, we've got 3 points. And if you remember what I said in the sequence, the physical well-being, the mental well-being, the spiritual and emotional well-being, and the financial well-being. And on the stage, we've actually spoken about this. Rahul actually makes a very, very important point. Not necessarily every leader will climb Mount Everest and play squash. There are leaders who play tabla, who love cooking, who love singing and writing poetry. These leaders are also, you know, share these examples, can motivate people around them, because some of these activities, look, it's all about finding a vent to release their stress and get into something more constructive. So do that. Charu spoke of how in JLL they are making financial well-being also as a KPI. They're helping youngsters plan their finances. So it's all about, you know, doing everybody's bit on physical, mental, emotional, and financial well-being. It is absolutely inspirational and fascinating. I come back to you, Charu, and for the larger, and this I'll actually throw open to all the speakers. I would request you to share with us one initiative which you have in JLL, which you personally lead or personally practice, which has become more of a sort of a movement in the organization towards the well-being.
Interesting. So one thing that I like to do, and this is not a physical or anything, on how we run meetings, right? And I think I mentioned it earlier, that the tone of the meetings is changing about making people feel that they are important, right? Their well-being is important. So we open meetings with always asking people, how are you? How's it going for you? How's the family? How are you doing?
Amazing.
Right? Because there's so many nuances that come out from there. The person's expression, the person's tone, tenor will lead to maybe after the meeting you calling out the person, hey, you seemed out of it, you know, is everything okay? Ghar pe sab theek hai, you know? I think that is really important in ensuring that people are well, one. Second is talking about your own infallibility, right? Being open about it to say that, look, I'm not having a good day. And it's okay, right? If I say it, the next time the other person will be more open to say, hey, listen, you know, I'm not okay. Can I chat with you? You know, I think that's so important, right? Because I just wanted to add something to what he was saying in terms of mental wellness. You know, we manage many types of assets, residential, commercial, etc. not during the pandemic, but this year has been unequivocally the most challenging in terms of dealing with people who are living in those places causing self-harm. Right? And that leads to so many things because our people are the first respondents to any of these emergency situations. And then it's incumbent on us to ensure their well-being is taken care of, right? Because they are not trained to look after all of this. So, you know, giving them that sort of support. But in addition to what all we've spoken about, social media is having a huge impact on the mental well-being of people. Right? Talking to them about how to manage it, how to ignore comments if someone's being nasty, etc. It is having a big impact. So talking, I think, you know, becoming real to the people you work with, that we are available, you need to talk about it, what your challenges are, etc. Don't stay quiet. So I think that is the thing that I'm, you know, very consciously trying to ensure we embrace in the entire organization.
So, and actually you make a very, very interesting and important point, Charu. You know, we as leaders have become prisoners of ratios and numbers and Excel sheets, and we would very rarely start our meetings with how are you at a personal level, right? And the fundamental tenet of level 5 leadership will be breached. We've created that wall around us instead of being a shoulder to every employee in the organization where they could come and say, look, I'm not feeling well, can I come and talk to you? I would be the last person in the organization who, if somebody is not feeling well, will come and talk to me as a leader. And that's a very, very important point. Rahul, to you, what is that one initiative you drive in the organization which you're extremely passionate about and according to you it's very powerful?
Well, this whole subject of wellness is very close to my heart, both personally and professionally. I've invested more than 15 years in this industry. Before I answer that, I'm going to maybe refer to a small photograph that I saw many years ago. It came on an email. We didn't have WhatsApp then. There are two village boys on a village road walking hand around the neck each other, and one of those boys has a tumbler full of water in his hand. Of course, he's going to answer the nature's call somewhere away from where he stays. But the other guy does not have a tumbler in his hand. And there was a line written there in Hindi, if I may. वो मेरे साथ आया जब उसे आई भी नहीं थी. That's a buddy for you.
That's a good
right?
one.
He had no reason to be there, but he's just there because his buddy is there.
He's there to give emotional support.
And that's a culture. To me, working towards that culture requires everything that all our buddies have spoken here, all of you have spoken here, and a lot of you have made notes. That to me is my most prized, well, prize is yet to come, but the most valued investment of time and effort. To create that culture, awareness for me is the biggest bet. I mean, whenever you do change management, whenever you change behaviors, 80% of your work goes in creating that awareness, giving people a reason to change. And if I was to ask this group to make a change, very few would be willing to change. But if I give you a bit more information, and I allude to Dr. Devi Shetty, he's very passionate about doing those assessments, especially the CT scans, and I met him a few months ago. Such a great guy. But after you hear him, the willingness to change changes. It moves. So that's been where me and my team have put in the most effort over the past many months to influence that culture. Not that it didn't exist, but the sky is the limit, you see. You can only make more buddies. So we want to be the buddies. We want the leaders to be the buddies of all our work group, to break those barriers. And of course, a lot of work in store for us.
Sure. I come to you, Manish. What is that one wellness initiative which stands out for you and you're extremely passionate about that in the gym?
So one of the things which has changed for us drastically as an organization. Yesterday evening I was chatting actually late night with a colleague of mine. And typically when we chat, it's always about have you closed that deal, how is this one going, right? How are the margins on this thing? Yesterday he was telling me about how great his readings are. And he was talking about his cholesterol levels, bunch of other things. And it's not that he's not well. Everything was fine. But now along with our bookings, revenue, gross margins, I can go on and on, the financial metrics. The conversation around metrics like, how are we progressing on number of people who are pre-diabetics, right? People on hypertension. I'm just looking at a mail which I have got that how are we doing versus the 5 million calories burn goal which was kept in the organization, right? And those kind of metrics are floating around in the organization. And what I feel happy about is that I'm not involved in any of these. I was involved in setting this up long time back. But organically, you see a bunch of these metrics emerging, right? People coming up. Now we have the privilege that given that we are a healthcare company, we have more than, out of more than 5,000 people, more than 1,000 come from a medical background, medical doctors, PhDs, pharmacologists. So a lot of knowledge is available inside the company itself, right? Based on that, organically, a lot of these goals, metrics are being discussed and finally they're becoming part of the everyday lexicon along with the financial metrics which he anyway discusses as an organization.
Well, that's absolutely brilliant, Manish, and you've touched my heart, you know, when you shared that metrics, because I personally have been very, okay, wrong word, very, slight exaggeration, but I've been slightly disappointed with the corporate India not to look at the health matrices along with the financial matrices. We start our day with how much business have we done, what is my expense ratio, this, that, and the other. And I'm personally absolutely fascinated with the million calorie...
Five.
Sorry?
Five.
Yeah. I'm saying million, it could be multi-millions, it could be,
yeah.
So the metrics measuring the calorie burn. And this is truly what gives us inspiration that what we've started as a very small initiative is certainly going to become a movement that we all have been dreaming for. And if you look at the panelists, what the panelists have spoken, if you look at what Dr. Shetty spoke, if you look at what is being spoken possibly in your bilateral meetings today, there is an awareness about the importance of health and well-being at the workplaces. So this movement is just a start. This movement is, as we said, this movement is not going to be successful unless we all join hands and make it supremely important for all of us in our daily work life. Charu, gentlemen, thank you very much for being here. I'm not going to open the session for questions, but before that, I would request Yashashwani also to come up on the stage and you can ask us questions. And I would request you to identify yourself when you ask a question, and also please point your question to the particular speaker if you want anybody specifically answer your question.
Thank you.
Since you already acknowledged that I'm a gentleman, I have to stand up and offer you the seat.
Yeah, we have a couple of raised hands. The gentleman at the side first, yes. Yes, sir, please stand, the one with the mic.
Yeah, hi, I'm Uday Mathur. My question to each of the panelists. We have heard about the ideology and the leadership, etc. To each of the panelists, what is your most important observation that you see within your own companies in relation to the acceptance of the concept that we are all talking about? And what in your mind is the 2023 different path that you may have contemplated?
Sure.
Well, a question back to you and maybe to this group. How many of you in this room get up in the morning, say, I don't want to be healthy today? So and that's a rhetorical one, right? I mean, my perspective, what I see in our organization is that our colleagues, the workforce, is like a dry sponge. You sprinkle any water, and in this context is anything to do with health and wellness, their health and wellness, it gets absorbed instantly. The problem is not that absorption. Problem is not their participation in that initiative. It is sustenance. You know, one initiative in a February of a particular year will impact that individual in February. We want to make sure that this is sustained, not just for that February of that year, but many more Februaries to come, in a manner of speaking. So 23 is too short a radar for me, if I may, you know. 23 is more tactical, you know. I would go to at least 2030 if I was to look at a strategy. Yeah, sure. That's a bare minimum. It takes multiple cycles of measuring the problem, impacting the problem, and then monitoring the problem. Well, for want of a convenience, I'd say maybe a year for at least one cycle to run, just like the financial year. I think The corporate INC understands and recognizes the annual review cycle. So if I was to put that context to it, you'd at least need 3 such cycles from an organizational perspective to have a change which you can say is real. It's like weight loss. We all have been on that journey, all of us, right? The weight you lose in the first 2 weeks is water. You gain it back. You need at least 12 weeks or 3 months worth of effort, and then you say, oh, that's tissue loss. Similarly, I believe multiple cycles need to be run. So to your point, sir, 23 is already here. For 23, we are already too late. More tactical, but I think if we can take the time to strategize in 23 for 2030, that would be a good investment of time.
Yeah. I can also share the other practical issue that we face at workplace and also in and around our ecosystem. You see, there's a saying in Hindi, आप सोते हुए को जगा सकते हो. जो आदमी सोने की एक्टिंग कर रहा है उसको आप जगाओगे कैसे? वो ऑलरेडी जागा हुआ है. Now, the leaderships can lead by example. You can have all these conferences happening. You can throw as much material on people and do as... our priorities are slightly lopsided. You know, more often than not, the answer, the response I hear from people is, sir, time ही नहीं मिलता. उसको नीचे जाके 10 मिनट गप मारने का भी टाइम मिलेगा. उसको घर पे जाके सब खाना बिस्तर पे खा के 3 घंटा टीवी देखने का भी टाइम मिलेगा. उसको अपनी बॉडी को 45 मिनट देने का टाइम नहीं मिलेगा. Because our priorities are lopsided. You know, to the point that you said, we don't get up in the morning and say, boss, कुछ भी हो जाए, मैं अपना 15 मिनट का, आधा घंटा, 45 मिनट का वर्कआउट नहीं भूलूंगा, या मैं सिंगिंग नहीं भूलूंगा, या मैं कुछ भी नहीं करूंगा. So हमारी priorities बड़ी lopsided है. And the other live example which, you know, kind of stares in our face is, हमने जब, we almost made it mandatory for employees to go for medical checkups. We spend a lot, as I said, और हमने KPI में डाल दिया अपने leadership के, it's a self-created KPI कि हमें कराना है. People don't go. And the answer is, I don't know what I have in my body, I don't even want to know what I have in my body. अब कैसे करेंगे? आदमी जानना ही नहीं चाहता कि मेरी बॉडी के अंदर क्या है. So you have these examples, but then, you know, situation is changing. People are becoming more evolved now.
The next. Do we...
Manish, you want to come in?
No, I'll make this comment and then I'll have to apologize and log off. I have a flight to catch. Now, as far as 23 is concerned, I would completely agree with what has been said. It's too short-term a goal, right? In fact, I think the direction is more important from our perspective. As far as buy-in is concerned, again, the point was so well made, right? Nobody wakes up saying, I don't want to be well, but changing the problem, health is one of the things is, and by the way, this is a global problem across the board. Health is something you always believe any problems in health will happen only to the next guy, right? And you are immune till you get hit by it. So that's a very broad underlying theme across the board, which is difficult to change, right? And we as a community group of people can continue to nudge people in the right way. And some of that just happens by broader societal changes, right? As a society, we continue to become more prosperous, right? A bunch of things like that happen. Initiatives like this are taking place. You see that willingness come. Just on the lighter side, I still remember you spoke about finding time, right? I had this childhood memory that when this was when Senior Bush was the president. My father used to be regular running and all this walking, running. He was not running for a few days and he said, I'm not finding the time. And I had just as a kid read that Bush used to run 5 miles. And I told him, listen, he finds the time as the president. And so anyway, that became a topic for later. 20 years later, I was just setting up the company and had put on some extra weight. My father looked at me, what happened? You're putting on weight. I said, no time. And then he looked at me very skeptically, Aajkal Bush bhaag nahi rahe kya? George, and after that, I was so embarrassed. I've never missed a run or a yoga, whatever it is. I mean, I want to do today, but I found time in the morning that putting an alarm to wake up. But it's a slow change, right? All of us get into habits. I think all we can do from our side is continue to nudge people in the right way, put up those reminders, anything which you do for managing change for different areas.
You can hear me, right? Yeah.
Now it's
Okay. So I think our teams are very well aware of what they need to do about their health, as you said, it is often a fine balance between the word one hears is stress. I have a lot of stress, I don't have time, and you can't take stress away from work, but it's how you manage it and how you speak to the people when you're setting goals for short term, 23, and then as you said till 2030. That awareness has to be brought in to say that the stress is not going to go away if you're working, right, or actually doing anything in life. It's how you manage and deal with it that you have to look at, and hence come up with, goals that you can quantify, which you think you can achieve, and put it down. Let's put it down informally and let's see where you track to in 6 months' time. And I think that's incumbent on all leaders to have those conversations when you're setting up KPIs formally or informally with your teams. And then following through, So if someone's calling you at 9 o'clock, you have to first ask, why are you calling me? Is it life or death? Yes, you take the call. No, we'll talk tomorrow. Because it's breaking that culture. If someone's sending you an email at 1 a.m., ask him, why are you sending it to me at 1 a.m.? It's not even important. That is stress balance. You're creating, that acid in your body to say, oh, I have to respond. 9 out of 10 times you don't have to.
Charu, I can't stop commenting on reacting to what Charu said. And I've seen it in my working lifespan. I know there was a time when your, how productive, how hardworking you are was directly proportional to which what time of the day your mail is coming. And now we are talking, boss, 9 baje ke baad mail bhej rahe ho, aafat aa gaya. Sorry, Stephanie, I just couldn't resist commenting on that.
I see her coming here, and I just wanted to probably summarize the conversation as to how we see it. And probably applicable to all of us at a personal level and also at an organization level. Because I think the need of the hour is to walk the talk. And I think the question was around that. I think two things. One, it requires courage for us to really walk the talk. We have to role model it. And courage in terms of saying no, courage in terms of moving away from some of the stereotypes that we may be forced to adhere to. So I think courage is the center, is the cornerstone for us to change. And the second is to create an environment of psychological safety. And that I think is very important. And personally for me, we had our leadership guys at the Great Place to Work Institute. We went off to Ahmedabad for about a week. And some of our conversations were tough. And I remember one of our leaders, Basuri, asking me a question to say, okay, all this is fine, but what about this? And I was just so happy that she did, because the message that went out was that this is a psychologically safe place where we can sit and discuss our fears, our vulnerabilities, and work together. Because I think what we miss out, and this is probably a request to all of us as leaders also, what we miss out is the humane aspect of it. Sometimes we hide behind numbers, we hide behind the framework, we say that needs to be an annual plan and all of that, but we're all human beings also at the end of the day. So just giving ourselves the benefit of doubt, for us, being okay as leaders, not wanting to hit a sixer for every ball, and I think at the end of the day we need to role model it, and that requires courage and a lot of self-reflection. She's eyeing us, so I'm going to, Anuj, you want to say something and hand it back to her?
Is there time for another question, or should we just open it to be fit?
Actually, due to a paucity of time,
we've spoken already.
We actually did all four speakers. So, or would you like to take one more question, sir?
For the audience, but if
yes, all right, just one more.
There is
the gentleman at the corner.
To all the leaders, this is directed, and thank you for the wonderful insights. My name is Navneet, and I lead the learning function for Global Logic. We are in the IT space. I'm also looking at the wellness initiatives. I was very intently listening to what Dr. Devi Shetty was saying, and he mentioned about, take second opinion, third opinion, and this has happened, and we're witnessing this in the health industry. Health industry is growing, but then there is a degradation in the values, the value system. And now we say that the wellness industry is also growing. So how as business, we as business leaders ensure that while the health and the wellness industry grows, but there's no degradation of values, because there is a conflict of interest. The business interest is there. So what we should do? We talk about corporate social responsibility, so what will be our responsibility in this context?
I'm sorry, but honestly, I don't see the two linked, right? If we're propagating physical, mental, emotional health and well-being to the employees, it has very little to do with the degradation of the external ecosystem around. It's only about making yourselves and your, the area of sphere of influence that you have aware of, that much before you eat, what should come is whether you walk or not, right? It's just more of a metaphor. So, I don't know, whether the external, I can't personally comment on the so-called degrading value of the external ecosystem, but keep it aside. What we are discussing here at this stage is that leaders like ourselves should realize that it's important for our employees to realize that खाने के साथ में walk करना भी ज़रूरी है, या you need vents to, outlets to vent your frustrations out, because the workplace does give you unwanted stress at times. It's all about that in my opinion. Frankly, हम human beings ना चीज़ों को complicate भी बहुत कर देते हैं. एक हेल्थ वेलनेस को प्रमोट करने से पहले हम एक्सटर्नल इकोसिस्टम की वैल्यूज पे वैल्यू जजमेंट पास करना लगे, उसको छोड़ देते हैं फॉर द मोमेंट. वो होगा, और डॉक्टर देवी शेट्टी ने खुद कहा कि चीजें इंप्रूव हो रही हैं, वो भी ठीक हो जाएगा अपने आप में. बट इससे पहले अब मैं आपको बताऊं कि एक अपने कंपनीज में आपने हेल्थ कैंपेन्स अगर चलाया या मेडिकल टेस्ट को कंपलसरी कर दिया, एक एम्प्लॉय भी अगर निकला जिसका आपने टाइमली इंटरवेंशन करा के उसकी जिंदगी बचा दी, फ्रैंकली उससे बड़ा प्रोफेशनल सेटिस्फैक्शन, पर्सनल सेटिस्फैक्शन हो नहीं सकता. सो
बिल्कुल, लेकिन इसके साथ एक और बात मैं कहना चाहता हूँ, आई विल आल्सो टॉक इन हिंदी. जब एम्प्लॉय के माइंड में एप्रीहेंशन आ जाता है ना कि जो डायग्नोसिस है वो ठीक होगा कि नहीं होगा, राइट, सेकंड और थर्ड ओपिनियन लेना है, तो वो हमेशा वो दैट एप्रीहेंशन विल दैट्स व्हाई पीपल आर नॉट कमिंग फॉर मेडिकल टेस्ट.
That's a fair point. One is quality, second is a perception of the quality. In a service industry, I'm sure all of us are somewhere related, either providing services internally or externally. The perception takes the better of us. Quality है या नहीं है, उसकी perception अगर अच्छी है तो अच्छी है. To your core question, if I may, the so-called degradation of the healthcare services, or the confidence in our healthcare industry, a private healthcare industry, is not going to change. It'll become much worse before it becomes better. Again, there's a commercial influence on many aspects of healthcare which are beyond the control of an average citizen of this country or an average employee of an organization. Organizations, however, have a better influence. Now, this is where the relationship with the ecosystem comes to play. Organizations have a better leverage to get better access to healthcare for their employees, and that's under the health parlance for us, making sure that we know which hospitals are willing to support you. That's a network. So network management for me is one big piece. On the wellness front, there is actually a concept called wellness washing. It came up a few years ago. Wellness washing is a simple term used for not walking the talk. Organizations declare that they're doing X, Y, and Z, but actually not doing it. They're washing wellness. And that's okay. All organizations did wellness washing before they actually went into sustained initiatives, because eyes don't see what the mind doesn't know. One of the reasons why wellness industry is still in its infancy, at least in India and Asia, is because not many people know what to do. Not because they don't want to do something about that. So just my opinion and not facts, my opinion on your points is that there are ways of handling the influence of commercialization in the private healthcare, and organizations have better leverage. On the wellness front, I don't think we need to worry about anything. Sky's the limit. Any drop in this dry sponge will get absorbed without a question. So whatever you do is welcome.
Oh, absolutely.
Well, thank you so much. Thank you, sir. I think I'm hoping your question was answered. We've got so many other questions in the house, but due to a paucity of time, we're going to request you to keep them and address them to our panelists in the session to follow, which is going to be the break. But right now, I think we've got a very, a special moment we're moving forward to, because we've got our leaders on stage and we've been talking about learning, experiencing, adapting, growing, and how a small change can push us forward into this movement. We're all part of this movement, and can we pledge to that? Because I think that would be beautiful, right? So if everybody, can we please stand up wherever you are? We've got the pledge being brought on stage as well. And it's going to be
You should actually help us through this. Do you want us to put our hands like this?
yes,
Or
let's put our hands on our heart. Let's put our hands on our heart, everybody. And
God save the Queen.
and
The Queen is no longer
and
with us.
each one of us, each one of us.
We'll follow you.
Let's say the first line. I commit to prioritize well-being.
I commit to prioritize well-being
and to be a crusader
and to be a crusader
in the movement of making India a healthy place
making India a healthy place
to work for all.
to work for all.
Thank you so much. That was special. A huge round of applause. We're sending out energy. We're sending out our words into the future, not 2023 only, but 2030. We're hoping for, and into the future. Thank you so much. But before you leave, we've got a big thank you going out to our panelists on stage. And we'd request Anuj and Yashaswani to please present a token of gratitude. Can we please have them being brought onto stage? We'd like to thank our panelists on stage, Rahul, Charu, and of course sending out gratitude to Manish as well. I'm sure that when you all were sharing on stage and emphasized leadership effectiveness, creating an impact, it struck a chord with all our leaders right here in the assembly. Thank you very much. Ladies and gentlemen, please put your hands together. Thank you for your time, your investment here this morning. Thanking both our panelists. Thank you very much. Please put your hands together in gratitude and hoping that you remember this moment when the movement kick-started. Ladies and gentlemen, we're going to be taking a break, but I need you to open up your alarm clocks very quickly. Open up your alarms on your phone. I want all of you to put 12:12. We're taking a 15-minute break. So everybody, 12:12. All our alarms are going to go off together. And we're going to walk back in at 12:12. So everybody, alarms on. We're going to take this breath stretch. Get yourself an exercise buddy, a walking buddy, a buddy who's going to take you into this break and bring you back on time. Thank you so much for joining us right here. Thank you, our panelists on stage. A group photograph is a must. And of course, we're going to see you back here at 12:12, 15 minutes from now. Thank you. As you step out, please stop on over and check out Get Set, Go. Step, Set, Go, because they've got something specially curated for all of you. Please make sure that you go on, try it out. Step, Set, Go, amazing activities. And we're going to see you back here at 12:12.
When's the baby due? Hello? No, it's not loud enough. Is it loud enough? Yeah, okay. But just give me the click. Hello? This is as loud as I'll be, yeah? Hello? Okay. Can I see the slides, Riaz? Huh? What?
Switch it off.
No. There's no sound.
They're connecting.
Yeah, I don't know why.
Hi. I think we met.
I'm Harsh. Yeah, I know. No. Nobody's in the house.
gentlemen, we hope that you've enjoyed that walkabout, the cup of tea or coffee, whatever was your beverage of choice. And we're hoping now that you can join us back in the main ballroom. Our next session is about to begin. Your presence back here, we hope that you were able to go ahead and give feedback for the previous session. Remember, once again, the QR code behind the agenda. I'm loving it when you pick up the agenda right now and you're scanning the QR code right away. Thank you so much for giving us your feedback, for joining in, for making sure that we're all actively present right here today. So everybody in the house, scan the QR code for the just behind the agenda. That's where you give your feedback, and your feedback is so important. Every single session if you can. All right, quick show of hands. Who had a chance to go ahead and take part in Step, Set, Go? Quick show of hands. Step, Set, Go, anybody? Yes, one. A couple, 3, 4, 5. Okay, I've got about 10 hands in the house. I'm loving it. Thank you so much. I love the fact that we're even getting active in our gorgeous sari. So which means no excuses. You can get active anytime, right? So everybody, Step, Set, Go. We're going to have a leaderboard that's going to be put up here. We're going to show you who's at the top of the chart when it comes to collecting steps today, taking part in the activities, and we promise you that when you do go across to Step, Set, Go, you get to collect these points, and the person who, or the persons who are towards the top of the leaderboard, walk away with prizes towards the end of today. So today is going to be a great day. If you're being active, if you're walking about, you're going to collect some points, all right? So right now, without further ado, we want all of you to get back in your seat. Thank you so much for your presence back in the hall. You know, the last 2 years have truly seen phenomenal changes in the way that we work, right? The way that our peers and employers contribute to the workplace culture, and the way our leaders have stepped up to create a culture that puts well-being along with other parameters at center stage. And that's what we're doing here today as well. After the beautiful narrative that our speakers in the last session shared with us, it's now time to understand how one of the best workplaces have created a wellness-first culture for its people. So moving into the session right now is an amazing case study on Tech Mahindra, a company that prioritizes the well-being of its associates and has been working to bring a positive difference through its philosophy of wellness before business. For this session, we have amongst us Harshvendra Soin, Global Chief People Officer and Head of Marketing at Tech Mahindra, who will be sharing insights on how the company has put measures and policies in place to promote overall well-being. Post Harshvendra's session, the audience questions will be anchored by Akshat Shah, Vice President, Client Experience and Sales at Great Place to Work, India. As we welcome our speaker onto stage right now, please put your hands together for Mr. Harshvendra Soin, who is a gold medalist in personal management and industrial relations from University Business School, Chandigarh. Prior to his current role, he worked with Tech Mahindra in various roles, such as the CEO and country head at Tech Mahindra Canada. Over the years, he has also held senior leadership roles with various organizations, such as Fortis Healthcare and Aditya Birla Retail Limited, to name just a few. Ladies and gentlemen, he's right here with us on stage. Let us make sure that we are feeling well, that we are feeling healthy, and we are feeling ready for this session.
Thank you, ladies and gentlemen. Can you hear me? Okay, good afternoon. I know the tea break was the most exciting journey to happen in the last 10 minutes, but I'm glad all of you are back. How many are from HR in this field? Oh gosh, I have a tough time. Right, so obviously, you know, whenever I used to sit for a session like this, the idea was, what do I take away, right? Is it all about talking about the fact that is it an advertisement of Tech Mahindra? The answer is no. So what we're trying to do is tell you about a little bit about the experience we've had in the last 4 or 5 years. Remember, we are talking about a company that's 163,000 people, 105 countries and 135 nationalities. So it's a complex company. Even a single communication can't go in one language, right? And during the pandemic, we had an opportunity and a challenge, with this size and in every single part of the world, right? So I'm going to share with you what we call wellness before business. And thankfully, this was coined in 2018. I had just come over from a business role. I was the CEO for Canada. I came back to take over HR. And we decided, and this was much before the pandemic, right? We said, wellness before business, because ultimately, if we have to make a difference, we have to have folks who are highly engaged. And at that time, ladies and gentlemen, we coined something called human experiences. The wellness journey is part of those human experiences that we talked about. To me, this is an important quote. Dr. Raithil, and look at what she said. Supporting employees' well-being should be a priority for every employer. It creates an environment where not only individuals, but also organizations can thrive. And I can tell you this is really true. Because I was sharing with Preeti just now that the impact of whatever we have done is massive. Not only are we a #1 employer across various regions around the world, but also in India, in this whole great resignation period, we are the company with the lowest attrition across any peer set. And we are lowest by a huge margin, right? So actually, look at the business connotation of wellness, okay? So before we get there, what happened during the pandemic and post-pandemic? And I'm sure if you're HR folks, you would be seeing that we called it the Great Resignation, but actually it was the Great Reclamation. The difference between resignation and reclamation is people started looking at priorities differently. And holistic wellness was #1. #1 priority of people joining a company and staying with the company was holistic wellness. Apart from that, obviously, was also flexibility. Now, unfortunately, in some of the conferences that I've gone to, flexibility is thought of as work from home or work from anywhere or work from somewhere. But unfortunately, flexibility is a lot more than that. Flexibility is about work, where you work, how you work, when you work, what you work on. And that also impacts well-being and the holistic well-being that we talked about. Third was purposeful and meaningful work. Companies with a purpose thrived, and great brands actually came down very quickly. And I talked about the word human experiences. To us, human experiences was personalization. At 163,000 people, we had N is equal to 1, which means everybody was treated as an individual and personalized, whether it was incentive plans, wellness plans, holistic plans, was all done N is equal to 1. And therefore, this is a big change. And if you go back into your organizations, you will see this is the change that's happened. And every organization has to take this into account. I talked about the fact that wellness before business came into being about 2018. And this was embedded in the business strategy. So whenever we have a client meeting, whenever we have a deal that's going on, this is there. It is not only reserved for a meeting on wellness. I've often heard of a CEO saying, let's call a meeting on wellness. It's never going to work. Wellness has to be part of everything that you do as a business and has to be part of the business strategy. And what we really talked about, and what's important here is words like integrated and holistic and sustainable. Words like personalized and customized experiences. And I'll give you some examples as we go forward. But most importantly, what I'm going to try and share it with you is about how we use technology for scale. And maybe this is going to be something interesting for all of you to see, because whatever we did, we could not do it across the country. 105 countries, at the same time had to use technology. And I will leave this with you to say that as part of our belief is that technology is an enabler, movements of truth are still human. So we had to deliver a human experience on wellness through technology, because otherwise it was impossible to actually deliver it. When we talk about wellness in Tech Mahindra, it's across these 8 facets, right from physical, emotional, mental, to occupational. I'll give you an example of occupational and how we do it, environmental and social. So I have a strong recommendation for your organizations. Whenever you're creating a wellness plan, make sure it's beyond just the physical and mental. Because the physical and mental is an outcome of something deeper. And all 8 facets, ladies and gentlemen, are very, very important. When we started this journey on wellness in 2018, we actually did something no company had done before. We appointed a global wellness officer. And guess what? The wellness officer is about 26 years old. And she runs wellness globally. And then we had a structure to it. The reason I'm saying is the only reason we could do so well during the pandemic and really stand by not only our employees but also communities and countries is because we had a structure in place. And look at the structure. The wellness officer had direct access to me and our CEO, direct access. And then we went down to the grassroots level. If you see the lowest, we said 3,000 wellness warriors. This was across the globe, and this was purely voluntary. And we then trained people managers, because the problem is that the people managers say, "Kya kar rahe ho yaar? What is this wellness?" Because this is pre-COVID, remember. You know, everybody's happy. Why are you bothering about this? But we made a structure which had 8 on-site teams, 11 pan-India teams. We gave it it was almost like an employee resource group. We gave them budgets, we gave them independent decision making. Nobody from management was involved, except that they had direct access to the top senior most management. This is the thing that really made a big difference, I think, as we went forward. The design was simple. We did a needs analysis, and the needs analysis was as an individual level and an organization level. We then had implementation through policies, and important thing is this was also as part of our diversity agenda. Because you can't have different things happening in silos. And finally, of course, there was a serious evaluation of what we were doing, and it was all put to test during the COVID times. And we came out really, really well. Our wellness experiences, again, I'm not going to talk too much about it, but look at the detailing that wellness has in TechM. From onboarding right to the last bit of experience, wellness is part of everything. For example, imagine you're going for an interview. You're anyway nervous. And if the experience is really bad, I'm telling you, it's not going to leave you in a great taste, and it lingers on. And if you have the job, it's even worse. Because now you know that the company you're working for really doesn't care. So what we try to do, and I will give you examples of how we use on recruitment, how we use in various onboarding processes, how technology has helped TechM deliver the wellness experience. So the message, ladies and gentlemen, really is wellness is not siloed. Everything else that you do around in your HR policies has to talk to wellness. So the first thing we introduced many years ago is this, which is really the touchless attendance. Now the genesis was we went to employees and said, tell me something that are really bothering you. And in an IT company, I can tell you, it's the worst IT inside. Everything seems to be manual, and it was. So we said, what's bothering you, right? And they said, listen, we are really harassed by the fact that everywhere we have to carry these ID cards. And then we have to swipe every ID card. And then you terminate me because somebody else swipes my ID card. And then on the payroll, you have 30,000 people doing interventions in between. And it's just not pleasant. And it's really, imagine if you have ever got a wrong salary, or if you've ever attendance not being marked, what you go through here is crazy. So we introduced, this is 5 years ago, a touchless attendance system, but it was very interesting. You looked at this lovely iPad, you said in, your attendance is marked, but it also captured 8 moods. Instantly, it captured 8 moods, and it was GDPR compliant. So what happened was, I don't know the mood of Preeti, but I would know the mood of Bombay, or any location in Bombay, or any building in Mumbai, or any building in, let's say, Hyderabad, or any part of the world, every single day. Okay, so I'll just give you a look on how it looked. Voice enabled, people loved it. It created a huge excitement. By the way, we sold it to the immigration authorities. So what you see in Dubai, etc., is exactly this. But we started by doing this for employees for their well-being. So what you see here is, it's a simple in. From there to your payroll is 0 touch. No human being touches it. Absolutely automated, but the experience is so good. Well, we had ladies coming and doing their bindi and stuff like that, so it was really nice. Right? So it was very well received, but it did a lot for well-being. People really started feeling lighter. They didn't have to open doors through this because the facial recognition opened doors. And remember, you can't copy a facial recognition of your own face, right? So you can't have somebody else say, okay, mera face aaj tum dikha do. Right? So it was a great way of introducing, and again, this happened pre-COVID, during COVID and post-COVID. Imagine the power of this. There was no touching. Right? So you could enter and do everything without touching a single piece of infrastructure. The second thing we introduced was AI Coach. Now this is a very important thing, and this actually came in during COVID. What it does is, it's very difficult to sometimes tell, the frequency of communication to monitor. And during COVID, people who were supposed to talk to each other never did, right? For us, for example, the delivery and sales teams. Then when you were upset, have you ever written a mail when you were angry? How many people? Okay. So it is definitely different from your usual tone. It doesn't say dear, harsh, it doesn't say anything. And the AI coach recognizes it and says, hold on, are you sure you want to send this? This is not you. And therefore it just reduces the tension in the system. Because during COVID and even post-COVID, the system tension was huge. And this is all, again, AI driven, and if you'll see this, that's what comes up if you write something which is not your style. It also recognizes and rewards people, okay? So it's a way of non-intimidating way of rewarding people. And it's a tendency when you're upset, you say, abhi main respond karta hu is mail ko. I don't like this, something like that. So this will not let you send it. It'll let you think again. And that 30 seconds to think makes all the difference. And therefore the system and the mood in the organization comes down. And remember, this creates a huge difference in the way an organization works, okay? This thing that you see is called a wellness robo or a wellness buddy. It runs around, and there are many of them, and they run around all our offices. What does it do? It actually has conversations with you, right? It actually nudges you for various things, tells you a joke, but also keeps monitoring your parameters. And it can tell you that you are not, it can alert saying something seems wrong. And these are so cool, they're just like it's this much. I mean, the size is so small, and it keeps running around all our offices. And this was developed in-house, and the reason we developed is it's very difficult for people to constantly monitor other people. And then you need a break, right? So this wellness buddy just sort of moves around, starts a conversation, has random conversations. Again, we actually got this after COVID, not during COVID. In COVID, we had our humanoid, but this came right after COVID because we recognized the fact that people were still under a lot of stress, a lot of tension. They didn't know what was happening. When people came back to office, by the way, very less people coming to our offices, but whoever came had many questions. And this could, identify some emotions that were contrary to what the physical emotions showed, okay, the physical body showed. So this is, again, something that we use. Again, technology as an enabler. Movements of truth still human, okay? All to do with wellness using tech. Well, this is something we introduced again 5 years ago. This is our yoga bot called Asana. The reason we wanted to do this is, for somebody like me who wears a suit every day, very difficult to do yoga suddenly, right? So we said, but we wanted people to feel agile during the day. So what it does is, it's a very nice looking bot. It pops up the first time you open your computer, and for 30 seconds it wants you to do some asanas, which are just, you can do it sitting, right? And then the second time it pops up, it's one single time everywhere around the world at the same time. So if you ever enter a TechM office and see everybody sort of doing something funny, it's because of this yoga board, because at the same time globally this happens, okay? The first time when you open and the second time, and what it does is this 2 30-second break makes a huge difference to what you're doing. And you would actually see our CEO also get up and do some asana in the middle of a meeting, because this is something that breaks the whole sort of seriousness of what you're doing. We also, as part of our wellness, which is holistic, both mental and physical and emotional and social, is what we call 101 challenges. It's actually an app-based wellness. What it does is there are various things that happen, including, say, walk 100 kilometers over the next 7 days, or take a virtual marathon in your homes, right? So which means you run across the home and see what happens. And then there is leaderboards. There is a lot of thing on social media. So if you ever go on social media handle of TechM, you will see a lot of these challenges put on the social media. It's really exciting. It's very simple to do. People can do it in their homes. And of course, you can see that there's a lot of benefit that folks have got through this program. The good thing is there is also counseling, expert advice given in the program through this app. So actually, if you have issues saying, okay, listen, I've just had an angio, can I really do this? It'll instantly give you a suggestion whether you should or not. A quick glimpse of what happened during the pandemic. TechM stood out as a company that was really stood for its employees, families, and communities. Some of the things that we did, obviously, apart from the vaccination, the help desk, etc., we actually opened intensive care units in about 11 offices in India, and then many offices around the globe, which had everything, including an ICU kind of facility. We had tied up with Fortis at that time, and I can tell you we saved about 550 lives, would have lost them had they been outside, right? The reason it was important is we had competition with us. We had people from other IT companies, journal communities, people who we didn't know. This was completely free. When remdesivir was not available, this had everything, including remdesivir. And I'm going to talk about COVID technology, but the other day, and I always give this example, there's a lady who walked in and gave me an envelope and just said, okay, I just want to give you this envelope. I thought it was a resignation letter and she was working somewhere. But when I opened the envelope, she said she was the wife of one of our employees who had passed. And when he passed away, it was, I think, in May or June. He was promoted in April to the next band. But obviously, the insurance companies work from Jan to December, they said, we'll give you the insurance amount of that previous band. And then we just gave the difference, which was about 3 times, okay? And we forgot about it. Now this letter said, this lady had written saying, whenever I look at my 6-year-old son, I pray to God and say, thank God my husband worked for a company like Techem. And that stands, it's on the wall of my office. And to me, that defines whatever we did for COVID, and this is huge. The one thing that made a big difference is the technology, and I don't know if I have it here. Yeah. We had something called mHealthy. You know, how many people did a RT-PCR test during the COVID? Yeah, all of you did. You didn't have a choice, right? But RT-PCR test was 65% accurate, and it was a pain. So for example, I attended office every single day during COVID, but we had a box called mHealthy. It was an AI-driven tool. With a prick, it could determine whether you are positive or not to 98% accuracy. The reason it was 98% accuracy was because it was AI-driven. It had about 1.5 million data sets. We did it every day for our employees. It took 5 minutes to get the result, exactly 5 minutes, and it kept everybody safe, okay? We also, of course, then extended it to other companies, like your pizza delivery companies and other companies actually took this mHealthy. But again, we used technology to do something more accurately for our families. The biggest concern, the biggest issue on mental wellness was you didn't know whether you were positive or not. You know, the cases that were not clearly, if you're not coughing, people thought you were okay, and you know, you never knew. So this is something that worked very well for us. We actually made use of this, gave it to communities. We did a lot of stuff for communities. This small box, which was probably a foot by half a foot, you know, could do multiple times the diagnostic. We also had something called EAP, which is really 24/7. A lot of companies had this, but this was counseling available for personal and professional reasons. And this still continues. You'll be surprised at how many people use it. I personally was surprised because we thought that, you know, after COVID, people don't really use counseling. We have hundreds of people using every day. And this is quite surprising because, you know, COVID is gone and the memory is gone, but the aftermath still lingers on. And that's the other recommendation that I have for all of you. Don't think that the stress is gone. It's still there. And people need the same kind of attention that they had during COVID. This is a very interesting service we have. It's called Mind at Ease. We do it through our foundation. It's the Uber of counselors. So consider it an Uber of counselors, which means it connects counselors to the people who need it. It's nothing to do with TechM, really. Anybody can use it. But if you need a counselor, this connects you to the right counselor, and the counselor gets connected to the right patient. It's like an Uber service. And this is basically for the wider community. Again, something that is very popular amongst folks. Now, this is an interesting tool. I have a small video for this. This is called Be Me. We call it feed forward because every time in your company you have feedback, right? And people don't like to get feedback from folks they don't trust. So this connects to people you trust, and you can actually get feed forward. Even when we are launching a new policy, this is used, right? So it's constant feed forward on various things, including your behavior, your etc., from the folks that you trust. Because you may not trust your boss or somebody else's boss, but people who you trust. And we get inputs on everything that we want to do before we launch, not after we launch. So this is called feed forward. So again, use of technology to help employees in their well-being. The next one that you see is the meta world. And I don't know how many people get confused what is metaverse. I can tell you it's not that complicated. Metaverse is a physical and a digital combination. When your mothers and grandparents used to write letters by a pen, post it in a post box, somebody used to receive it and read it. Then you started sending emails, somebody used to open and read it. Meta is a combination of both. It's an immersive experience which really eases the mind. Okay, it's a great experience. If you haven't experienced metaverse, please do. It is an immersive experience. You're there. So we've pushed it in recruitment because I talked about recruitment process to you. It's really intimidating because you have to wait till the boss comes out and meets you. Here, nobody has to wait. I can do interviews with 100 people simultaneously and they can ask different questions and they will feel me there. And so this is just an example of what happens in metaverse. Again, the whole experience is very different, and there is a report that comes out of every candidate who's gone through this, right? And therefore, when people join us, we actually do a survey after 6 months saying, what was your experience? What did you feel? And a lot of times we said those AR, VR sets are not friendly, right? It's always, if you're a Sardar like me, you can never wear them anyway. But otherwise also they're not very friendly, and this is really very, very, very immersive. So some non-negotiables on our wellness before business, core values, part of our core values, dignity of an individual. That's why I said everything is N is equal to 1. All senior managers as part of the BSCs have wellness. And if you don't have this, then it's really an eyewash, right? Wellness is important because, remember what I told you about facial recognition? Every day we know what's happening in various teams. When I talk about diverse cultures, we are the only company that has 12 active LGBT communities. Active. We hire 60 LGBTs this year alone, okay? But it's also about being diverse, nationalities, neurodiversity, gender, age, thought. And that impacts, because remember, we are a company that still looks very Indian all across the world, right? But you have to behave differently. Otherwise, there is a serious issue that comes up for the nationals that work with you. Similarly, age. Our company has a lot of youngsters who run large projects and they have like people three times their age reporting to them. How do you deal with that? It's still very difficult. So this is a non-negotiable for us. And of course, harassment, microaggressions, we have strict policies against microaggression. Microaggression is something you can't recognize instantly. But we have a strict policy against microaggression all across the world. Finally, I know I'm running out of time, so what are the lessons that we've learned? Personalize. Don't tell me that it's an IT company, that's why we're doing it. I can tell you we had nothing. It is much cheaper than having a single person running it. So personalize. It's all about mindset. You have to change a mindset of wellness. And if you still feel it is a nice thing to do and not a must to do, it will never work. So have a culture. So it's a mindset of culture. Leverage technology wherever you can because, that's the only way it will work every time. Celebrate the wins and then repeat the celebrations. Obviously, you have to track and measure everything. If you don't measure wellness scores, it will fall. And that's the job of Meghna, who's our wellness officer. And empower employees on the ground to run them. Every time they have to come to you for an approval, it's gone. Okay. Various ways to listen to the employees. We have something called CARE, So if you write to me, if you write an official complaint apart from the posh complaint, if it is not attended to in 10 days, it escalates to the next level, then next level, then next level. It's all automated. So somebody has to reply to you within 10 days. And what happens is then this is analyzed every day, so people have the power to speak up because they are listened to. You don't have to respond to you don't have to solve everything, but you have to respond to it. Similarly, for free voice, if you go to TechM Free Voice, you'll see a lot of things that people say anonymously. Just to let you know, our MCare score, which is the engagement score, shot up by introducing all this from about 4.04, which was the highest ever, to 4.58 this year, which is an enormous increase. And some of the people's credit to the openness in the environment and the care that people give to them and their families. So it's an important thing. We won a lot of awards that I was telling Preeti again, sharing with her. Brandon Hall and Stevie, we got 10 each. It's an award from the US on wellness. We have now been recognized across the globe as a benchmark. These are not important except the fact that when you're attracting talent, talent looks at this. And when you're retaining talent, talent looks at this. And we are not the best paymaster by any length of imagination. Okay? And as I said, we are the lowest attrition in IT, and well, IT is pretty high on attrition. The two awards that I want to talk about really are the Brandon Hall and, of course, the Great Managers Award 3 years in a row from Economic Times. And, of course, the Stevie Awards, which were really on our pandemic response. And these are not Indian awards, these are global awards. So that's all I have. Thank you very much. I wish you the very best in your wellness journey, but remember, it is no rocket science what we do. It is very simple, not expensive, but use technology because it ensures repetitiveness of whatever you want to do. Okay? Thank you very much. Thank you.
Thank you, Harsh. I think all of us had some great insights. Some things that surely struck a chord with me, and I think will be very relevant considering these are some of the conversations we keep having with everybody. First and foremost, of course, wellness or well-being cannot be a separate agenda. It has to be part and parcel of everything that you do and integrated into each and everything that you're doing. Second and most important, technology has to be the enabler, but moments of truth will always be human, and how technology can be leveraged. We've seen some great examples of that. And last but not the least, ensuring consistency and adoption across the board, especially for an organization of that size. It's very important that at every layer, which is your managers and their managers, also adopt this as part of their goals and their responsibilities. So with that, we'd love to open this up to our audience for some questions that you may like to ask Harshvendra on anything that you
There's a question there. There's a question right there.
And we'll have some mics. We can start from there.
First of all, thank you, Harshvardhan. I think it was really interesting in terms of how you looked at the entire aspect and life cycle of well-being, right from beginning to, of course, measuring the results. Okay. Two specific things that I wanted to check with you on. So number one, you spoke about is how to change mindset of managers to balance productivity and well-being. The second aspect that you spoke about was also in terms of democratizing the well-being, allowing employees to create volunteer. Could you just expand on these two things, any specific initiatives and any challenges that you faced?
Oh, huge challenges, firstly. You know, when you talk about wellness, I don't know, can you hear me? When you talk about wellness in a context of the business that we were in, you see when pandemic struck, a lot of our business was impacted. Now you could choose to say, okay, you know, I'll just do the normal vaccination camps and stuff like that, and that's it. But we said, no, we will spend. We, by the way, we also gave about 50 oxygen plants. And we spent a lot of money, but not more than money, a lot of executive time on taking care of employees, their families, communities at large, right? Competition as well as our customers. That set a clear agenda. But prior to this, obviously, Mindset changes because everybody is a busy person. Company, everybody is busy, right? So wellness, is it really important? In India, by the way, people didn't even recognize mental wellness. So the first thing is to get them to say this is real. And we gave enough examples. The biggest thing that you saw on my slide was psychological safety, to speak up, to say, I'm not okay with this. And therefore, how you do it is through BSCs, through other things, through measurability. The fact that we could measure it every single day was important. But clearly it was a culture. If you want me to define in one word, it was not easy, but it was a change of culture, where HR was not driving it, by the way. Right? HR was facilitating it. It was not like saying, oh, doctor aa gaya, HR walon ko bola jara kar de. Nothing to do with HR. It's to do with the leadership of the company, and led by, in our case, CP, who's our managing director and CEO, every single day. And you don't have meetings on wellness, you have wellness in every meeting. That's a mindset change on how we actually achieved it. It's not been an easy journey. What was the second part?
The second was a point on empowering employees to identify and build well-being programs.
Yeah, so we have a program called Josh, which is really self-directed work teams. From everything, when our customers visit, they do the music, they do the. So it's a group that follows their dreams, from jumping off a plane to doing music to do whatever they. It's managed by them. There is no management interference. They just have a budget and they manage. So wellness was put there. If you saw that lower layer of 5,000, that was the Josh workers actually. And then you had to have 15,000 managers or people managers, because they have to support these 5,000. Otherwise, they would spend time on wellness, and at the end they'll say, "Tune kara kya hai, boss? You were always missing." We also give people time off officially to do these things and recognize it in their BSCs finally. And we reward them for that. So it's, again, in one word, a culture change. And not easy at all, even today.
First of all, I would say compliments and excellent presentation, sir. My name is Bani Khurana, part of the Reliance Retail Group. You spoke a lot around counseling. There were a lot of discussion points around that. So my only question is that as a starting point, when you started with this counseling service in a corporate environment, how did you ensure that the employees developed the faith, as you, kind of evolved around this journey, especially on the discretion front? Because an employee talking about his personal problems at work and confiding and, thinking that this will be kept confidential is a very, very difficult thing. So how did you deal with that?
A great question. And remember, I'm not talking about India.
Yeah.
So outside it's even, you sneeze, it's discriminatory, right? So the first trick was we did both personal and professional. So people were going through serious personal challenges. They were open about talking about that. The counselors were 24/7 and they were outside. At 2 a.m. in the night, you could call up and the counselor would pick up. And the problem is we have counseling, but it's 9 to 5, only 2 counselors. When you need somebody, they're never available, right? And that's the problem. Now, if you had a problem and you called and somebody picked up and said, "Don't worry, I'll speak to you now," it gave people confidence that they were able to speak. We never interfered in we never tracked anything. And surprisingly, we saw a lot more personal counseling happening than professional. Even during COVID and even now. While occupational safety through BME is being addressed, but massive personal issues. The husband was home, the wife initially liked it, then she said, "Boss, kab ja rahe ho office?" But he was not going to office, it was a serious problem. The kids home, 2 bedrooms, 4 people, what do you do? So it's all real, and it's happening today too, because the hybrid is going to stay. And therefore we started with all addressing that first. And then we came to professional, and it just sort of spread because the quality of input they got was very good. And we were surprised at the numbers. I told you, I was personally completely surprised and taken aback, saying, this is happening here. I mean, I could imagine US में होता है, बाकी होगा, but India, so many people.
All right.
Yeah.
Can we have the mic here? And somebody on this side of the room as well. I have a question here.
So, sorry. In the moodometer, generally after an initial excitement of first month, third month, it dies down. So what has been your experience and what's the most sustainable or consistent mood that you have seen?
No, it never dies down. Remember, if you are in Mumbai, some of you have had a fight with your spouse. And you come in and that will show up. Whatever you do, it will show up. And some of you have had a great experience, that will show up. But overall, remember, for example, it is every single day. About 2 months ago, Hyderabad dipped. Hyderabad is a great location it's got 30,000 employees. It dipped. And I said, what the hell happened? And we realized there was a local election and we didn't give half a day off. So it just shows. So instead of reacting after, instant reaction happened. Because it's instantaneous. And people are clear that their name is not, because it's GDPR compliant. We don't store any data. It gets deleted the moment it reads. And you can only have a cluster. So you will never know Harsh's mood. But you'll know something has gone wrong. So excitement continues. I mean, and imagine you put yourself in and say, when you carry your ID card and swipe everything and you forget today, ID card bhul gaye. Those things are not anymore there. And I can travel to any part of the world and it will recognize me. Any part of the world. So the whole experience is so pleasant and it's so simple. And it's not complicated, and I know that everything is done. The initial problem was people didn't know, okay, actually the moodometer, as you look at it, is done. But people said, how do I know that usne mera recognize kiya? So we had to actually put that yes button just to make them believe that it's done. Actually, the moment you look at it, it's done. So you say in, it says welcome. That's not needed actually. But we say that because, it's a affirmation, okay, ho gaya tumhara attendance, don't worry. But we've seen a lot of changes in moods across various units and in buildings. Forget that. If your cafeteria is not serving good food in one of the buildings, you'll show up. 100%. And you can investigate real time rather than looking and saying, I will do a survey in the next year and we'll know how the mood of the company is. Doesn't work, right? And people know that they are looking and people know that something is happening. And if you don't take action, then also it's a waste of time. But the experience is pleasant. And that's what makes it. And we have to follow a process. There is a written statement of people saying, yes, I want my mood to be taken. For example, if you say, no, I don't want my mood to be taken. So it will just capture your attendance, but not your mood. It's so intelligent that the system can actually disregard you for the mood and only capture your attendance. So it's up to you. It's personalized.
I think we'll take one last question.
Hi, I'm Sneha. I lead the engagement and wellness at India Infoline Securities. I must say you are a case study in wellness. I just want to know that, especially in the times of manpower optimization and when the negative sentiments are too high, how then do you promote wellness when employees' colloquial statement can be, oh, you have money for this, but you are still optimizing manpower. What kind of approach would you have maybe that time?
I love the word you use, optimizing. You mean downsizing, right? Optimizing can mean also adding, right? Okay. It's a reality in our industry, by the way. It's a reality, right? Just to let you know the impact, we hire 15,000 people a quarter. Okay, that's the size we're talking about. 15,000 fresh additions happen in every quarter. It's about, say, standing up and saying, what's your priority? It's like D&I. People say, acha tum wahan pe itna paisa kharch rahe ho. It's your priority, and it's an open conversation with whoever wants to have a problem. And our free voice is full of this. But remember, when they started using things and they said, arey, this seems to be working for me. But will you have some naysayers? Obviously you will. But if it's a business strategy, then there is no problem, no? Imagine we actually presented to the clients and we won deals. And I can't name the deal, but we won it just because of this. Because I said, wow, you're a company that cares. You actually care. And it's not easy, again, as I said, there are many contradicting priorities, but this is we're not talking about great amounts of money, na? We're only talking about great amounts of commitment. And commitment of the management team together to say, we will create something magical. And it helps. Today, my attrition is 3% lower than a company that has never been beaten in their lives. And we 3% lower than them. Suddenly, everybody's saying, ye kya karte hain? And I can tell you, a lot of HR heads have come to me and said, what do you do here? When the great resignation was happening, we were going down like this. If you see our track record of quarterly attrition, 8 quarters we've come down, 8. And everybody's going up like this. Something else has to matter, right? I mean, I don't know if it was only wellness, but one of the factors really was this. Because people didn't want to go to another company and said, wahan pe ye nahi hoga. I'll get maybe ₹1,00,000 more, but if I need my family, for example, we have an AWT where we give 5 lakhs money without asking a question. It's a trust for medical reasons. No questions. Your salary could be 3 lakhs, but you'll get that 5 lakhs. So various things on thing, but commitment is important. And you will have naysayers. I mean, if there, what's the point in doing something which is not going to be difficult to implement? If it is really, the mantra is, moments of truth are always human. And our credo is human experiences. And you know, IT, it's very easy to say I'm using AI, blockchain. We never say that. We say we use a solution for human experiences. It could have whatever. And the other thing, finally, I would say, is people start believing in your own solutions because they see it. Otherwise, they don't see it. How do they know what you sell to the customer? Now they know what you sell to the customer because it's all there. That's why tech helped us internally.
Okay, I think we have time for one last question our team tells us. Can we pass the mic here, please?
Hi, Harsha. I'm Natasha Chandar. I lead the engagement for IIFL Finance. One question regarding how do you promote the internally the employee assistance and like you spoke to the assistance program, etc., that you do as a part of your wellness. That's one part of the question.
Okay, so basically, see, everything is done differently. How do we communicate? That's an interesting question. So we don't send mails because we know nobody reads mails. 88% of our 163,000 people are either millennials or Gen Z. 88%. So we have to do the cool things of sending them Insta messages and WhatsApp messages and Twitter replies. And if you go to our social media handle and my social media handle, you'll see everything there. Insta handle, because we have to communicate with employees in their language. And of course, there is mails and other stuff, but we do, gamification is a big thing for us. For example, even our values is done through a snakes and ladder game, which is online, obviously. So we try and gamify, make things interesting, but we still have a long way to go. Let me be very clear. We are just not perfect, or we are not even close to it. But what we are trying to do is do things differently. To talk to you in your language. You know, if I send you an email, you'll say, "Acha, main padhti hu, dekhti hu." But if I send you a WhatsApp message, you'll see right there. Or an Insta message, or an Insta post, or do things which you're interested. For example, when people get interested in sports or adventure, we do things there. And we tell them the value of everything. So for tying up for your, any cool gadget that comes in to say, okay, if it promotes fitness, we will take 50% of the cost. But you have to use it. And you have to walk 6,000 steps a day. Now that shows commitment, but people like it, right? Oh, I get a watch. But actually you are helping the wellness quotient of the company. And yeah, I think we can do better on communication, to be honest. We can do better. But remember, our challenge is we have to speak so many languages. Everything has to be deciphered, decoded, translated. And therefore, short messages work best. Any training program is not in a room. It is measured very differently. We've stopped measuring training many years ago. We only measure impact. So I think we're just trying to do things differently, but communication through, and Meghna does a great job because she's a 26-year-old talking to people. They listen to her. And she will come and sit with you and say, okay, what are you doing? And it's non-threatening, right? She's like, and she's like you too, which is like the lowest. But she runs globally wellness. And when we appointed, people actually laughed, "Ki tumne global wellness officer." And a 26-year-old, why? And we said, that's the only reason why it will be successful. Because if it was a 52-year-old writing mail, it would never work in our company. Culture is like that. So we're trying to do things differently, but I mean, I wouldn't say that there is not a long way to go there. Communication is still a big challenge because we have to also be very clear on cultures, right? Philippines, we did a lot of work when there were earthquakes. We did a lot of work when they were in Indonesia, when there was, this tragedy. We did a lot of work, different things, right? So you can't just say only we are India-centric then, right? And volunteering is really the way.
Just the second part of the question. Can you speak to the 15,000 people managers whom you had kind of,
Sorry, do you speak to?
Can you speak to the point which you made on the 15,000 people managers whom you had kind of trained to support the wellness initiatives?
And they are recognized for it. Remember this. Whatever they spend time here is being recognized. So I told you that we are also, great people managers with 4 years in a row. Those guys are sent for this. And people who spend time with their with their employees, talk to them. If you don't recognize them, then people will say, "Kya farak padta hai?" So ultimately, they are also being called and having chats with CP and me, and we recognize them. COVID warriors are recognized in a very different way. Promotions. This is taken into account. So people see value in doing this. And it's not just, "Theek hai, chalo, kar rahe hain." And I think that's an important thing, because if people are spending time, and this is important for the company, then you have to recognize it formally and informally both. Only informal is not enough. Thank you.
Thank you very much, sir. Continue to be with us on stage. Can we please have Akshat join us on stage as well? Since its inception, Mahindra Group's philosophy has been Rise for Good, and Tech Mahindra's culture, which promotes rising awareness towards wellness, perfectly embodies this philosophy. So we have a special memento that we request Akshat to hand over to you, Harshvendra. Thank you so much for joining us, for helping us understand how the leaders and people at Tech Mahindra have created a well-being first culture. This was lovely. And thank you, Akshat, for anchoring the question session. Ladies and gentlemen, quickly to remind you, you need to go ahead and scan the QR code behind the agenda and give your feedback for this session. Thank you so much. Thank you. Ladies and gentlemen, please put your hands together. Harshvendra Soin, thank you. Well, we hope you all got a chance to experience and explore the booths in the pre-function area. In case you haven't, don't worry, because we're going to make sure that you get a chance to right as we step into the lunch break. So this is a surprise. What we're going to do right now is we are going to be breaking for lunch, ladies and gentlemen, because we looked around and we were checking out your emotional quotient, and we thought lunch should definitely be the way we step forward. So that's what we're doing. But everybody remove your cell phones. This time around, I need you to be serious about the alarm. So everybody, cell phones out, quickly. Put on your alarm. And we're going to 1:55. Everybody, quickly. Remember, all the alarms are going to go off together. We don't need the hotel's bell to tell us to enter. You don't need the mic. You just need to know that the alarms are going off. Everybody, 1:55. Are we good to go? Step into lunch right now. Thank you so much. Enjoy lunch, and we'll see you back here at 1:55. We've got an amazing experiential session coming on. Go ahead and also check out Step, Set, Go. We're going to have the leaderboard showing here when we come back. Collect your steps, make sure you're moving, and enjoy lunch. We'll see you back here shortly. Ladies and gentlemen, good afternoon. How you doing? We can see some familiar smiles because we're getting used to looking at the audience and I'm getting used to seeing you where you're at. And that's always nice. It's nice when you also shift space and then I get a chance to see your smile kind of blossom in another space. So everybody, welcome back. It is this post-lunch session and it's not going to be conventional. We're not going to start out with a speaker saying we hope that we can keep you awake because this session is going to get you completely immersed. So everybody who's in the pre-function area, I invite you to kindly join us right now. And as we move forward, a quick check-in. Have you been able to scan the QR code behind the agenda and make sure that you've given your feedback for all the sessions that have happened so far? Loving the thumbs up. Thank you so much. All right. And while that is happening and while we're getting ready, you know, we just had an amazing session just before lunch, right? So when everybody's coming in, we had Harshvendra Soin talk to us about when you open up the laptop, the first thing you do for 30 seconds is you do whatever asan comes up there. So everybody, I'm opening up our stage laptop right now. Everybody, if you can stand up. Stand up. And for the next, not 30 seconds, all right? I'm not going to be like the Yoga Asan app, but everybody reach on up as high as you can, reach with both hands. And you can make some noise if it's like tough stretching up. And up on your tiptoes, come on your tiptoes. Last, you can count down with me, 10, 8, 6, reach up higher, 4, even higher, 2, all right, good job, you everybody, feeling all nice and stretched. Put your hands together. It's always nice to applaud yourself, you know. That's what it's all about. Take a seat right now. The energy has gotten a little lighter. And I'll tell you why we are talking about getting into an experiential session. Because the session that's going to come on right now is a session on movement and movement therapy. Okay, so we have with us one of the co-founders of Creative Movement Therapy Association India, that's CMTAI. She's somebody who brought dance therapy into India and has been making sure that it reaches different communities, different stages, different countries. It's completely experiential. And it's wonderful to have with us somebody who has been immersing herself in this therapy. It's called Creative Movement Therapy, and today she shares it with all of us. So for the next couple of minutes, it's going to be immersive, and we invite all of you to make sure that you're deep diving into this time. It's really close to my heart because this is a therapy that I completely believe in and I share as well. But right now, quick question, everybody. On a scale of 1 to 5, if 1 says I'm feeling low and heavy, and 5 says, I'm feeling happy and excited and light, where are you at? Are you at a 1, where you're really feeling low? Are you at a 2, where you're not that great? At a 3, where you're pretty neutral? 4, where you're closer to feeling happy and light? And 5, where you're really feeling on top of the world? Where are you at? Close your eyes for just 5 seconds. Quickly check in. Where am I at? Where am I at? On a scale of 1 to 5. And raise your hand up. I'm just going to look around the room quickly. Everybody, where are you at right now? Are you at a 1, a 2, a 3, a 4, a 5? All right, looked around the room. Thank you so much. Right now, it's time for us to go ahead and welcome on the stage someone who has been making sure that wellness is a part of the lives that she touches through movement therapy. Please welcome on stage the wonderful Tripura Kashyap. Absolutely a privilege and an honor. Huge round of applause, please.
Hi, everyone. So like Keisha beautifully said, this is going to be an experiential session where you're going to experience what movement therapy is. And the whole idea is not to talk about it intellectually or academically, but to actually experience it in your bodies. Why? Because movement is something that's really primal to us. We were born with movement. That's the first thing we did in our mother's womb. We moved, we kicked, we somersaulted. We were so adventurous with movement. But as we grew into adults, slowly the movement disappeared from our bodies. We became alienated, we became disassociated from our bodies, and thanks to our smartphones, the movement that I actually see is just at the tips of our fingers. Yeah? So the rest of the body has kind of gone into oblivion. So today's session is about reclaiming movement back into our bodies. Yeah? And I feel like movement is our universal mother tongue. Everyone can speak it. And movement can get you to be creative, it gets you to express yourself, and it's therapeutic. Yeah? So you'll notice what I mean by creativity, expressivity, and movement being therapeutic. And we'll take you through this. We'll take you through a small session of movement therapy. There are no rules because in this session, you are going to be creating your own personal movement language. So there's nothing like a wrong movement, and it's a non-judgmental experience. And we here have two beautiful dancers, in fact, Shambhavi and Kisha, who will be demonstrating some of the activities for you. I call them activities and games. And you don't have to imitate them, but it's like a takeoff point for you to experience your own movement. Okay? So we're going to start with a very small warm-up to just wake up the body. Yeah? It's going to be very slow. It's going to be because we've just had lunch. And we're going to start with a very small warm-up. And Shambhavi, Kisha will be demonstrating for you. Yeah? And I'd like all of you to stand up, because that's the only way that you can experience, the whole body. So can we have everyone standing up? And let's begin with the head. Yeah? Just moving the head very slowly, the way you feel like. And go onto your shoulders. Find different ways of moving your shoulders. Just move it the way you feel like. And go onto your elbows. Find different ways of moving your elbows. You don't have to imitate them. You can do your own movement. And go onto your fingers and your wrists. And now move your upper body, every part of your upper body, your hands, your elbows, your wrists. Yeah, just your upper body. Just go with the music. Just flow with movement. And go on to your hips. Find different ways of moving your hips. Remember, hips don't lie. Yeah? So find different ways of flowing the movement through your hips. Yeah? And go on to your knees. Find different ways of folding your knees maybe, or dipping into your knees, whatever you feel like. Remember, it's your movement, yeah? You don't have to imitate them. So just your knees. And go on to your feet. Find different ways of moving your feet. And now move the whole body, every part of your body, your hands, your nose, your hips, your elbows, every part. See if you can move every part of your body. No one is watching you and you're not watching anyone. You're just in your own space. Okay, all right. Thank you very much. Lovely. Thank you. So that was just great job. Yeah. So that was just the first part of a movement therapy session. This is how we begin a movement therapy session, by just waking up every part of the body so that the body gets ready for movement. And I don't know if you've heard, but the mind and the body are interconnected, right? That's where the word psychosomatic comes from. So when you do something with the body, it also affects your mind. Yeah, it opens up the mind also. So the way I got into dance therapy was because of my brother. He was on a wheelchair with cerebral palsy. And I used to be a dancer at that time. I learned Bharatnatyam, Chow, contemporary. And I used to look at him on this wheelchair and wonder, how can I get someone on a wheelchair to move? Because when he heard music, he would literally jump out of his wheelchair. He would jump even without having any movement in his body, or he would twist, he would turn, he would bend, and he'd have a lot of fun with the music. So that's how the whole thought process came to me, that dance could be used with people with special needs, on a wheelchair, people with mental challenges, physical challenges, etc. And much later, I realized that even the so-called normal functioning people need movement in their bodies. And even the so-called normal functioning people have problems with body coordination. They have problems making eye contact with each other. They have problems making, being very self-aware of themselves, emotional expression. So this was really interesting for me, that even so-called normal people have so many body-related issues. And that's when I started training people into dance therapy. And to this day, it's been my passion, it's been my profession, and it's really helped me grow a lot. Yeah. So the second activity we're going to do is a lot of fun. And of course, I'd like all of you to try it. Again, they're going to be demonstrating, but they let you loose on your own. It's a very simple idea. Let me find the music. All you have to do is follow your finger with the upper body. That's all you have to do, okay? So let's see how they do it, yeah? So they're using their upper body to follow their finger. Okay? That's all you get. So now, remember, sitting is the new smoking, yeah? So let's all get up and try following your finger with the upper part of the body the way they did. Let's go. Don't imitate them. Do your own thing. Use your upper body to follow your finger. And the next part of this exercise is where one person is the leader and the other person follows the finger of the leader. So just watch, and then you can do this with a partner next to you. Yeah, see how she's challenging her partner to move? Very nice. Okay, so find the partner next to you, and one person is the leader with the finger, and the other person moves the body with your finger. Let's go, find a partner. Ready? And try to do this without talking, okay? Let's go. Go. And now you can have your revenge. You know what that means. Go ahead. Change partners, change roles. And now, just watch both these beautiful dancers. They're going to follow each other's fingers, right? So, Keisha is going to follow Shambhavi's finger, and Shambhavi is going to follow Keisha's finger with a body. Go. Okay, all right, back to you. Follow each other's fingers. Okay, all right, all right. You can sit down now. Very good. Please sit down. Take a break. So this is what we do in dance therapy. We encourage people to explore their own movement language that they already have in their body. Yeah? And this is called creative movement. So creative movement is all about throwing away judgments. It's about really exploring, tapping out the movement from your body. And it's about expressing emotions, it's about expressing stories through movement, but to begin to build and develop movement language. So usually when I work with people, whether it's in a corporate setup or whether I'm training people, I take them through 5 stages of movement development. The first stage is called movement seeding, where you're seeding movement into people's bodies. The second stage is called movement development. So they develop, they explore the movement. The third stage is called movement expression. They begin to explore what we talked about today, anger, sadness, fear, laughter, different kinds of emotions. The fourth stage is called resolution, where when there's a problem, so suppose someone has difficulty saying no, the whole session is about saying no to each other through movement, and then finally through the voice. So the fourth stage is called resolution, and the fifth stage is called integration. So whatever you're learning in the session, can you take it back into your real life? So this woman who couldn't say no, but she found her voice in a session, was able to go out and say no to people that she wanted to say no to. So these are generally the 5 stages through which we take people through. So it's not that I suddenly put on music and ask people to dance. They freeze. So I do something called structured improvisations, just like what we did. Follow your finger, etc. Okay? So the third one is about, the third activity we're going to do is based on the third part that I talked to you about, movement expression. I believe that each part of our body can express itself through movement, not just move, but you can say something through different parts of your body. We are doing that all the time. Believe me, we are all talking about body language. It's a buzzword these days. We know that 75% of our communication is through our body language. But what are we doing about it? We are not. We're not doing anything about it, right? So this is your chance to kind of really work on your body language and help the body to get expressive. So in the next activity, they will face each other. I like to call this body talk, okay? So when I say head, they talk to each other with their heads, yeah? There's no voice, it's just heads. They're finding different ways to communicate with each other. And when I say shoulder, they're communicating with their shoulders with each other, yeah? So this is what I'd like you to do. I'd like all of you to get up, find a partner, and I'll lead you through the activity, yeah? Are we ready with a partner? Facing your partner? Okay, let's go. So let's begin talking to each other with your head. Okay? Just the head. Music, please. Okay, use your shoulders to speak to each other. Use your elbows to speak to each other. Use your hips to speak to each other. Use your knees to speak to each other. Use your feet to speak to each other. Use your whole body to speak to each other, every part of your body. Okay, all right, you can sit down. Very nice. So yes, in the beginning it feels a bit awkward maybe, but you know, there are a lot of people who come into my workshop saying, you know, we have two left feet, we can't dance, and they just want to sit and observe. And of course, I don't allow observers. because you can't observe and train at the same time. You got to experience it in your body. And finally, when people do experience it, after one day, they can't stop dancing. They've got the dance bug in their body. So even when I ask people to walk, they dance walking across space. So it's really about just, like I said, reclaiming movement that your body has lost. Yeah, that's all we're doing. And there's nothing like a wrong movement. Everything you do is your movement. Yeah. The next thing we're going to do is something called paintbrush. It's a very popular activity in movement therapy. The whole idea is that space around the body is divided into 3 levels, right? The high level, the mid level, and the low level. It's also divided into directions: front, sides, backs, diagonals, etc. So this is like your personal bubble that you're moving with. And most of the time when I ask people to dance, they're dancing in a very small space, in their own comfort zone. So the idea of the next exercise, the paintbrush exercise, is to really paint the space around the body, paint the floor, paint the lower levels, paint the mid levels, paint the high levels. And then you slowly notice that your range of motion is expanding. It's from here, it's becoming this. Yeah? So that's the idea of the paintbrush. I hope you really have fun doing it. Let's all get up and I'll take you through it. It's a lot of fun actually. Yeah? So to begin with, what I'd like you to do is maybe just use your right hand to paint the space around the body. Yeah? The different levels. High level, mid level, low level. And now use your left hand and see what's the difference between the right and the left. Don't forget the levels and the directions. And this time, close your eyes and paint with both your hands. See what that feels like to dance with closed eyes. Open your eyes and paint with your legs. You can hold on to your chairs if you feel like. Close your eyes and paint with every part of your body. Your elbows, your nose, your head. Paint with every part of your body. Open your eyes, face your partner and paint with your partner. You can go around each other. You can go around each other. Have fun. Yeah. That looks beautiful. And now let's shake the paint off our bodies. Shake every part of your body, okay? I'll find the music that will make you shake. Yeah? Let's go. Shake every part of your body. Shake away with your partner. Okay, all right. Thank you so much. Wonderful. Yeah. So, yeah, you can sit down, take deep breaths. As you sit there, just relax, just chill, listening to me. So, why do we dance? I feel dance is a great, very natural antidepressant. Yeah? It just puts you in a good mood and you don't know why you're in a good mood. And I love that. I love being happy without a reason, you know? So whenever I feel sad or depressed, I just put on music and I move. And I don't have to tell myself I'm doing a sad dance or a happy dance. It just, whatever is blocked in your body flows out through movement. So one of the things that I'd like you to think about is to create 10-minute movement rituals for yourself. Every day, for 10 minutes, put on whatever music you like and just dance to it. And I promise you, once you finish dancing for 10 minutes, you'll feel something change within you. There are chemicals that are there in the brain that, you know, are putting you in a good mood, right? And your body begins to sweat, you begin to become more creative. And you feel like, okay, now I'm ready to face life. Now I'm more resilient. Now I want to take on challenges. So that's the kind of experience that I've had with dance. Not only just me, but many of us who've gone through these kind of therapeutic movement experiences. So this is some sort of a takeaway from the session for you, I would say. All right, so we just have about a minute or so. We'll do a cool down. So we started with a warm-up, remember? And we did this finger pencil activity. I'm not going to go into the reasons why we did everything because there's no time for that. And the third thing we did was the body talk. Yes, remember you talk to each other with different parts of your body. And the fourth one was paintbrush. Yeah, you painted the space with different parts of the body, and we're going to end with a cool down. So what I'd like you to do is maybe you learn the sequence of the cool down we do, and then you can do it on your own. Okay? It's a very simple idea. It's about breath and movement. You breathe in when the hands go up, you breathe out when the hands come down. It's as simple as that. But it'll be better if you all stand up and try it out. Yeah? So I'll take you through the sequence.
So quickly go ahead and remove that mental scorecard we did on a scale of 1 to 5. Where are you now? Where at the start you were at, wherever. If it's 1, where you're feeling low and dense and heavy, and 5, where you're feeling light and exuberant and energetic. Where are you now? Can you feel an immediate change? Yes? All right. Has it changed for anybody? Has it? So you can actually see a session like this, 25 minutes, can actually change the way you're feeling in your body. So like ma'am said at the start, most of us start out in the mind, and then incidentally the body feels a particular way. Ma'am directed us to allow the body to move. And guess what? Our minds have left feeling. How are they left feeling? Call out any adjective under the sun. No, everybody. We've given voice back. Everybody, on the count of 3. 3, 2, 1. I felt happy, nice, elated. I love that. All right. So everybody, thank you so much. Please put your hands together for Tripura Kashyap. Thank you so much, Ambavi. But ma'am, before you go, we've got a beautiful memento, a token of gratitude. Thank you for joining us at the Wellness Confluence. Everybody, please put your hands together. And ma'am, while you're still on stage, we want to quickly ask you to, if you have any feedback, if you want to write down the way you're feeling right now, and remind yourself that you can keep going back to that good feeling place. So if you just want to put down a line or 2 lines and give your feedback as well, you know how to do that. Go to that QR code just behind your agenda. All right, well, I need to collect my thoughts. And that was really, really special. So now as we move into the next session, it's a session that we were all looking forward to. And they say that, when you're looking forward to something, it gets even sweeter, right? So we've been looking forward to the session, and it's here right now. So, ladies and gentlemen, as we welcome our next speaker onto stage, someone who will share with us about, let's talk about this, okay? When we talk about policies, when we talk about leaders and businesses and their role in creating an impact, it's important to understand that it ultimately starts with care for self. Personal wellness is every individual's right and responsibility, and this covers all aspects of wellness. So take a deep breath right now, because in line with this idea, our next speaker for the day is author and filmmaker Tahira Kashyap Khurana. Let me share a few words with you about her. She is known for her candid style of storytelling. She is the author of the recent bestsellers, The 12 Commandments of Being a Woman and The 7 Sins of Being a Mother. Emerging as a strong icon of influence for women's empowerment, she has subtly offered a voice to her characters, fighting the patriarchal norms in the most entertaining ways. Tahira has also co-founded Indian Women Rising, a cinema collective established in order to shed light on Indian female filmmakers across the world. Ladies and gentlemen, she's right here with us. We're going to welcome her with a loud round of applause. Thank you so much, ma'am, for joining us and being with us this afternoon. Ladies and gentlemen, it can be much louder. This is the Wellness Confluence. Thank you. And now, ladies and gentlemen, we welcome the Chief Human Resources Officer at HDFC ERGO. Please welcome on the stage with a loud round of applause, Ms. Sudakshana Bhattacharya, to take this session forward.
Hi. Okay, great. Yeah. Wonderful to be here. Good afternoon, everyone. And I'm in the place of envy right now to be talking to Tahira on stage. So thank you for giving this opportunity to me. But it's not about me, it's about her today. And welcome to the Wellness Confluence, Tahira. And it's an absolute pleasure to be hosting this talk with you. So we've had a series of wonderful activities through the morning talking about the importance of well-being. And we had Dr. Devi Shetty sharing really important advice as to what are some small steps that one can do. So we'll come to that. I'll open the session by asking you the question that would you like to share some of your peak moments of your life when you experience the value of health?
There's a saying that goes, first of all, hello everyone. It was such a pleasure looking at all of you dancing and painting. It was a pleasure. Some of you might be feeling awkward, but trust you me, there was bliss on your faces, and that was just making me smile. So congratulations to all of you for having done such a great job at dancing and painting. And I think Kashyap's are ruling. That was Kashyap ma'am only would come and sort of explaining. The peak moment for me where I experienced health, there's a saying that goes, it's always good to learn from other people's experiences, but sadly enough in my case, I had to experience it myself, and that happens to 90% of us. I really hope that all of you fall into that 10% bracket and you learn from my experience and other people's experience. So I had taken my life and health for granted, I used to eat, drink, whatever, of course not drink, not an alcoholic, but just, even those soft drinks and I was in the prime of my youth and the calories would just shed off and you're not much bothered. You don't know what's happening inside your body. And so physically I looked extremely fit and everything, but I know a lot was happening inside. There's so much which is being spoken about mental health awareness now, and people are talking about it openly, which is so great. But I just feel mental and physical well-being is so connected that physically I felt fit, but mentally I was not there, and then eventually it showed up physically. And so I did have DCIS, which is stage 0 cancer, which is called ductal carcinoma in situ, and but I would not sort of victimize myself, because each one of us sitting in this room have some issue or the other. For as long as we are human beings, which we hope we are throughout this life, of course, some of us do behave like donkeys at times. But as long as we are human beings, we're going to face some or the other issue, whether it's in the form of health, relationships, breakups, financial, career problems. Problems are always going to be there. So my problem is not that great or not that special, but yes, I did face a health issue, and I feel that it was a cumulative effect of
that it's a no media session. If you can just. Sorry.
sorry, forgot to mention.
Check. Forgot to mention at the beginning that this is a no media session, so requesting you not to take any photographs or videos, and please avoid posting any if you've taken them already, all right? Thank you so much. Sorry ma'am, thank you.
Okay. Not at all, not at all. Ab main bhool gayi.
You were talking about it's not just about the physical
I just
illness.
feel our mental well-being, our mind, body, soul are very, very connected. And so I was probably physically my fittest, but mentally not there. And my doctor had a list of boxes that he checked. You're not overweight, it's not hereditary, you're not an alcoholic, you're not a drug addict, you eat well. I don't know why have you ended up with this. And very honestly, till now, with God's grace, I have not asked why me. When all the good things were happening, I didn't question back then. Why should I question now? So, but I felt a surge of well-being during my lowest. And it's very tough to explain. Like for someone, I'm undergoing chemotherapy or I'm undergoing some treatments which physically looks like I'm becoming frail, but I was at the peak of my health because I was resilient because of my life state, and my life state was high because of my practice. Now, I'm just saying everyone should probably pick up a philosophy in life which empowers them, which centers them. For me, that was Nichiren's Buddhism. I was chanting well before I had my health issues. So many people might say, "Arey yaar, tumhari kya ye chanting, tumhara kya ye meditation? You to ended up having this problem." We are going to have problems any which way. But what is your attitude in the face of a storm is you decide your suffering based on that. And I'm just so grateful to the universe that I was going so strong in my practice. Then when this happened, I was like, okay, now a tough situation has come. There is no point having a perspective where I'm begrudging and complaining. My idea is to get over it quickly. And just because of that, my suffering did not last or was not as aggravating as it might just look or sound. So I just feel mental health, physical health is so connected. And to answer your question, when did I feel the peak of my health? I felt I was at my peak of my health when probably to the world I was at the lowest. So, yeah.
Thank you for that beautiful opening, Tahira, and you touched upon some fundamentals about well-being. So my next question to you then is, you said that the body, mind and soul are connected, and you said while you were physically looking healthy, but something was happening mentally, and that kind of manifested in your physical well-being status. So would you like to share with the audience about how can they proactively take care of the mental wellness or a well-being part, so that even if there is a probability of it manifesting in the physical wellness or physical health, it can probably be prevented or perhaps predicted, and hence it can then be prevented?
I feel there are two aspects to it. Of course, one is the physical and the medical side of it. One should definitely not ignore any signals that the body is throwing up. Not ignore what the doctors have to say. Of course, be aware of yourself physically as well. Undergo physical checkups. But the other part of it is, don't let stress eat into you. Yeah. I mean to say, one could be stressed. You just feel like this is going to eat you up, like the situation that you're in, it's here to get the better of you. But the only way for any one of us to expand in life is to go through a tough situation. I mean to say, how did we clear a 5th grade and a 10th grade by learning trigonometry, and that was so tough for me. I can't tell you, I hated math, I still hate math. But I could just graduate in life because I went through that tough time. And the only way for us to evolve is when there is a stressful time, and how we react during that stressful time, that will predict our future. The seeds of the future are sown in the present. So as much as consuming the circumstance that you are in could be, whether it's in terms of health, whether there is in terms of, like I said, financial, or in your career, the bosses are troubling you, eating you up, please pray for their happiness. I know it's crazy as it may sound, how can you pray for the happiness of someone who's giving you so much of grief? But trust you me that nobody wants to give grief to anyone. That person must be going through 100 times more stress and 100 times more grief to be able to give grief further. So I just feel, in order to better your circumstances, really pray from your heart for the other person's victory and other person's happiness, and nothing in this world or in this situation that you're in is out there to get you. It's only enabling you to become a better version of yourself. It's just a question of perspective. It could be really rainy and kitna ganda mausam hai, or it could be, wow, I'll just enjoy the rain and I'll come back. It's just a matter of perspective, and somehow this learning comes to us in retrospect. In retrospect, we feel, "Arey yaar, I shouldn't have reacted the way I did. I did not have to scold my child, or be angry with my boss, or be really begrudging towards my partner." But that's always in retrospect, and so the seeds of this discomfort have already been sown, and the stress you've already caused your body. The idea is to train yourself in a way that you become the bigger person in the picture. And your first reaction or first response is something which is self-constructive and not destructive. Because if you're going to stress, you're going to abuse, you're going to shout, you're going to scream, roti kyun jal gayi aur pankha kyun nahi chal raha, arey itni badi situation hai nahi hai ye. What is it going, that's going to cause you so much of stress. And then later on you feel I shouldn't have. But then later on is then later on only. You've already sown the seeds. The idea is to train yourself. Now either you can talk yourself into it, have a dialogue with positive people, or have a philosophy that empowers you to do the same. But do take steps to conserve yourself, you know. So
that is so well said. You're emphasizing on the fact that empathy is so important to step in. And from the space of empathy, it's easier to not only ensure one's own well-being, but also spread that positivity around to influence or probably inspire others' well-being as well. So you mentioned about people and the impact of people on our own emotional and mental state. You mentioned especially here, today we have most people from the corporate India, and there is a certain trend of work or timings and work-life balance that people either prioritize or they
change your bosses if they're giving you a tough time. They're going to pull me off the stage.
Okay, so for people who probably don't have that luxury, and they have to juggle multiple priorities, getting inspiration from your own life, what are some of these secret sauces that you may want to share with the audience about juggling multiple priorities yet protecting the mental well-being? Because it means you're actually meeting so many people, you're permitting yourself to have interaction with so many people, and not all of them may be as pleasant.
Right.
So how do people then prioritize their own well-being?
I think self-care is the biggest, self-awareness, self-care. Wherever you feel that you're giving way too much of yourself, just put a stop to it. I think it's very important for us to be aware of our environment and of ourselves. And because of the philosophy that I follow, there's this really big learning that I have learned, that your external environment is always a reflection of your internal environment. So if there is too much, sorry I'm using the word shit, but if there's too much shit which is happening in your life, outside of you, it means there's as much shit happening inside of you. And so you are creating that environment for yourself. So the idea is to be aware. Has anybody noticed that at times when you're leaving the house, you have screamed at your house help or something has happened, then the lift bhi nahi chal rahi, aare itni der lag rahi hai lift, you are the last person, and when the lift also comes, it's packed, so you have to wait for another lift. Then you head to your car, the gas is running out, then you go, your seatbelt you're not wearing, then the challan also happens and you're losing your lid, and the problem is just multiplying till the time you reach your office and your boss also gives you off. So the idea is to become aware of these triggers, and so when you're aware and you know that it's because of the anxiety within me, I'm so anxious right now, let me come, and that's lovely exercise that I'm going to learn that. She was dancing and she was breathing. I was just seeing what was that cool off exercise. She was telling you to breathe in and breathe out, right? And this is a gesture which you actually use to tell people, calm down. This is what you actually tell people, calm down, calm down. So the idea is to become aware of yourself. What is my internal environment? Why am I so angry? Why am I so anxious? Pankha nahi band kiya to kya hua? Lift nahi aayi to kya hua? If you're able to do that, I just feel you stop those negative triggers from multiplying, because your internal and external environment are all in sync. You live in a universe which is connected. All of us out here, we are connected. So if there is a certain table which is unhappy and all of us are happy, and we say, "Arey, forget it," and we're going to live in this room only, that unhappiness is going to trickle down to me as well. As much as I might think that person is not related to me. The idea is to believe in the concept of interrelatedness, connection. We all are connected, and that person's sorrow will someday reach to me. So be aware of that, be aware of your internal environment. These are the few things that I have learned, and I am sort of sharing it with you. And this is also I have learned courtesy of my practice. It's something not I've created, but I have learned it the hard way, the loving way, any way that you would say. But it's a beautiful, it was something new to me, and I don't know if it makes sense to you all, but it does work.
That is so beautifully said. So that prompts me to another question. You know, I heard you talking about your practice and your chanting. If it is permitted, would you like to share what kind of practice do you do, number one? Number two, when do you and how do you make the time to do that practice? You know, most people in the audience would probably be spending a couple of hours to reach office and maybe another couple of hours when they go back home. So that's a lot of commute plus a 9 to 6, 9 to 7 kind of a work day.
And then 1 hour of checking out the reels. Usme se time nikalo na. There's so much of Instagram and tweeting and reeling that we are doing. We can easily take out 5-10 minutes out of that. I refuse to believe that there is paucity of time. There could be paucity of intention. But you can totally take out 5 minutes out of your entire regime, which you think you're doing for yourself, but actually you're not. You're just responding, calling out to an action, but you must take out time, whether it's 5 minutes or 10 minutes for yourself. That's self-conservation, preservation, and that's going to charge you for the rest of the day. Instead of thinking, time milega, to main ye karungi, ideally it should be, ye main karungi ya karunga, or ताकि मैं ज़्यादा efficient हूँ for the rest of my day, ताकि I am a really loving husband, a really forgiving partner, a really kind neighbor, and my efficiency at my work also doubles up. So it's again a perspective.
No, that's so well said. So I actually intend to ask the audience a question. कितने लोगों को लगता है कि हमें किसी practice की ज़रूरत नहीं है? नहीं ज़रूरत है practice की, ज़रूरत ही नहीं है. Amazing. That's like Zen already.
That's great. You know, that's so amazing. So like I said, some people might need it, some people might not. But by the end of it, we all are human beings. And so maybe a dialogue could motivate you. All of us do have our lows. It's very impossible for all of us to stay in a high life state all the time, because then either we are gods or we are zombies. And we are none. We are Homo sapiens, and we are going to have a lot of fluctuations in a day from a low life state. So for instance, you know, I spend a lot of time getting ready today. I have my blush on and I'm trying to look my best, and suddenly I enter an elevator and this lovely lady, and she says, "Yeah, थोड़ी मोटी नहीं होगी, थोड़ी खुली jacket नहीं पहनी," and there my life state goes plummeting down. All it took was a random person who's not even related to me to make one remark, and my life state went down. But when you have a sound philosophy or a sound sense of well-being, you don't oscillate that much. That's the only difference. Otherwise, we all do oscillate. But at times, the oscillation only is so tiring. You get tired of being happy. You get tired of being sad. The idea is to be stabilized in life. So at times, like she and him, which is so great, I would love to spend more time with you to know how do you manage without it. But yeah, maybe like I said, good company, great dialogue, a sense of well-being and conscious of yourself in your internal environment. If you guys are really acquainted with that and you practice that, then maybe you don't need a practice. But mere mortals like me, I do.
So, you know, early in the day, we were having another panel discussion, and a leader mentioned about you know, people who lead teams, organizations, or any field for that matter, may also have a strong hobby or a strong practice, like somebody plays a tabla or somebody plays squash and stuff like that, and those things contribute towards staying mentally healthy. Absolutely. And so is there something that you have which has helped you to overcome the phase that you had? I'm assuming most of the audience would have known your struggle, so I don't want to go on and on about it. But what was the crux of it at that point of time which helped you to bounce back? Because you're really an icon who bounced back from that struggle phase and that phase of challenge pretty soon, and what you achieved after that. So how did you manage it?
The knowledge that my life is here to create value. I just kept telling myself time and over again that I have this mission of creating value. I am very grateful for the life that I have, and my sense of work, while I was going through my treatment, I really did not miss a single day off from my work. I was going from Monday to Friday. I was in the pre-production phase of the film, the feature film that I've shot. Next year, hopefully all of you will get to see it. It's called Sharma Ji Ki Beti. Do watch it once it's out on some OTT. But I was in the pre-production phase of it, and I used to go to work every day. So the sense of mission, the sense that you can create value at your workplace through your work, that kept me going. I think all of us need to know that we, each and individual, every person is very, very significant. We all have an individual mission that only we can accomplish and nobody else. And once you have that sense of self-importance, you will take your life seriously and with gratitude. And yeah, like I said, Monday to Friday I was working. Saturday I used to take my chemo. Sunday I used to take my shots which were required to up my WBCs, and Monday I was back at work. And what kept me going was only my work. So I was very, very grateful for the work. So please be grateful for the jobs as much as you might hate your colleagues or your bosses. Be grateful that there's a job that you have, because that's where you can really connect with people and add value apart from the work that you do. So yeah.
So at this point, Tahira, I'll just take a break and perhaps invite a couple of questions from the audience. So far what we have heard Tahira talk about, is there any question that the audience may have? Okay, so.
Yeah, hi. So I've now become aware of the triggers from what you said. But who's going to tell that to my wife?
If I talk to wife, I think she'll have 50 more triggers. So let's not get there.
Okay, I saw a couple of more, yeah.
Hi, this is Shivani. I'm a mindfulness practitioner, so I completely resonate with the talk about acknowledgement and acceptance. And since I work in the mental health space, I think denial and lack of acknowledgement is the biggest challenge that we face. Yes. What I wanted to ask you was, when you said you were at your lowest, or when you realized you were not doing very well in terms of your mental health, what happened? How did that acknowledgement come about, and how did that shift happen? And the reason I ask is so that, because I think a lot of us want to make that change, but people just don't know how to make that shift. So if you could share your experience, that would be great.
Beautiful.
So this was the time where not many people spoke about sadness, depression, anxiety, and I did not read about it. I did not know whom to talk to, because I thought there's nothing wrong with me. At that point of time, I felt victimized. I was in a low life state. I could feel my heart pounding really, really fast. And I did not know those are called anxiety attacks, which I came to know later about. But I got to know how to deal with it eventually. But I really wish, when I had those symptoms where you just want to cry continuously, and it's not normal to cry so much, that's when I realized later on, you know, you 5 minutes or 2 minutes also you cry, it tires you out. So if you're crying for a longer period of time, or you're having anxiety attacks, you must reach out to a counselor, to someone, to a doctor, and to Shivani for that matter, and please seek out help. It took me a long time to even figure out that this is what I'm having, but I did not seek help, but I eventually became self-aware, and like I said, the philosophy that I followed, it really, really helped me understand a lot of things about myself, and through myself, the workings of my body and my environment. But if somebody is going through that, must reach out to a doctor, must reach out to a counselor, must have a dialogue at times. Just talking, it really releases a lot. Please do not hold back. And men can cry too, so all of us can. It's okay.
Hi. Okay. So as a survivor, when you look back, what are your reflections on your family's journey? So for example, we are either the affected ones or we are supporting the affected ones. So what will be your message to those supporters? Because even as in this entire phase will be difficult for them too.
यार मेरा ना मानना ये है कि ज़िंदगी में ना सबके लाइफ में प्रॉब्लम होती है, तो ये यहाँ पर तो हम सब सर्वाइवर्स हैं, very honestly speaking, सिर्फ मैं ही नहीं हूँ. All of us have survived some great bullshit which has happened in our life. So I would really like all of us to clap for all of us. And I really want to ask all of you, how did you survive? And that's the same answer that I have, is just take one day at a time. Do not let the problem consume you. For someone, health issue could be big, but can be easy to deal with. But for some teenager, a heartbreak, it gives you suicidal thoughts. So it's not more about the problem, it's about your perspective and how you deal with it. So I just feel all of us out here are survivors of some issue, and we all need to be really kind to ourselves.
So Tahira, you know, there is a section of people where these talks about mental well-being, emotional well-being, social well-being is still a lot of noise. Because perhaps somewhere there is the connection with the importance all of this is probably not as mature or as strong. And I remember you talked about self-awareness sometime. So can you explain or maybe unpack the concept of being aware of self and thereby living a healthier and happier life for, you know, for the benefit of all of us?
No, like I said, to just know that it's you who's creating the ripple. I mean to say, of course, many of us believe in God, in the higher power, in the supreme power, but शुरुआत हमसे ही होती है. You know, we really need to become aware that we are the people who are the creators of our life, of our environment, of our society, and in terms of the world. So a small step that you take towards self-conservation today, it will lead to earth conservation. And you might say कि अरे यार इसका क्या लेना देना, मेरा क्या world peace से लेना देना, मेरे घर पे उनकी wife उनको इतनी problem दे रही है बेचारों को जो trigger वाले थे, अभी बेचारे सो ही गए हैं शायद इस सेशन में. But you know, there are so many issues that you say, अरे मैं क्या world peace के बारे में सोचूं? I am going to talk about I'm having so much of issue myself. But like I'm going back to that, we are not disconnected from our environment. The ripple effect starts from us. We need to be aware that we can make change, we will make change, and our lives are very, very significant. We are not just random people. Sometimes someone might think we are so low in the hierarchy of an organization. मेरे जीने से क्या किसी को फर्क पड़ता है? आपके जीने से बहुत सारा फर्क पड़ता है. अगर आपको ये फर्क पड़ता है कि आप जिंदा हो, आप alive हो, you have to really know that you can make a difference, and you can. Nobody is too small. We think, you know, the universe is so big, and we feel that our bosses are more entitled, or Bollywood stars are more entitled, but that's rubbish. Each and every one of us are equally important. If you see a microscope, a macroscopic sort of a bird eye view from the universe, all of us are specks and equivalent. So we all are capable enough to make a change, but we need to know that we can. Most of us think that हमारे कुछ फर्क नहीं पड़ता, but that's absolutely untrue. Each and every life is very, very, very significant and very special. So what Sir can do, Shivani can't do, and what Shivani can do, the ma'am who asked me the question, she can't do, and what the ma'am who was painting so well, I can't do. But what I can do, you can't do. So each one of us has a unique mission which only we can fulfill, and we are here on this earth to do that.
Wow. You know, that takes me to another, I'm tempted to ask this again. So can to ho gaya? We can do. हमने believe कर लिया कि of course we can do. But want का क्या करें? What about people who have not realized that they also want to make an impact, they also want to make a difference, but it's just that they haven't yet realized that. So how can they bring themselves towards the purpose of their life and thereby live happier?
In pursuit of happiness. I mean to say, all of us want to be happy by the end of it. And true happiness really doesn't lie in only doing things for yourself. There is so much of happiness that comes on your face when you do things for others. I am not connected to all of you and I'm not related to you all. I was just sitting there and I was watching you all dance, but there was a smile on your face, and I just realized that I'm smiling too. Now, all it took was all of you to be happy and I was automatically happy. So in pursuit of being, of achieving happiness and knowing that by adding value to other people's lives, I can also become happy, that's where that want and the desire and the need will actually come up. We might think, "Ya mujhe kuch lena dena nahi, main khush hu." But kya aap waqai khush ho? You'll have to ask yourself that question. And agar aap waqai khush ho without really contributing to your life or to other people's life, I really would want to sit with you. But most of us are not that happy, and happiness comes when you contribute, when you do, when you create, when you construct, whether for yourself or for other people. So true value, I feel, true happiness lies in creating value. And that could be doing someone for some random person, even for a beggar, if you just give them a packet of chips and आप देखते हो वो साइड पे जाके खा रहे हैं, आपको कितनी खुशी मिलती है अंदर. It's just so much happiness. The idea is to do things for other people also, and that's where happiness comes in, for me at least.
So it is essentially asking oneself those questions about what brings me happiness. And now I've done all this hard work and I've come to the answer, and I realize that my current situation doesn't allow me to be, to have that.
To be happy.
So then there is a space of courage, right? There is a sense of courage that needs to come in. So what do you have to say about that?
I'll go back to how I had started. I also did not see the courage. I was very unhappy at one point of time. And I did not think that I can ever become happy, or God doesn't want me to become happy. My these and these goals are unfulfilled. Some of them are still unfulfilled. But the idea was to realize that it's the lifestyle that I need to work on. And where did I get that courage from? I got that courage from my practice. Like I said, mere mortals like me, at times we need a philosophy, a sound philosophy, or someone to explain the philosophy of life to us. And so when you chant, so you said in the beginning, what is it that you chant? What is Nichiren's Buddhism? So here the five words that we chant on is Namyo Ho Renge Kyo, which is I dedicate my life to the mystic law of cause and effect. And you manifest, when you're chanting, is what they say, you manifest the highest level of courage, compassion and wisdom. So when you have the courage, when you manifest the courage, then you really do want to work towards your own happiness. When you manifest the compassion, you do want to be working towards other people's happiness. And when you manifest the highest level of wisdom, you want to take those steps which are going to be constructive for your own good and well-being. So a sound philosophy like that helped me. Many of us have other philosophies. Any philosophy that empowers you, I think is what sort of helps you derive that courage. And for some people, it might not be any practice. It might be just a dialogue. It might be time and again questioning yourself, doing yoga or having self-introspection. Mere paas time nahi tha. I was not very kind and sort of had all the time in the world to do self-introspection. But I realized that is very important. So one must take out time for themselves.
Yeah. You did talk about self-care, and often when we have conversations with people, a lot of people say कि नहीं मेरी इतनी जिम्मेदारियां हैं कि मैं अपने लिए self-care नहीं कर सकती या नहीं कर सकता. Or even like the awareness that self-care is important, and self-care is not just about going to a spa or getting oneself pampered in terms of shopping and stuff like that, but it's far deeper and there are so many layers. So just in very simple terms, one or two things that our audience here can practice for themselves despite having responsibilities for others that you may want to share.
In terms of what
self-care
stuff they should do?
Yeah, they could do.
Like you said, they could pick up a sport, have a conversation, make a funny reel, anything that takes you away from the cause of your stress. It's never too late to pick up any instrument, any sport. I have just started learning the sitar. I've never picked up a sitar in my life, and today I'm learning to play sitar, and it's very healing for me. Painting is very healing for me. I play squash. That is very healing for me. And my work, genuinely, it gives me a lot of happiness. Making films, writing stories, writing books is a form of self-expression for me. Every one of us deserves to find their own mediums and things that give them happiness. One might think at the age of 50 or 60 or 70, ab kya sochna? But my parents took up to gardening right now and they're so happy. I'm just saying the idea is to be happy for the rest of our lives. It's not that a 30-year-old deserves better than a 90-year-old. A 90-year-old equally deserves to be happy, and a 90-year-old is equally capable of adding value. So when you add value, that is equivalent to happiness, and that could happen at any age.
This is amazing. So may I conclude that, from the conversation that we've had, that my mental well-being is in my hands.
Absolutely.
My emotional well-being is in my hands, and hence thereby well-being is probably self-reliant, and that people should stay committed towards staying well, staying happy, and being emotionally and mentally healthy. It's not at the cost of responsibilities, it's not at the cost of somebody else doing it, कि मेरे company ने तो कुछ बनाया नहीं platform mental wellness के लिए, emotional wellness के लिए, तो फिर I am not accountable for my own mental well-being. I think it's collectively and individually our responsibility to take care of our own mental and emotional health. And of course, there's another aspect to it which I'll just touch upon, and I'll invite your, your views, since you talked a lot about different perspectives, is social health. A lot of our mental well-being is also about how aware are we about the social health around us, and how are we contributing towards improving that. You talked about we all are connected. What is that 6 degrees of separation across the world? So we are all connected in some or the other way. It is not just happening a random conversation. So a little bit about the social health and how can people take care of their social health as well.
No, I think we really understood this concept of social health and all during the pandemic, where all of us collectively felt low, where all of us collectively were praying for it to get over, and where all of us collectively were affected. We were all affected by it. So, so at least there is no point of contention out here, dispute out here that we are not connected. We are absolutely, absolutely connected. And I gave this analogy of this room and one corner being unhappy and we thinking that it's not going to reach out to us. It eventually will, that unhappiness. So it's very, very important to work for your happiness, and you will also be happy when you're working towards other people's happiness. So it's very, very important. And pray for your so-called enemies, pray for your grumpy bosses, pray for your spouses who are giving you grief, pray for your ex-boyfriends and wives and girlfriends. It's as crazy as it may sound, it's going to bring you peace because you're the one who's stressed over it. वो तो आगे बढ़ गई ज़िंदगी में.
Thank you for putting it so simply. So last 2 questions, if there are any in the audience.
There are no questions. They're going to sleep off. कह रहे हमारे पास कोई problem नहीं है. उतरो और अब जाओ. Thank you so much. You guys have been such an amazing audience. And like I said, it was such a pleasure seeing you all paint and dance. Please continue doing so.
Okay, there is a question.
So, does being thick-skinned helps in dealing with these issues?
I don't know what is this concept of thick skin and being all macho, but if that means not having a conversation and just bottling up, that eventually it's going to explode and it's going to be destructive.
No, it's more in the context of, not allowing it to affect. Like you mentioned about the dressing and a random comment from a woman, right?
Right.
So sometimes people get overly sensitive,
right,
and then brood over it or allow it to affect, and it can, like I was having this conversation and the person was saying, I don't feel like working,
right,
I feel like resigning today. Okay,
right,
that's what the person told me on the call today. And so it's not about the organization. Sometimes the bosses themselves make the life of that other person so miserable,
right,
that the person might be working with the best of brands,
right,
but wants to now resign at the spur of the moment, right?
Right.
So whereas there could be some other people who are very thick-skinned, they'll say, "Okay, chalo." So I mean, since you've gone through a lot and have overcome and moved the needle, do you advise that sometimes this helps, being thick-skinned?
I think everybody is a product to their circumstances, whatever has led to the situation they are being. The idea is to be empathetic and not sort of term somebody overly sensitive or being strong. I think when you start boxing people like that, then dialogues become difficult. The idea is to be empathetic towards whether it's a sensitive person or strong person or whatever you want to term. But the idea, and I'm no one to actually, I'm no master of anything. Like I said, we all have survived something. Somebody might have survived something more drastic, and that doesn't mean a more serious disease. It could be a massive financial crunch supporting 10 members of the family. So I'm no one in a greater space, but all that I know is that it's good to be compassionate and it's good to be empathetic, and it's good to have a dialogue, it's good to have a conversation. So if the person wants to quit at the spur of a moment, is being impulsive, is also perhaps because of the situation he or she is facing. If somebody is thick-skinned, like you were saying, I will not give them 10 or 10, but I will just say that they're learning the ropes of life in their own individual manner. I will not credit or discredit anyone, but it's to each their own.
Well, I think, we've pretty much run out of time. We're loving the fact that hands are coming up constantly. And that's the beauty of a session like this, right? There is no big or small problem. There's no big or small solution. It's just unique. And each one of us are walking such a gorgeous journey together. So thank you very much for this.
Thank you. Thank you. It was such a pleasure. Thank you. I would like to clap for all of you. Thank you.
And as you brought to light the beauty of life and the way that each one of us is kind of unfolding our own path, we've got a beautiful memento that we'd like to bring up onto stage. We'd request Sudakshana to kindly do us the honors and present this memento to thank our guest today, Tahira Kashyap Khurana. Thank you very much, ladies and gentlemen, for making sure that we have so many takeaways. Well, that was beautiful. Thank you so much for this wonderful session. Thank you, Sudakshana, for anchoring the session and bringing out the flow of the narrative as well. We know that we are going to be meeting up with our next set of panelists on stage right now, yes? Today we are seeing the emergence of trends which are challenging workplace practices and stability in organizations. So a single antidote to these challenges is a culture where employees can thrive, and the onus of designing such a culture comes upon the shoulders of people managers. So ladies and gentlemen, if you're ready right now, our upcoming session, we have the Chief People Officers from some of the best workplaces in India. Joining us in this session are Krishna Raghavan, Chief People Officer at Flipkart. We welcome Sudakshana Bhattacharya once again, Chief Human Resource Officer at HDFC ERGO, and Mukta Nakra, Head Human Resources and Sustainability at Marks & Spencer, Reliance India. This session will be moderated by Preeti Malhotra, Practice Head Wellness at Great Place to Work India. So as our panelists walk on stage, a few words on introduction. Krishna's efforts at Flipkart are aimed at transforming Flipkart to be an employer of choice by providing an inclusive and entrepreneurial environment through a balance of bespoke and sustainable people practices. In the course of his tenure at Flipkart, he has also spearheaded the launch of the marketplace platform and has led multiple strategic technology initiatives for e-card. Ladies and gentlemen, please welcome Krishna. Thank you for joining us. Sudakshana is an experienced HR professional having dynamic exposure in all facets of the HR domain and is a practicing HR professional for over a decade. She emphasizes employee research to study human behavior to help predict and enhance individual and organizational performance. Sudakshana is known to introduce people practices and programs that are unique and impactful. Thank you for joining us once again this time as the panelist. Moving on, as a member of the leadership team, Mukta is focused on ensuring that human capital is a key driver in enabling business success. She also leads sustainability at Marks & Spencer and is spearheading programs to drive employability and improve livelihood in our communities. She has earned a certificate in Process and Partnership Excellence from Harvard Business School, amongst others. Ladies and gentlemen, please welcome our third panelist, Mukta. Thank you for joining us here today. Well, it's time for our panelists to move forward and to moderate the session. Preeti, all yours.
Thank you, Kisha. And thank you everyone. I think it is so fulfilling and so amazing to see that we are all here and investing this day to really not just talk about well-being, but I'm sure at least since morning I've made my notes to try and see what am I going to go back and try and implement, right? And conversations have been amazing. Thank you to everyone for participating, and thank you so much to all three of you to invest your time and share with us. So this is where the rubber hits the road, right? You keep talking and people can say we must do this and we must do that. And here we have three practitioners who are actually doing this day in and day out, and probably the night as well, since it cuts across and there are no boundaries, right? And each one comes from a different industry. So I think to open, I would love to hear from each of you. If you could, just also for the benefit of our audience, share with us a brief overview of what is the well-being philosophy really in your organization. And when you look at institutionalizing it in your organizations, since we have been privileged at Great Place to Work to learn and study some of the wonderful work you do, but it'll be great for us to know from you. So maybe you can start, Mukta. And
hi, am I audible? Yeah. All right. Thank you so much, Preeti, for that question. So philosophy for us at M&S is quite simple. It's primarily to create a healthy work environment. And that work environment actually comes alive through different factors that impact it on an everyday basis. But the purpose of it is all for colleagues to come together, be their true, authentic self, so that they can create magic. And that authenticity comes from various interactions that they have with leaders, with peers, with everyone across the organization, and how it makes them feel at the end of the day. And that feeling is really what we focus on. How to make someone feel good at the end of the day through interactions. How do you demonstrate care, basic care, where they feel looked after, and there is a safe space for them to kind of say that I'm not feeling okay, and still be accepted by standing out. We bring that to life in different ways, but I think three key areas that we focus a lot on is the leadership at the top. How do you kind of walk the talk? How do you ensure leaders show up as vulnerable and authentic themselves? They can do the storytelling about themselves and not feel awkward about narrating their own stories of how they felt or navigated through tough situations, or even how they cope with failure. How do you create that environment where it's okay to say we've made a mistake and let's learn from it. The second aspect is communication. How do you keep eyes and ears really close to the pulse of what people are feeling? And what are those conversations that we don't get to hear on a day-to-day basis, but we don't want to miss out on? Because that's really where you get the pulse of what's happening in the business. And the third one, I think I said earlier, is to just, as an organization, how do we keep investing in benefits that demonstrate care? And of course, they have to be inclusive, not just from a colleague standpoint, but how do you extend it to their families? Because the lines between workplace and home are so blurred in the current environment that you need to ensure that they feel looked after, along with their families, to be able to have a healthy balance, as well as navigate through maybe a tough time in family, get it easier at work, or when there is high pressure at workplace, how do you help their families to cope with it? So I think that's really how we would describe it at M&S.
Thank you, Mukta, and completely resonate, right? And I'm sure the principles cut across, but it just comes alive. It has to be contextualized to each of our organizations and business contexts. So would love to hear from you, Krishna. What is it at Flipkart?
Thank you so much for actually giving us the opportunity to be here on this stage and talk about such an important topic overall for all of us, not just in corporates, I think in life overall. I think at Flipkart, first of all, our people purpose is really around how do we empower every Flipster to maximize their potential and well-being. I think Tahira spoke about it so beautifully earlier in the session about finding one's purpose. And it's about personal purpose. I think we believe that if you're able to connect an individual's purpose to what their potential is and what they're good at and allow that discovery to happen in a workplace, we often think about such constructs in the personal space but not so much in the corporate space.
True.
But if we are able to do that as an organization, I think corporates at large, that will lead to fulfillment. I think fulfillment also leads to well-being.
Absolutely.
And we often discount that quite a bit when we think about well-being in the construct of physical well-being. So that's for us the biggest purpose that we exist as even as an HR function.
Wow.
I think that's the reason we exist in the first place. And if I talk about the overall aspects of well-being, I think a lot of literature on that subject around holistic well-being. So I won't speak too much to that. But I think over time, mental well-being, again, a topic which has been touched upon by Tahira and previous speakers, very important aspect that we should focus on. And at Flipkart, we spend a lot of time on that aspect, right? And it's all contextual at the end of the day. What matters to one person at one point in time in their career, in their life stage, may not matter to someone else. So how do you actually contextualize well-being for a person? For instance, a mom who's coming back to work, very different circumstances that you need to cater to. You need to be empathetic to that situation, and your policies need to speak to that. So you can't do lip service to these kind of things, right? So how do you actually make it work? And do you measure metrics that actually show whether it's working or not? And do you alter your policies accordingly? So that's the way we think about some of these things. And I think financial well-being as well, very important aspect. We talk about financial literacy a lot. I think there's a big divide in India in particular around women versus men in terms of how financial awareness happens at our homes. So how do we cater to that as an organization as well? It's a very, very important aspect of how we live our life. So these are the 3-4 areas that we focus on holistically as a company, and we continue to still shoot for that North Star, which is how do you maximize one's potential and well-being.
Thank you, Krishna. And I'm sure we're going to deep dive into some of these. The idea was to just get an overview, and I'm so glad you spoke about purpose. So for us globally, the data showed that if you're able to tap into the purpose, and especially when we talk about millennials and getting them engaged and getting discretionary effort, and that's a challenge, it's a 7 to 8x multiplier. And it's huge. So how do we do that? The how is the big one, but there's data. Thank you for that. So Dakshina, love to hear your experience.
So thank you, Preeti, for inviting me to this panel. What a pleasure to be with the two of you here. So at HDFC ERGO, of course, the fact that we are associated with a movement like this, and I remember that conversation where this whole idea was born out of our heart, and you were there in that meeting, Anuj, Prasenjit, Yashaswini, of course, joined later in the movement. And this entire thing started because there is this feeling about prioritizing well-being, and it's not just for the employees, but creating an ecosystem where everybody beyond just the direct stakeholders get to benefit from the organization's initiative towards well-being. Now, to very specifically, talk about what does the organization do for our employees. So, first of all, like what Krishna, you mentioned, the philosophy is about focusing on holistic well-being, and it actually stands on 5 pillars. So it is financial, social, emotional, mental, and physical. And like we heard in the other panel that how organizations have institutionalized concepts of physical wellness through yoga or through different forms of sports or games, and mental wellness through having partners who provide confidentiality services of counseling and stuff like that. So this is at the philosophical level in terms of framework and structure, and how is this executed? Because ultimately it's the last mile. I mean, the proof of the pudding is whether people are really getting the benefit of it. So we invite people to bring their whole self to work. Challenging this entire concept that your personal life is different, your professional life is different. We said, be who you are, bring your whole self to work. And we will take care of it, like your professional aspirations and professional requirements are taken care of through fair and transparent personal appraisals and promotions and career growth and career development. But the other parts of yours, like for instance, if I have a special interest in photography, I mean, does my organization create an ecosystem where that can thrive? So we have something called Elements, where we provide people to bring their hobbies and special interests to work as well. So for that, you don't have to take time off and then go home and do that, and or your hobbies get compromised. So we'll talk about it later. But yeah, so that's what it is at the headline level. We as an organization, we're committed to focus on well-being for people beyond our just direct stakeholders. For employees, it's a 5-pillar-led well-being, holistic well-being approach. And at the execution are these, self-interest, common interest clubs like Elements, which make sure that it is the benefit of it is passed on to the last mile. So yeah.
Thank you, Sudakshana. And I'm so keen to deep dive into each of these. And maybe let me start with you, Krishna, over here. Like you mentioned, so if I look at just the workforce, the range of the profiles of workforce, right, in an organization like yours. So one is your tech guys, then the sales people, then you have the supply chain, then you have the store. So each one's a different cohort just in terms of profiles. And like you were talking about that as human, somebody's coming back after, say, a delivery, or you're a caregiver. So they're just different cohorts. So how do you kind of customize this, and how do your programs really speak to different individuals for different needs?
Yeah, it's a great question. I think obviously we are not unique in the ecosystem. There may be other companies obviously that actually have diverse workforces. But just to give perspective, Big Billion Days, which happens every year, we have over 2 lakh people that come and join us on temporary sort of assignments. Yeah. And then we have 20,000 full-time employees and across all functions. So I think for us, really there are some core design principles that we've kind of based our entire thought process around well-being. The first one being is, as I mentioned earlier, like how contextual is it to the employee life cycle? Each person at various stages would be different. How personalized it is, that's a very important aspect of how you think about well-being as well. What applies to one will not apply to another. So as an example, our entire insurance program it's almost like a menu of choices that an employee can elect into and opt out. Nothing is really mandatory. What you choose at any point in time could differ. So that's how we think about the personalization aspect. And then how do you actually empower the employee to actually pick these choices? How do you educate them? How do you create this awareness? So what we realized during the pandemic, as an example, is that what was the foremost thought in people's minds? It's about, okay, what if something happens to me, right? And you can have all the cover that you want, but there are cases where people have actually maxed out their cover that they've taken. So we rolled out an unlimited medical insurance plan. And I think for us, that step was an important one to actually lean in and listen in to what the voices are speaking about. So that, for me, is an example of how you should actually constantly listen in and then be able to cater a particular program to the needs of that particular cohort of employee. And similarly, again, all the FTCs that work with us, our delivery heroes, as we call them, or heroines, as to speak, the wishmasters, right? They actually have never experienced teleconsultation in their life. And when we had the COVID pandemic hit, many of them didn't have access to a doctor. So when we rolled out Suraksha, which was a program for all these employees, they actually got access to medical care for the first time. And there were beautiful stories across the field about how they experienced teleconsultation for the first time in their life. So for me, actually, these are the design principles, the foundations on which we think about well-being and all our programs and policies.
Wonderful. So lovely to hear, right? Because I think the how changed for all of us, right? I think even if there was some organization who was doing it for the last 20 years, how they were doing it pre-pandemic and during pandemic, all of us have gone through that. So really being open to continuously listening in and being ready to change and keep customizing is so important. coming to you, Mukta, you have, of course, your corporate people, and you have people in stores, and how do you kind of ensure that each one is, of course, experiencing the same M&S, but also you spoke about the whole psychological safety piece, right? So how do you really enable this for people at your stores, and I'm sure it's done through managers who kind of have limited span of control across levels, so would love to know a little more about
Absolutely.
that.
I think our store managers and our line managers are really the focal point of how they experience the organization, and that work environment that I spoke about earlier, how does that really come to life? So we encourage our people managers and line managers, including store managers, to kind of continue to assess themselves on a regular basis on three key parts of how they are leading their teams. Okay. One is individual safety. Are you creating an environment where you as an individual feel comfortable to speak up, and others in your team also feel comfortable to speak up? Are you able to challenge status quo? Do you not feel criticism for having made a mistake? It's just about that environment where I as an individual have an environment where I feel safe. The second aspect that we encourage our people managers and line managers to think about is team respect. How does this team come together when we share ideas? Do we respect ideas? Do we give time to those ideas? Do we challenge each other respectfully? Do we come together to create new ways of working? How is it that we just, come together by knowing each other? The emphasis of get to know your people is at the core of that team respect. Know who you're working with, ensure you are able to empathize with them. And the last part is about team learning. This is where you breed innovation. Tell us how we can be better as an organization. Tell us how we can be more productive. Tell us what we can do differently to get to our customers in a better way. And these three aspects are embedded in the line manager development journey in a manner that they're continuously assessing themselves. This isn't about being managed by anyone to say, we need to follow process through it, but has got embedded as a way of working and a culture in the business. So I think those are the three aspects that if you continue to reflect on continuously, you know whether there is any course correction to be done in your own role as a people manager and someone who influenced the culture in such a huge way, because we're spread across over 35 locations. We cannot be managing people everywhere. It's really that one store manager in the store that has to take that responsibility, and it's the empowerment through these basic diagnostics that we encourage for people to keep checking in on the team factor.
Thank you, Mukta. You brought it out so beautifully. As you were speaking, I could, visualize this country and pockets of excellence like heat maps lighting up like this team is discussing. So thank you for bringing it out almost visually to me, and I'm sure some of you kind of related to that as well. And on that, when we did our last 2 years of study, there was this one statement where it said that companies where people can speak up, right? The retention was 3.8x for those organizations, right? So for everything there is data which backs it up, and that's so beautiful, and then you think about it and say, oh, this is commonsensical. But how do you kind of back it with data? So coming to you, Sudakshna, I think you had, again, a very large workforce, a huge field force and all of that. And then they had to go back and I think start working digitally. Now again, you're back. So with all that, what in your experience have been some things which have worked to make these programs effective? What has been your experience?
So Preeti, like you rightly said, the context is a large, widespread organization over some 600 locations, and there are one-man offices as well. So that this digital offices where there's only one employee in that location who's the lone ranger, keeping the HDFC ERGO flag flying. So, so for us, it's all about impact. How do we make sure that that one person in that town, which probably doesn't feature in the first map of our country, but the town exists and this person is doing business over there. So what is it that we can do which can make sure that the impact of it is felt by that person? So it really transcends beyond just focusing on employee experience or best practices. It is about touching that human life over there. Which means that anything that we do it with the philosophy of last mile first. So whether it is about choosing a medical insurance scheme, like Anuj was mentioning about it in the morning, or it's about choosing, creating a platform where, like elements we talked about.
Yeah.
How do we make sure that that person over there in that city knows about elements and has the wherewithal to actually participate in those forums, and gets his or her interest registered, and feels a part of the organization. So to that extent, there is this complexity of managing people at the last mile, and as we see that our organization will continue to grow what is today called the Bharat, which is the tier 3, tier 4, tier 5 towns, which means that everything that we do as an organization towards employees is not focused just because they're employees, but because they're a person who's based in that location, or there are two people based in that location, and how can we make sure that the benefits that a person in HO feels is as consistent as that person who's in the last mile. So this is how we make sure that whether it is about hearing people's voices, we leverage the technology a lot here, of course, but today, Harsha's session on technology has made us question a lot of premises on which we use technology. He's really opened up our eyes, but with that caveat, we still try to leverage technology to make sure that we're touching people's lives, especially the ones who are the farthest from the Eiffel Tower of, the corporate headquarters. So I think, that's what it is for us.
No, thank you, and that's so true, right? I mean, being able to touch Bharat, or like you said, a Lone Ranger with all the weight of carrying the brand as well as their own personal thing, it is so huge. And I think you said it in a few sentences, but to actually implement is a big challenge. So thank you for sharing that. And on the technology bit, since you are a technology company as well, right, at heart, so what in your view or what in your experience have been some of the things where you've been able to leverage technology to really evolve some of these programs for the so-called new ways of working?
Yeah, I think if I just expand a little bit, if I may, just the topic around well-being and how do I see the future, and technology is definitely a big part of it. Again, the aspect that you spoke about in terms of technology controlling you versus you controlling technology. I think that's the way at least we should think about it. The 2-3 trends that I think focus areas for us as at Flipkart as well, and it's a work in progress. By all means, we have not gotten there. Is definitely one is on preventive. I think a lot of focus has been on what happens thereafter. What care do you provide? How do your policies cater to that? But how do you actually figure out ways? And again, previous speakers have talked about signals that your body emanates at various points in time. How do you actually listen into that, like through technology again, and through diagnostics, which are more preventive in nature? And how does that actually feed back into things that you elect for yourself and your family?
Sure.
Today, I think just the feedback loop from what's happening within you from your well-being to what insurance programs, and if you do good for yourself. For instance, I'm just giving an example. If you walk 10,000 steps a day, does your insurance coverage go down or not? Right? In the US, for instance, it's based on your driving. It's based on your driving record, as an example. Those signals actually determine your car insurance premium. Do we think about that from that perspective? So I think that's a big area of exploration, both from a prevention and what's in it for me, the incentive for the employee, for the human being to actually focus on well-being. I think that's a big factor. I think big data and AI, which is so prevalent today across so many domains, will also be, it's also there in well-being, in I think overall lifestyle. A lot of, I think, devices which measure various things, various parameters, and how that flows back, and how this data all gets analyzed. For instance, when you are a first-time parent, as an employee, you have to almost figure out what insurance cover you need, what's the right one. Can organizations actually feed that data? Again, all anonymized, aggregated. There's no data privacy issue here, but can it feed back and inform? Obviously, it's finally the employee's choice on what they pick, but can you inform that choice, right? Can you actually nudge, so to speak? Those are actually areas which I think worthy of exploration and taking forward. So those were the things that we are focusing on in Flipkart as we move the needle on overall well-being.
Thank you, and very interesting. And you know, there's always that question or the balance of that, you know, are we intrusive? Where is the fine line? And while there is so much technology can do, how do you, like you said, it has anonymized, but there is so much that we can leverage. And while we keep the conscious lens of what's okay, what's not okay, and how do you take the good side of it, but very powerful, I believe. Thank you, Krishna, for sharing. Coming back to you, Mukta, I think one key element we have seen, and we have also seen this in the feedback that we get from your employees across the country, that they truly experience a sense of belonging at M&S, and that's wonderful. So how do you, and inclusion is so important, right? It's integral to well-being. So how are some of those aspects that you have looked at, and again, ensuring that this is consistent, so some learning there would help?
Yeah, so you know, our purpose is to make the everyday remarkable, and it's in that purpose that all our actions kind of get embedded, and well-being and inclusion actually sit within the same bucket. Because if people feel included, they will bring their whole self to work every single day, right? And of course, we need to look after the care element in terms of what we, it's just not just the benefits, it's just the environment where people can be healthy and happy, and for us, safety is also a big element in the way we operate. But that belongingness comes with, you know, there are 5 simple steps that we kind of mentally request employees to kind of follow, to do that check in their own mind to say, you know, do I feel, can I belong here or can I not, is I have the liberty to be curious and challenge status quo. It is kind of embedded in the M&S way. The second is, can I be vulnerable and can I really express my true self? And not to shy away, but also create that environment that am I saying the right things, not necessarily saying the right things, but am I demonstrating that behavior that I'm interested in someone else? It's also about how, you know, you kind of come together to innovate every single day. I think it's just in our DNA to say, are we doing things the right way? Are we nurturing our thought process? Can I ask you a question? And if I'm asking that question, someone's taking an interest to kind of answer that question right at the end of the day, because every idea matters. I mean, we've got platforms where you can raise ideas. We've got platforms where you can raise questions anonymously, and trust you me, there are some very tough questions that come to us.
Sure.
But we as leadership team stand in front of the entire organization and are happy to take those questions, because we want to ensure transparency in the way we see business, in the way we see results happening, and we communicate that week after week on how we're doing, what we are doing, what we want to do better. Our vision's very stated as well in terms of who we want to be, and how that kind of links people's everyday jobs. So I think belongingness, well-being, inclusion are all elements of the same aspect or universe, where at the end of the day, if you create that environment where people can be their true selves, managers make the effort to get to know, you know, a family that has a child problem or a family that's going through a well-being or a health problem. Sure. How do you show up for such instances and just stand by as a backbone, not to kind of destroy someone, but to actually help them come together, give that support and nurture that environment? Because at the end of the day, a leader, a manager, how they show up every single day is really the work environment that gets created at that point. And you could be derogatory if you want to be, but you could be equally nurturing if you want to be. So I think these are all choices, but I think because it's embedded in our culture, we make the everyday remarkable. We ensure that we are focusing on all these things just to make that everyday remarkable true.
Thank you. That just sounded so authentic, right? You know, like you're actually doing it, and it's that intent that matter, and that's what you bring alive to your workspace and your colleagues every day. That's so wonderful. I know we have to also open to questions, but I do want to ask this one question to each of you. In terms of, actually 2 maybe. One is just this, that, you know, while all of us have the right intent, right, in this, but we are also expected to deliver on numbers, and all the time it's this tussle between that, yes, am I kind of making my numbers, how are my daily reports showing, And on the other hand, we're saying be authentic, demonstrate care, genuine care, right? Your care is not something it cannot be shallow, etc. So sometimes people say that the two, can they coexist? And I know that in all your 3 organizations, they do coexist because these are high trust, genuine caring, and high performance organizations. So what has worked? I think that one thing maybe from all 3 of you to make this really come alive, that yes, genuine care and high performance coexist. It's not at one over the other. So any one non-negotiable or any one principle which ensures that this happens. Any one of you could start.
Okay. All right. So for us, I think it goes back to, again, I keep talking about this a lot, but the purpose, right? And every time you're faced with a dilemma and you have a choice to make, you have to go back onto anchoring something. And what do you anchor on? It's the purpose. So when we think about maximize well-being, that's how we think about it. And the example for us is, and we talk about inclusion, Mukta spoke about it so beautifully, is really we have like a women's only hub, a sortation hub in Coimbatore, which pretty much is run by women all the way through. And in supply chain in particular, it's very hard, to recruit women and actually upskill them. Yeah. So it's breaking a bunch of barriers, both socially and under the corporates as well. But as we did that, actually the numbers are better than some of the other hubs. Wow. So sometimes you can actually balance performance and make the case for inclusion perfectly. It works all the time. Sometimes I think we just get our minds convoluted about it, saying that we have to trade one over the other. But there's several examples of that. Another example I can talk about is, again, a dilemma faced us when the pandemic, and we obviously wanted to roll out vaccinations for our full-time employees. But then we realized we all got together as a leadership group and we said, but the people who are delivering to customers are the ones in the field. They are the ones who are exposed the most. Right. Our policies say that we should actually give it out to full-time employees, but no, we'll actually give it out to all the people who are contract workers first. And there's a business case for that as well. I mean, how do you keep your operations running 24/7 during times of the pandemic when you're delivering essentials to the customers? So these are real practical examples where it's not a trade-off at all. And when you actually keep the purpose at the center and you pick your choices, I feel that you invariably land up landing both outcomes.
Thank you. Thanks, Krishna, for sharing that. Yeah.
So, just extending to, what Krishna was saying. So I think what we saw during the intense COVID second phase, which is where I think organizations face the biggest challenge of coming together. And, so earlier in the day, it's very beautifully articulated by one of my colleagues, Shruti. She said, you know what, I think it's time that the business leaders start talking the HR language rather than being the other way. I mean, the last decade was all about, can HR speak the business language? But I think what we have seen during the pandemic and what we are seeing now in terms of managing the, the workforce, which is hybrid and, phygital events and stuff like that, it is like people are now warming up to the idea that, listen, there are softer elements of the organization which are probably more important, and business numbers are an outcome of all of that. So it's a beautiful shift to my mind, and thereby, well-being is not an HR agenda, or it's not a people agenda, or it's not because we are going to be featuring in this, coveted list of great organizations who focus on employee well-being, but it's actually about survival. If we, all of us, especially, I think somebody asked how many people are from HR here, and I think I saw 90% of people raising their hands, which meant that it is each one of our responsibility to make sure that well-being is not a beautiful structure or a framework in our decks, but it's actually the line managers, KPI in some form, because the last mile experience of the organization happens on a daily basis through moments of truth by that line manager. Right. While we may sit here and create everything, but how are we empowering that line manager to create that kind of culture within the team? And it truly, truly resides on empathy and empowerment. So I think I'll leave it at that, these two then.
Thank you, thank you. I'll come to you, Mukta. And I know I can also see there's time's up. I know our next set of speakers are going to log in from UK, so I know they're online, but we'll just do this and continue, yes.
So we have 4 line manager skills. Very simply put, care, clarity, strength, and praise. Do everything that you do with care. Bring clarity in what you want your people to do so that they don't have to repeat their task, and align them to the purpose. Strengths, focus on people's strengths. That's where the victory of diversity stays and lives. And praise and express gratitude for what people are doing for you. I think our inclusion, diversity, and well-being philosophy comes alive with these 4 line manager skills.
Thank you. That's why now I know where all the clarity was coming from when Mukta was speaking. And what do we do, Kisha? I know that I'm sure there are questions in the room. This just kind of brought alive the fact that the execution is the key, right? And we can probably continue speaking and learning till tonight. So one option I can think of is that please have your questions, and could we take them in the tea break, or right? Because there are 2 people I know who've logged in, but I am going to use what Mukta shared, that gratitude. I think that's my only feeling today to all 3 of you, and to each of you in the room, and everyone who's logged in. The movement has just started, and I'm just so glad and very, very hopeful that we are going to take it miles ahead. So we will answer some of your questions because all of us are here, and continue the conversations during tea right after this next session. Yeah, thank you so much.
Well, that was pause-worthy. We all wanted to stop and kind of, immerse ourselves in that. But right now, I think what we'll do is we have beautiful mementos for our panelists, so we'll have those brought onto stage. Can we please have them? And we'd like to say thank you to each one of our panelists. Thank you very much for joining us, for your investment in the movement that has just about started today. So everybody in the audience, please, I could see a couple of hands coming up. Hold on to your questions and put your hands together as we thank our panelists, Krishna, Mukta, and Sudakshana. Thank you very much. Thank you, Preeti, for moderating the session and presenting the mementos. We'd like a group photograph as well. Ladies and gentlemen, please join us in thanking our panelists. Thank you very much. The wellness confluence, it's just perfect, isn't it? Thank you so much, everybody in the audience and everybody online as well. Remember to scan the QR code behind your agenda right now as the group photograph is happening. Everybody, and please give your feedback. So do that right away. We're giving you 30 seconds to do that. Thank you very much. Thank you. Everybody, scan the QR code behind the agenda very, very quickly. You know how important that is, right? And also remember, we've got step, set, go, making sure that we've got the right kind of action happening in the pre-function area. Not right now though, because we're moving straight into our next session. And while you send in your feedback, which I'm sure you're doing because everybody's looking down at their phone, that's a good thing to do. Our next session is on decoding physical literacy and its role at the workplace. It is new and contemporary with a vision to create an environment where everyone chooses to be active for life. One of our speakers who joins us today, Margaret Whitehead, is also called the mother of physical literacy and has been spending significant time to bring this concept to life. So, ladies and gentlemen, I know you are ready to move into this session. We are delighted to have her and her colleague, Nigel Green, join us today. So they're going to be joining us virtually. A few words on introduction. Margaret has led the work on physical literacy worldwide, writing 2 books and many articles, and has presented it in many countries across the world. She has evolved physical literacy as a lifelong concept for all and for life, and as a realistic, inclusive, and non-judgmental concept that respects everyone's unique physical literacy journey. Margaret is particularly interested in physical literacy throughout the life course. Ladies and gentlemen, please put your hands together. It's wonderful to have her join us on screen. Thank you for being here today. And joining us, in addition, we have someone who, in addition to his position as the chair of IPLA, Nigel also is the vice chair of the Northwestern Counties Physical Education Association. He has been involved in providing professional development for physical literacy and physical education in the UK and more recently in India, Qatar, Brazil and Taiwan. Thank you so much, Nigel, for being here as well. A loud round of applause, please. We're making sure that even though it's digital, you're getting the right kind of love as though you were on stage. So thank you so much for being here today. Welcome, Margaret and Nigel. We are truly excited about your session, and I would like to invite onto stage Sandhya Ramesh, Head of Diversity, Equity and Inclusion at Great Place to Work, India, to anchor the session. Sandhya, over to you. Thank you for joining us.
Hello. Hi. Audible? Hello, everyone. Good evening. And Margaret, Nigel, thank you so much for joining us today. And we know we've been running a little late on schedule, so thank you for your patience. We've had an exciting day with lots of conversation around health and well-being in the workplace, and today we're going to explore the topic of physical literacy with a little more detail, right? And I was very curious when I heard about physical literacy for the first time. Margaret, you're considered the mother of physical literacy. What inspired you to socialize this new concept around people's holistic health and well-being?
Thank you very much. Can I start by congratulating India on all the work they're doing to consider physical literacy and promote physical literacy. And can I also applaud you for having a session, having a workshop, having a number of days looking at the adult, because we've done quite a lot of work on promoting physical literacy with children, young children and older children, but I think in the West we are guilty of not spending enough time on the adult. So it's very good that you're leading the way. You asked me what inspired you to discover and socialize this new concept. And I would like to have just two brief parts. One is my own personal experience, and one is some insights from philosophy. My experience, I've been involved in taking part in and promoting physical activity for all my life, let's say 60, 70 years. And so I've observed the developments in the field throughout this time, and they haven't been very positive. They haven't been very hopeful. I've observed that there's fewer people who are involved in physical activity when they get to 30, 40, 50. I noticed that there's quite a lot of obesity, so that they're not doing what they should be doing or could be doing or might be doing in relation to taking part themselves. And there's a sort of a feeling that it's less valuable, it's irrelevant. Unless you are really Olympic medal standard, then just taking part doesn't seem to have any value, which is very sad, because it is a central part of who we are, our bodily manifestation, and we are losing out in the quality of life if we don't address all our capabilities. And I think that it's been undervalued, and when you should look at schools, it's been undervalued. There's less time given, it's no longer compulsory, less money, less teachers. So it's very sad, and I have watched it happening, and I had to do something about it. I felt that we were missing things. And I was also watching about what and how the children were being taught. And a lot of the teaching was purely focused on our physical structure and our medical health and fitness. Well, of course they are important, but they're only an element. And the area that we should be working in physical literacy, physical education, physical activity, should be much broader than something which is just looking at the physical. And sadly, the assessment that people have been trialing has not been helpful. A lot of assessments seem to identify failure and not to celebrate progress. Generally, assessment was norm referenced, involving in many cases failure in comparison with others, That's not very motivating. That's not really what we want to see if we want to encourage people. It's got to be a positive experience, it's got to be valued by other people, but unfortunately that isn't always happening. And assessment was not being used as a motivational tool. Very often assessment seems to be a negative thing, but it should be able to be a motivational tool. Now, all in all, this was a very dismal picture that I was living through all my career and my life. And I felt that we were missing, something was missing. And so I was recommended to go and have a look at some philosophy and see if I could get any guidance from philosophy or any concrete area where we can clearly see that there is support for our work. And we were forgetting the compelling evidence of our holistic nature. This belief is known as monism. This is the view that we are not some robot with a few extra added powers, but that every aspect of our being is involved in whatever we do. We are holistic. We are holistic. And everything we do has an effect on us, on all aspects of us, and we need to involve all aspects. We have a wide range of capabilities, physical, cognitive, affective, or emotional, and they should all be equally valued. So the monism, the holism aspect, needs to be remembered. We're not just dealing with mechanical robots. We're dealing with people who have feelings, they have understandings, and they have capabilities and skills using their bodies. So they are a whole person, and as we work with them, we should be remembering that. So I'm a very strong advocate of monism, holism, and anti-dualism. I think that you're better in India than we are in the West. We are very dualistic, body and mind. And they're still wondering how we've actually managed to join the body and the mind. Then there's I was fascinated in philosophy with the views of existentialists who believe that we create ourselves through the experiences that we have. This makes each of us unique. So we create who we are by what we do, by the experiences that we gather. And we each individual, and it's very important that we address this individuality as we teach them. They are not all the same. We need to be taught as an individual person. So this is really learner-based teaching. We're not teaching hockey or dance. We're actually teaching individuals and getting to know them and promoting physical activity. Finally, I found the views of phenomenologists very thought-provoking. They advocate that our experiences live with us, and we interpret the world from the platform of past experiences. So that if we've had a very positive session of dance, and we have found this to be rewarding and fulfilling and developing our self-esteem, this colors, that experience colors other situations which resemble the one which has been positive. That's very important. Because if we have been humiliated or embarrassed, we don't want to go again, we don't want to have that experience. And so the trick is that what we must do is we must make sure that whatever they do, it's positive and they have a positive experience. This means that what you did yesterday colors how you read today. Experiences cannot be discarded. They're always with us. They're always with us. And it's very important that the experiences that we have are a safe, rewarding platform from which to continue to be involved in physical activity. So that's my answer. My experience of seeing lack of value, of people not being involved, not being motivated, and then the philosophy that says, no, you are a whole being, we need to accept that, you're different, you're unique, and we must build up a battery of positive experience so that that motivates them and fires up their desire to continue. That's all.
Thank you, thank you. Thank you, Margaret. And so much of what you said resonated with me because I know so many of my school friends. So, you usually have physical education in school, right? And I also know that physical literacy as a concept is being taken to so many schools across the world and now in India as well. I had so many friends who, did not have a very great experience of the assessments that were an outcome of the PE classes, right? And in adulthood today, I still see that they're struggling to either want to try something physical, like a physical activity that they want to do. So thank you, I think, for talking about the experience part of it. And Nigel, if I had to come over to you and ask you about, just based on the philosophy and the framework of physical literacy that Margaret just shared, what do you think are the mindset changes required? And it'll be great if you can talk about this maybe from the lens of coaches or leaders, or in this case, teachers, right, in schools. What do you see are some of the key mindset changes that will be required in the way we approach physical literacy?
Okay, nice to meet everyone. Sorry it's not in person, but I have, as has been indicated, been to India a number of times now. Love the country, love the people, and love the fact that India is trying to become more active for a positive reason. And I want you to just reflect actually on the activity you've just been doing. I believe you have done a sort of dance movement type activity. Yes. And I suppose I want you to ask yourself how you felt taking part in that activity. Were you confident? Were you motivated? And were you able to take part physically? Were you included? Did you know and understand what and why you were doing it for? And for some of you, the answer would have been yes to all of those. For others, there may have been some yeses, but may have been some no's. And for others amongst you, there may have been a lot of no's. And I think this is the essence of what we're looking at, and is what Margaret alluded to. If we have had a range of positive experiences in different physical activity environments that have allowed us to develop our physical competence, our knowledge and understanding about activities and why we should do them, and our confidence and motivation to take part in those activities, then it's more likely, as we get older, that we'll engage in physical activities. If you think of what you did a number of years ago, there may well have been a time where you were involved in a physical activity. You were enjoying being involved in that activity, and you got a lot of satisfaction from it. You felt valued, you felt able to take part. But there might have been other occasions, or you might have known other people who didn't feel the same. And so, as coaches, as teachers, and as people with responsibility in the workplace, we've got to empower people to be more physically active. We've got to help them learn new skills, develop those skills from a physical point of view, learn about themselves, know what makes them tick, what motivates them. And then we've got to find opportunities and experiences that infuse them and engage them in physical activity. And I'll just share a little story with you. I came over to India recently and did some work in Chennai. And one of the people there, Geeta, she said, I decided I wanted to go and play badminton again. And I went with some friends. And we really enjoyed the first session. And then a coach came over to me. And he said, you're not holding the racket right. You need to change how you're holding it. So I changed it. And I felt I couldn't play anymore. So I lost interest. And this really identifies clearly the importance of the experience. We've got to make sure that individuals, no matter how old, no matter how young, get positive experiences in physical activity, so that encourages them to be active throughout their lives.
Thank you.
Okay, that's okay?
Yes, yes. Thank you, Nigel. And from there, I'm just going to quickly move over to Margaret and pick up the thread from that story that Nigel just shared. Margaret, what would be, different? So if we were to operate from the philosophy of physical literacy, what do you think, therefore, coaches leaders, because we also see organizations today offering a range of programs, right, that encourage physical activity. So as a philosophy, what do you think that coach in that particular story could do differently as per the philosophy of physical literacy?
Yes, well, we could talk a long time about this, but I think that in a way, some of the coaches and teachers are very mechanistic, and they are not considering that they are dealing with, interacting with the whole person. And this is very important, that people are not just, as I said before, robots, and they have to learn this and repeat it and repeat it and repeat it. We are giving them, when we are working in a particular physical activity, we're giving them an experience. And the experience should be roughly the same as Nigel would say, whether you're dancing or swimming or sport climbing or whatever it is. That it's the experience. And then of course it is the memory. It is the you have engaged in something, and this becomes part of you. I mean, I'll give you a trivial example. For example, not in sport, that I give to students somehow. If I have been stung by a wasp, and I'm allergic to that and I have to spend 3 weeks in hospital, any time I see a wasp, I shall just make a quick exit. If, on the other hand, I've seen the wasps and they've climbed all over my jam and they've climbed all over my fingers and they've never hurt me, I don't care about a wasp. But I carry this fear with me all the time that I'm going to get stung and I'm going to be very poorly. Now, I know it's a very trivial idea, but if you are embarrassed or harassed or humiliated, you remember that. And so it's very strong in a negative sense. If you've had a bad experience and your self-esteem has lessened, whether you're teaching, whether you're learning swimming or diving or whatever it is, that is you're going to carry that with you. So we really need to remember that we are working with whole people, so we're monist. And then if we want these people to go back, we need to have a look at the nature of the experience we should be trying to give them. And we are we're trying to celebrate their progress. We're not trying to say, yes, you're 55th in this class of 80 or you're 7th in this class of 10. What we're doing is we're giving them a positive experience so that they will, this will be part of their persona, they will be keen, etc. And then the same thing, it follows through with phenomenology. It becomes, you live it. Having had the experience, you live it. And I sometimes say to my students, take care of today. It soon becomes yesterday and has an enormous effect on tomorrow, because you carry the experiences with you. And so I think one of the questions you gave me is, what sort of experiences should they have? So this is very, very important. We accept that coaches and teachers find it difficult to change, but it is crucial that they do. So what sort of experiences should we provide? Ensure that all experiences in physical activity are positive and self-affirming, so that a desire to take part is established. We avoid any embarrassment, humiliation in participation. We enjoy the experience and that each person's progress is celebrated. I want celebration, even if it's your first lesson in something. I would like to think that if we could have a wide experience of physical activities, but not breadth at the expense of depth, we need to have a breadth. And if I look at the activities that I've been involved in, I've been involved in, I wrote it down somewhere, tennis, hockey, camping, guiding, dance, folk dance, a whole range of things, which has meant that as I have grown older, I've moved away from doing certain things and I've gone back to something else, or I've tried something else. So if we can give them a broad experience, we can cater for their needs as they grow older. We need to ensure that their personal self-belief is nurtured. We want them to nurture their self-belief because they found another capability, another way of interacting with the world. We want them to enjoy and share the enhanced quality of life achieved by participation in physical activity. We want them to enjoy the activity, And we want them to share that enjoyment. We want them to do a selling job. Oh, come on, come along with me. I've just done a 2-mile cycle ride. Come on, it's absolutely great. They've got to be ambassadors for us as well. I think that you've got the gist. It could be, we aren't in a situation of not being interested in their developing a skill, because the context is important. But what really matters is they go out of the room and they say, oh, I'm looking forward to coming back again.
Thank you. Margaret kind of took me back to my own journey. You know, I think as in the early childhood, I was a lot into track and field athletics. Somewhere in middle school, I tried Kho-Kho, and I was like a Kho-Kho captain. Kho-Kho is also one of the games we play here in India. And then I tried my hand at throw ball, and then, you know, I could play throw ball. And then in undergrad, I tried my hand at cricket, and I could play cricket. And then, you know, you enter adulthood, you enter work life, and all of a sudden, some of that just hits a plateau, you know. You stop connecting intentionally with some of those experiences. So Nigel, this question's for you. How can adults reconnect with the joy of, you know, physical activities that they were exposed to when they were younger? Even in India, we would have gully cricket, right? So many of us would go outside our houses, in our colonies and in our buildings, and pick up a bat ball, play with our neighbors. So how do you think adults can intentionally stay connected with that experience? Yeah, over to you, Nigel.
Okay, I think there's a number of points, and some of them linked to Margaret's and some of them to the comments that you've just made, but also to the people in the room. You as human resource managers, you as leaders in industry, have a responsibility for the health and well-being of the people who work for you and yourselves. So making sure that a range of positive experiences is provided is really essential. And if everybody gets positive experiences, the chances are that they will be coming back and engaging further. This has got to be realistic, because we know as people get older, they get more commitments in relation to family and work and so on. But at the same time, we've got to think, how can we do this? And from an organisation point of view, I think there's a number of points you can think of to encourage people back to activity. First of all, active travel. And I know India is a country where a lot of people travel to work either by walking or on cycles. So encouraging them. Having active breaks during the day. So providing facilities and an environment that again allows and encourages people to be active during their break and lunch times. And that includes providing facilities to be active and for everyone to be active at work. If you think back to the early 20th century, a lot of industries had sports facilities for their workers. Now, I know that's quite a challenge in the current climate and with the space available, but we've got to be thinking not just a gym, but other facilities that allow people to do a whole range of activities. And that includes everyone. We've all got different abilities and disabilities. So we've got to have opportunities for everyone to be involved. And finally, I think the point I would sort of emphasize most is having support within the work environment. Having someone like a life coach within the environment who encourages you to be physically active and finds way to support you in being physically active is really key. And if that means that they explain places where you can go to take courses or events, such as a 5K that you could train towards, or they find coaches who can help you learn about a different activity, then they could be really responsible for encouraging people back into activities or to try new activities. So I think people in the workplace, you've got a real responsibility to change practices.
Yes, absolutely, Nigel. And we've had a whole day of conversations around what all the leaders in the room can do to be able to influence that. But I'm also going to use this opportunity to invite on stage one of your leaders who has been leading physical literacy here. We have amongst us Mr. Amit. Amit, if you can please join us on stage. And, you know, we'd love for Amit to also share a little bit about the work that you're doing here in India. Oh, you have to watch that. Amit, thank you so much. You've been here through the day, through the sessions. How has it been so far?
Quite a lot of learning for me personally as well. A lot of new points.
Great. Amit, you've been leading physical literacy in India, and I think I've had an opportunity to understand that you've worked with some leading sports coaches in the country. What's been your own personal journey and inspiration to, you know, I think to adopt a concept like physical literacy? Also just, you know, understanding the ethos of sports and competitive sport in our country and how much that's been advocated ever since we were young.
Sure. So first of all, I was working in Grand Thornton in consulting space, and I was very passionate about doing something for the children. I still feel that this will be a question asked by children to us, that we don't know how to play. We don't know how to be active. I was very passionate about finding some of the answers to this. And in that journey, I met Pulela Gopichand, our national badminton coach, and we together started promoting this concept of physical literacy for last 6-7 years. He has been kind of torchbearer in the country to talk about this concept. He firmly believes that the coach's perspective on when he is also known as a coach to bring Saina, Sindhu and so many laurels for the country is a very incomplete story. Because we need to look at that 10 years back when Saina, Sindhu would have been playing, there were maybe 2 lakhs girls playing badminton in India. And by making 2 champions, we also lost so many girls who could have loved badminton for life, because the focus was just on few people. And which calls very specific paradigm shift the way coaches are dealing with sports and physical activities. Every coach wants to look at who is best in the class. Sports as well. You could have seen for your journey when you were in the school, college, or even today as well. So this calls for that all these sports coaches that need to move away from talent identification and the medals terms to visualize that all these children will be going to workplace tomorrow. And all these children need to have happy, positive, rewarding experiences so then they can make workplace more productive, more energized, and they can have better quality of life for the whole life. So that has been my experience into it. For me, I'll connect to what Tahira said, that we have used so many words, use health, fitness, well-being. तो उसका philosophy क्या होना चाहिए? That's what I found philosophy through physical literacy, because it put across that everyone wants to be active for life. Everyone wants. And if you look at maybe a month from now, 90% of the people all over the world have New Year resolution they want to be healthy this year. These statistics that most of them have the resolution of to be active for life. And it helped me answer that my journey, I was not into sports. I just remember, as you said, childhood, just playing with my father in a very small area. My father used to play cricket with me, playing on street with my friends, but not so good in physical competency. Going to college, I did my engineering, I did my master's and PhD from MDI Gurgaon, where I first time connected with sports. I did sports facilities. And I connected back that in the college and the young age, I was just thinking that is about looking in a specific way. You need to look good in a specific way, you need to have muscles, so and so. But the moment you find the experience part of it, the joy part of it, that in a way, wanting to do more. मतलब जैसे बच्चा होता है ना कि मौका मिलते ही बस खेलो. You want to be active. You are not made to sit. You are not designed to be sitting. So that feeling got into my head, and this philosophy gave me that answer actually, that it's a journey. Each one of you, each one of us sitting is having a very beautiful journey of our physical literacy, which is non-comparable, which is unique, which has influence of our parents, our friends, our peers, our bosses, and this journey can be even more beautiful. So that kind of answered my philosophy search.
Thank you. Thanks, Amit. And Amit, we also see organizations, and you witnessed today the number of programs and initiatives that a lot of our best workplaces spoke about. We know that a lot of organizations today are, and post-pandemic, this has been a conversation of being able to foster better health and well-being in the workplace, right? At the same time, some of the challenges organizations face, and one of the biggest one is participation, right? And that sometimes is largely either owing to factors of time, self-motivation, even interest in the particular physical activity. So you've also started working with organizations in our country today with respect to this, taking this philosophy to corporates, right? How do you think organizations can make this entire process of the focus on health and wellness more inclusive?
I think it has two dimensions to it. One is organization are places where human capital can be unleashed. To unleash that hidden potential, your whole well-being is the most important unearthing opportunity. And they are also on their unique journeys. They're also being labeled in some ways that I'm so and so, I have some kind of body image, self-talk about myself. And they go to environment. So I've heard a lot of perspective, but I still feel a lot of them is around that how do you take care of them inside the company, feel valued for that part. While other way to look at that, all these are beautiful humans coming to my organization. They have a beautiful experience of physical activity, well-being in my environment, but they also take that to their homes, to wherever they go. So I'm supporting in their physical activity journeys as well. So it's a two-way process. I'm adding, in a way, life to their lives, also ensuring that it adds to the organization outcome. So when I started working with corporate, because I'm to an extent too much obsessed, is a holistic concept, has all the answers for anyone's physical activities journey. I intentionally do a lot of CXO workshop to start with that. As Krishna said, the purpose, the top leadership, buy-in, very important. And what I found that even my few sessions that there had hardly been 2-3 hour discussion on the wellness of the corporate from the top leadership. And they had very different understanding about it. So in a way, if you have wellness perspective, I took them to different breakout rooms. What do they mean by employee wellness? They're very different needs. So solution, in a way, they could find that they need to converge first of all to have a good strategy around it. And then clearly looking at, as Nigel said, Margaret said, even a lot of HR leaders said, each employee is so unique, but most important to look at that, these employees are not just adults, they are having the journey of the life. They already have childhood experience, teenage experience with them, and they're also experiencing on a daily basis. So these experiences are cumulative for the life, and how do we start the experience where it was left? It's very important. How do we restart the experience where somebody left the journey of physical activities? And from that point, maybe if I need to look at, I look at those 10-15% employees who are not active currently as starting point. Most of the initiative I have been to walkathon people who are already active. So many clubs who are already into it. So these are the few of my learnings. Of course, it has been still initial stages for us to take this concept to the corporate, but these are some initial learnings.
Okay, with that, if there are any questions from the audience, we'd love to take them. So you can also keep the mic closer to you. But I also have one more question to all three of you, just basis your experiences here. Nigel, Margaret, Amit, if there is one thing that organizations can do to integrate the philosophy of physical literacy in the way we plan and execute health and wellness initiatives, what would that one thing be? Maybe Margaret, you can begin, and then over to Nigel and Amit.
I think that it needs to be quite clear that activities which involve our whole self, including our embodied dimension, are valued, and they need to be spoken about, they need to have celebrated, etc. Perhaps middle management could set an example. I think that it has to be a number of things which are happening, but I think that if there is real passion and commitment from middle or senior management, that this is a good thing, and I actually do, on a Monday night I go to squash and I play for 45 minutes, I think that they've got to be open about it. Some people feel very self-conscious about body image, etc., but I'm not interested in that. I'm interested in celebrating what they do and having an avenue for celebration without, being a bit trivial about it. So I think that really promoting it, obviously making it valuable because of the time and the money and the interest and the commitment, I think that can be very powerful.
Thank you.
I'd support what Margaret said about celebrating people who are being physically active. But I think from an organisation's point of view is just to reflect, how can you make the working environment a more positive, physically active, engaging environment? And how can you support your workers in being more physically active at work, but also in being more physically active at home as well? So it's not just work, it's the whole life that you're trying to support them to be physically active. I mean, simple things like you might say, well, okay, you can come in a little bit later because you're doing a physical activity in the morning, or you might want to leave a bit earlier because you're doing a physical activity in the afternoon or something. Just little things. It's finding ways to encourage people to be more physically active.
Thank you, Margaret and Nigel. I so relate to it because we have our, our founder director, Prasenjit Bhattacharya, who loves trekking, yeah, and invariably for the last 6.5 years that I've been in this organization, we've always had a few posts coming up either on Yammer or on the WhatsApp group saying, I'm going trekking this Saturday, anyone would like to join me? And, I went on those treks a few times. And then you understand, you understand about other likes and dislikes, and you have conversations. So, I really connect and resonate with with what both of you just said. Just the importance of leaders being able to share that authentic experience with a larger group of employees, right? And inviting them to be part of it. So thank you for that. Amit, anything that you would like to add?
I think apart from this, from my corporate experience, I believe that we need to integrate diversity, inclusion, equity within wellness part as well, and using a tone of compassion to it. But there's not a single comment made on anyone on the physical aspect, and it is so important point I'm making. No single comment on any physicality, and the beautiful word could be, how is your journey going on? Can we support it? I feel that would make a huge difference, because a lot of people, where I speak to corporate, they talk about the kind of comments on the physicality which is being given to them. Just adding to this what Margaret and Nigel said.
Thank you, Amit. Thank you, Margaret and Nigel. We'll just take some questions from the audience.
I'll have a very short question for Amit and his senior leadership. The ways of work are changing, and the workplace as a concept is also changing, especially with the hybrid coming in. So there is also a need to redesign workplaces. and also bring in design thinking. Now the physical literacy that you advocate, have you also looked at ways in which physical literacy can be embedded into the new workplace, the new reimagined workplace? Any thoughts on that?
I don't mind coming in there straight away. With COVID, it was quite obvious that people couldn't come into work, and so many people started physical activity of one sort or another. I do a lot of cycling myself and running, and I have never seen so many people cycling, walking and running, and this is families as well. And I think the flexibility that the current work environment could allow, where people can work at home at some stages, gives individuals that flexibility to say, okay, I'm going to start working a bit early this morning, I'm then going to take a break and I'm going to go and play badminton, or I'm going to go for a run, and then I'll come back and I'll work and I'll finish off my work later. And having that flexibility is really important. That can also be the case in work when you're actually in the physical building. But I certainly think the idea of individuals being more flexible in the work practices themselves allows them that freedom to be more physically active.
And I also think, Nigel, that the opportunity has to be facilitated. Because if you've got to catch a bus to go to play your badminton, then you probably haven't got time or whatever it is. So it does mean that the structure of the building, I think that I got a feeling that there was also some bricks and mortar that were coming into the questioner's remit. We've linked up with some architects now, and they are building new villages. And they are building villages which contain within their whole structure and roads and playing fields and everything, opportunities, easy opportunities to take part. And I sort of see that your request as following from that. It's not only the outside where you can do something, but something, I don't know, you could do something very simple. You could design it so people had to walk by the swimming pool, or they had to walk by something. And that might have said, oh, gosh, I'd love to do that. So it's reminding them and making it easy. I don't believe that it's ever true to say, no, I haven't got time to do it. Because I think you can so design your life to change it, even just for 10 minutes, quarter of an hour, walking somewhere. And I don't accept people saying, well, I haven't got time to do it. Anyway, that's just my comment.
Thank you. Thanks, Margaret. Amit, anything that you'd like to add?
I think that there's no difference, believe me. If you look at experience of person, if I talk about a real case, if there was a Muslim girl we were working with, she's an employee, but she has left Kho-Kho when she was 13. And her last experience was maths teacher slapped her because she failed in maths. And after that, she never played in her life. So if I know from where to pick up the journey again, what I had to create was a Kho-Kho team of girls which could meet in community and play again. And we have done, especially in Hyderabad, a Betikumba dance of females working in a corporate, because all them were more willing to go activity through culture, and we arrange a virtual class of Betikumba, or a virtual chef planning together, or virtual gardening together. So when you look at that, experience has to be enhanced. It's actually quite simple, that you're just trying to start where it was left for any employee.
Thank you. Thank you so much, Margaret, Nigel, Amit. It's been wonderful getting introduced to the philosophy of physical literacy, and I'm sure everyone here is probably going to go back and think of those simple joys of play that we had back in childhood, and how we can revisit it now in our adult lives. So thank you so much for joining us here today.
Thank you. Thank you so much, Sandhya, for taking us through that session. Thank you, Margaret and Nigel. Amit, thank you very much for joining us on stage. Ladies and gentlemen, making sure that we look at staying physical not only in the workplace, but in our home place as well, and doing so with compassion and no judgment. Well, thank you very, very much. I think a loud round of applause. Where is our joyful energy? All right, well, what we need to do right now is, I know what will make you really happy is giving feedback, isn't it? So go ahead, turn over the agenda, scan the QR code very quickly. You've got the opportunity to give some feedback right now, only about 10 seconds, very, very quickly. And then we've got a surprise. So everybody, 10. Sabi, are you ready with some music? Ready with some music? All right. So 10, 9, 8. Everybody done with your feedback? Done with the feedback? All right, the good news is what we're going to do right now is after you've seen the QR code and you've scanned it, you've given your feedback, let's go ahead to the next slide, the next screen, which is the leaderboard of Step, Set, Go. Do we have that already, or are we still tabulating steps? All right, everybody, we've got a lot of names over there. Remember that you can go ahead and collect some steps as well. I'm going to help you right now. But we've got a couple of prizes coming your way. Step, Set, Go. Thank you so much. You've made sure that we're active. Okay, so this is what we're going to do right now. Everybody sit up in your seats. Sit up. You know, there's active listening, there's passive listening. Today, right now, I wonder if you're being passive audience or active audience, all right? So everybody, what we're going to do is this. I'm going to invite you to take 3 selfies, but I'm going to give you different criteria, okay? So the first selfie, Sabi, can we have some music, please? Give it to me. All right, let's have it. Some Safri Dio in the house. Lovely, pick it up, pick it up, pick it up. Let's have the energy. All right, everybody, this is what we're going to do right now. You have to go ahead and click a selfie of you with everybody in your group on your table. Quickly, one selfie, quickly. With whoever's on your table, or go to another table. You can't be alone. You can't be alone. Go to another table. Join in. Quickly. All right. All right, right now, you've got to go back to your seats. Thank you. Thank you so much. All right, everybody got a selfie? Yes, you've got one memory that you're taking back with you today, for sure. And I'm hoping you've taken lots of other photographs. But right now, we are going to move forward to the moment that we've all been waiting for. So everybody, if you're ready, right here at the Wellness Confluence, we move into our next session. And for this session, the speaker requires no introduction. It is our final session of the day. He has created ripples as one of the most reputed cricketers of his time. He is one of the greatest fielders of all time in the history of cricket. Ladies and gentlemen, we are going to welcome on the stage the one and only John T. Rhodes. We will keep some time for audience questions, so keep them ready. We are now going to be welcoming on the stage Basuri Datta, Vice President at Great Place to Work Institute, India, to join us. And while she walks on the stage along with John T. Rhodes, let me share, a few nuggets of information. I'm sure you know it all, but John T. Rhodes is a renowned South African cricketer known for his fiving prowess. He is the only player in history to have received a Man of the Match award for fielding. In his rich cricketing career, John T. has played 52 test matches, 245 ODIs in South Africa. He's not only introduced a new standard of fielding in world cricket, but has also delivered countless memorable and often match-saving batting performances. We're wonderful and honored to have him here with us today, and also must add that we were delighted when you named your daughter India. Thank you so much for joining us here today. Ladies and gentlemen, the one and only John T. Rhodes.
to you. Towards the end, we will do some questions and answers. But
check.
Thank you. All right, now you can hear me. Amazing to see those steps on the board. I have just arrived from Sweden and I stopped counting at about 10,500 steps. So you lot are a long way behind me. I did land this morning having left Sweden at -7 degrees. So great to be here in the winter in Mumbai. It's quite incredible. I mean, I just suppose that everything is just, yeah, it's just depends on your outlook on life and your perspective. And it's been incredible to have been a part of a journey in India for the past, well, as a player, I suppose, since 1993. And it actually was quite interesting because I always like to sit into the conversation before my talk and just this physical literacy. And obviously, you're probably wondering in corporate environments, what does an old cricket player have to add or to offer all of you? Just also bear in mind that I have a Bachelor of Commerce degree. I grew up in South Africa during the apartheid era South Africa, which basically meant segregating people depending on their race, and we were, rightly so, banned from, we had economic and sporting sanctions. So I grew up in a very different era where there was no international sport for me to aspire to. So I have a commerce degree, I went to university, and also I have worked for a bank in South Africa as account executive, as a business banking account executive from 2004 when I retired. So I do have an interesting journey, and hopefully one or two things that come out of my conversation here this evening, you can take back and implement, not only for yourself, but hopefully for your working environment to make it a warmer and more enjoyable space. Because I think that was the key with the physical literacy, was about, it's got to be enjoyable. You know, I coach international players and 9-year-old kids, and I pretty much do the same things. Because the one message that came out, if you make it too technical, you take all the fun away. And there's no ways you can engage a 9-year-old child with technical stuff. There is no ways. So fortunately, I have a little bit of energy. I don't know if you noticed that in my playing days. I certainly like to get around, and I don't stand very still for very long, which is an asset when you're at backward point, but not so good when you're a speaker at a function, because those poor cameras struggle to track me. Yeah, I've gone out of screen already. I see you in the corner. All right, I'll try and slow down. But just seeing Amit get onto the stage took me back to 1992. Anybody remember 1992 Cricket World Cup? All right, thank you. I see one hand. That's great. I watch it on my videos every day. You know, I like to see myself in action. The days when I could fly through the air, because, you know, now at 53 I can still fly. It's just the landing that's the hard part. The flying is easy, but that touchdown, it's just not as, it's a bit like all of you with if you played gully cricket in that era in the late 90s, and I do apologize for all the bruised elbows. If any of you were diving around and, you know, because I know you're not all playing on a nice soft grass outfield, you're generally playing on a street or in a dusty road. So apologies for the elbows from that inspiration of 1992. But Amit took me back to 1992, because as he came onto the stage, he did the same thing as I did. We tripped over our laces, and we ended up almost falling head. Well, I did. He caught himself. I didn't quite have that dexterity, and I ended up flying through the air, tripping over my laces. But fortunately, Amit, I had a photographer who took a great picture, and I had Inzamam ul Haq running between the wickets. So I had a massive advantage over you. But yeah, it took me back a little bit there. And it's been quite interesting, you know, just Because for a long time, I mean, I've been coming back to India since 2010. In fact, the IPL was actually held in South Africa 2009, my first IPL. So 2008 was the launch of the IPL, 2009. And then 2010 was the first time I'd come here as a coach. So when you come here as a cricket player in India, because of the passion for cricket, you can never actually get away from it. So as a cricket player, you pretty much see the airport, you see the hotel, and you see the cricket ground, and that is it. So since I've been here as an IPL coach, I've borrowed a bullet, I've got an Enfield, and I've gone out to ride. Now, yeah, the insurance company's here. Yes, HDFC, ERGO. But nervous, I'm sure, that I'm advocating, oh, get out there and ride. It's not a workplace injury, people. But, you know, and don't tell anyone, but I actually don't have a bike license. But I pretty much fit into the way everybody else rides in India, so it's fine. So strange, coming from Sweden, where everything is, you know, to the letter of the law. Lane discipline in India. I mean, what is that? But the amazing thing, too, is, I mean, PM Modi ji, when he was first elected and he spoke about Make in India, my wife and I, we have put our hands up and we said, okay, we will listen to the PM, sir, and we have 2 children made in India. So that was 2015. 2015, India was born just across down the road, virtually here, at the Surya Child Care Hospital. And then 2017, Nathan was born, also just down the road at Surya Child Care Hospital. But the amazing thing is my wife is a yoga teacher. She also is also an architect. And that's been the interesting thing about my wellness journey, because I had the advantage of being a professional sportsman without us really getting a great deal of income prior to the IPL, but I was paid to do a job. And my productivity depended on me obviously practicing very hard. But in those days, training was not very scientific. We all just did the same thing. And fortunately, as a hockey player as well, I was rather busy on the field because I had a lot of energy, because I was a fairly fit person. Not because I wanted to be, but because I played so many different kinds of sport. And I heard about Coco. Anybody else played Coco this year? Man, I played it about 3 months ago and my neck is still sore. That flying dive those guys do, it's crazy. Yeah, as I said, the flying is not too bad, it's the landing part. So yeah. So anyway, so that's, you know, my journey in India here has been very much a discovery on, for me as an ex-sports person who was, as I said, was paid to be physically active. And it was only until I met my wife that she, as a yoga teacher and as an architect, she made me realize that everything is connected. Because sadly, too often here in India, we think fitness is about Bollywood and it's biceps and six-pack. And that's the image people have of wellness here. I think in the West that was very, you know, there was, in the 80s, the Arnold Schwarzenegger sort of era, that was what people also thought fitness and health was all about. Big biceps, six-pack. And my wife made me realize, because I was a fit person, just because I ran a great deal, but she really made me understand the importance of all of it being connected and all of it being healthy. And that involves nutrition, that involves rest and recovery, because a big part of what players do now, the men and the women's teams, they are playing so much cricket, that recovery is a huge part of wellness. And it's, I think, important for all of us to note that the entire structure is important, is essential. And it's been interesting, and Amit, I'm sure you've got some great stories. I'd love to connect with you. But, you know, from a leadership point of view, I've played under different captains with very different leadership styles. Traditional leadership style was Kepler Wessels, my first captain for South Africa. And that was him telling me what to do and how to do it. Not just what to do, but how I must actually do that. Never mind that, you know, a team is about bringing unique individuals together and utilizing those skills and abilities that they have to take the entire team forward. Then I had the privilege of playing under Hansi Cronje, the late Hansi Cronje, as a captain and as a leader. And he was somebody with incredible, sorry, I still get worked up. I know he had issues. Oh, I didn't bring my water with me. But don't throw it. Oh, thank you, thank you. I probably will drop it. So the late Hansi Cronje was an incredible leader because captain, he understood that each player in his team was unique. Each player required something different. And yes, we would sit down as a captain and as a player and discuss goals and discuss, where we want to get to. But he never once told us how we had to get there. And that was the difference between the traditional style leadership, which was, this is how you do it, or this is what you have to do, and this is exactly how you got to go about it. And to a self-motivating style of leadership. Yeah, thank you. I'm going to go one hand here. Thank you, thank you. 2 seconds, sorry, for Hansi. So when it comes down to, my topic was resilience and daily discipline. And the crazy thing is, a person like myself has been really fortunate just because of the energy that I have. I've always stayed active. But just to the, Nigel was talking about as well, you've got to incorporate movement that we can do on a daily basis. Because if you start making it a diet and a training regime, there's no ways you're going to maintain that throughout the year. And that's certainly what I've seen here in India. People get inspired to do something, but then after 2 weeks or 3 weeks, they go on a work, or they miss out on a training session, or they eat. Everybody always has. Who's had tea and cookies today? Tea and cookie. Yeah. Okay, it's only half the people, not even a half. Okay, it's amazing. Because that was always the thing about me coming here to talk in India before the pandemic, was me being asked to come speak by management to the employees about self-motivation, about willingness to go the extra mile, about performance, and just going beyond. And for a long time, that's what I focused on, because I had all these sort of team examples of being able to work with a team, as in South Africa, work with captains and as players. And we were the #1 ranked team for 5 years under Hansi Cronje's leadership without winning a World Cup. And that's another topic altogether. It is also why I started choking. I was starting to think about the World Cup. But it was interesting because after Nathan was born in 2017, because this is my wife's 4th child, so Nathan was very comfortable. And as a yoga teacher, she had a pretty healthy environment for Nathan just to stay there and not want to get out. And unfortunately, what happened is that it pushed deep into the tournament, and in fact, the day of the final, I left Mumbai to go to Hyderabad for the IPL final of 2017. And by midday, my wife and I discussed, and we decided that, okay, well, if Nathan hasn't made an appearance, because the Ambani family were really supportive. They allowed me to, fly later than the team, get back on a plane straight away, just in case Nathan appeared. But he hadn't appeared. But the gynae was amazing because he had been the same gynecologist who'd worked with Melanie through India's birth. And he just said, as long as we stay in touch with some medical professional, he's fine. And we chose an Ayurvedic doctor in 2017. And it was amazing because, again, you have yoga, you have Ayurveda in India, which is inherent in here. And it's such a part of the fabric and has such intelligence. And too often we think, we've got to look to the West because that's the best practice. And it's not. There is so much in India that we came, from South Africa. I mean, it's like a massive place. We're having a hard time currently. We can't keep the lights on in South Africa. But for us, we wanted to come to India. We wanted to have birth, Melanie to give birth in India, because of that spiritual connection that she felt from day one. And I think too often in India we overlook because we're thinking that everybody else has the right ideas or the best ideas, where there's so much here that we can hold on to and utilize in our work environment or in our home environments to make us healthier, more productive people at the workplace and at home. So it's been a really interesting journey, and I'm really excited to be here at this wellness conference because, for a long time I was regarded as the #1 fielder in the world. I mean, 1992 I fell into the wickets. 1993 down the road at the Brabourne Stadium, I managed to take 5 catches in a game. I mean, I was told afterwards it was a world record. I didn't even know that world records existed for fielding. So from those 2 days, I mean, those 2 events, 1992, because I ran out Inzamam and he was a Pakistan player, of course, then I suddenly became an Indian hero. And then in 1993 at the Brabant Stadium, it was against the West Indies. So I hadn't caught Sachin Tendulkar then. So everybody in the stadium were, I mean, it was like 25,000 people. And I'd never played we'd been to Australia for the World Cup. In South Africa, we never had crowds that big. But the entire stadium was just chanting, John T, John. It was insane. I mean, never had you toured another country and had people cheering your name. So 1992, 1993, people were talking about fielding. 2006 in India and Pakistan, nothing was happening. People were still talking about fielding. And, you know, it was important. The late Bob Woolmer, he was coaching the Pakistan team. And 2006, they were about to tour England for a test series. He asked me to come across and do a 10-day camp. And the interesting thing was that I'd always said, if I'm going to go and coach, I want to coach the coaches. Because sure, I can go in and inspire and I can show people, but cricket is a game of habit. And if you do it for 3 days and then stop doing it after that, all that, the 3 days and then the next week maybe of work and effort is going to be for nothing. Really. And the interesting thing was Imran Khan, so he was a politician, he wasn't yet PM at that stage. He just said, oh, it was a newspaper about Jonty Rhodes arriving in Lahore. He's going to work with Bob Woolmer and the national team and the under 19s and the A team and then about 10 coaches. Imran Khan said, he's wasting his time and our money because there is no fielding culture in Pakistan. This is 2006. So people had seen the benefits of fielding. Okay, T20 cricket hadn't yet started in earnest, but people were still talking about it. And why I'm really excited to be here is that you're not waiting for government to tell you, okay, now we need to start taking care of our people. You've stopped talking. You're already doing. And that for me is incredible. Because, you know, for a long time, it was a case of people talking about fielding. And only once the IPL started in 2009, 2010, did people understand the value of having everybody making that kind of contribution in the field. That suddenly every team had a fielding coach. So yes, I want to be a wellness officer in India. Because I think hopefully I inspired a few people. And as I said, I do apologize for the elbows from gully cricket. But I really want to be, my next mission is to be here in India and inspire people in an organization, and not just the people employees who work there, but the leadership. To appreciate the fact that for a more productive workforce, for people who are going to be more productive on a daily basis, we need to start understanding them as individuals, and we need to start providing a work environment that supports them to live their best life every day. And how can we do that? I mean, it is possible. You're here for a reason. You are making it possible. Because I've certainly seen from a change point of view that teams and leaders, there's 3 ways that you can handle change. One is you turn your back and say, that's not for us. The second way is to say, wow, that's a great idea. Let's do that. And you embrace the change. But the problem with embracing the change is that you're just keeping up with the opposition. So take us back to 1996 Cricket World Cup. Anybody remember that World Cup? Who won the World Cup in 1996? Sri Lanka. So everyone thinks that T20 cricket has changed the way that the game is played. But no, it goes back before then. The Sri Lankans changed the way that cricket was played. Because in 1992, they played in the World Cup. Everybody was having the same test batting partners as they had in one-day cricket. It was before power play cricket. So your opening batters for test cricket were the same as your opening batters for 50-over cricket. And the whole policy was, let's build a platform. Let's lay this foundation. And then the middle order is for guys like Jonty Rhodes to come and be busy, keep the ball on the ground, less risk, so ideal for me. And then the last 10 overs, we will hit as many as we can, boundaries and sixes, and hopefully we get to 200. I mean, 200. Now, what are the guys scoring, men and women? What are they scoring in a day? It's incredible in 50-over cricket. You know, in 20-over cricket, you score 200 and you're not guaranteed to win the game. So the Sri Lankans said, what's the point? 1996. We tried that in 1992. You know, if we do the same thing expecting a different result, then we're a bit silly if it's not working. So what they decided was to take a game away from the opposition in those first 15 overs. The rest of us were thinking, you know, test cricket. No chances, see off the new ball. We get to 45 or 50 runs, but wicket down. Only one wicket we're going to lose. The Sri Lankans said, no. We are going to see the ball and hit it. That's our philosophy. Sanath Jayasuriya and Kalu, Ramesh Kalu Uttarana. I mean, I'm vertically challenged, but the two smallest guys in world cricket at the time, probably. They were sent up and just said, with absolute freedom, if you see it, hit it. Sanath was aiming over long off, thick outside edge, 6 over third man. Didn't matter. Incredible. So they were now aiming for 80, 85 runs in those first 15 overs. And if they lost 2 or 3 wickets, that was fine because everybody had that rebuilding period in the middle overs. And they had Aravinda, they had Arjuna Ranatunga. Anybody remember Arjuna Ranatunga? Most frustrating, I mean, a great captain, great player. But when you're a fielding team and he goes down to third man and he runs and then he... And that's his running between the wickets. On a good day, he used to drive us crazy. So we had this guy, Fani de Villiers, who was at third man, and he was a javelin champion. And whenever we said, Fani, if the ball comes to you at third man, see if you can't hit the stumps at the bowler's end, because Arjuna is definitely walking, just watching, thinking he's safe. But he drove us crazy. But they had that sort of experience in the middle overs, and then they had the power hitting at the back. So they changed the way that cricket was played. The rest of us were then looking for pinch hitters. Pinch hitting became the buzzword of international cricket from that 1996 World Cup. We had tall off-spinner, Pat Simcox. We sent him out to bat. He tried once or twice, failed. We went back to our test batters, the opening batters. So the Sri Lankans changed the way cricket was played. And as a number 1 ranked team at the time, under Hansi Cronje and Bob Wilmer, we decided, okay, we want to be an innovative team. Because that's what, as I said, the third way to handle change is not just to embrace it, which is keeping up with the Sri Lankans or trying to, but to initiate the change, to be innovative. And sometimes being innovative is doing the same thing slightly differently. It's not about discovering something that nobody else has seen of or heard of. They just played attacking cricket instead of defensive cricket. So it was a slight change to what everybody else was doing, as opposed to something that nobody had ever heard of or seen of before. So we as a South African team thought, okay, we want to be an innovative team. And at the time, Bob Wilmer was very involved with his laptop, using it for player sort of analysis, for technical analysis, and opposition analysis. So if we wanted to see what Murali was doing, and we weren't too sure, we would study a lot of video on the Dusra. This one, Murali, brother, that's a lot of wickets. What did Shane Warne, my good friend Shane Warne, used to say? Yeah. Anyway, so Bob Wilmer said, okay, Hansi, we want to be this innovative team. If anybody's got an idea, let's bring it. Let's try it out at practice. If it doesn't work, it's fine. But let's keep trying to find ways where we can stay ahead of the opposition. So come the 1999 Cricket World Cup, which was held in England, Bob Wilmer had been watching American football on ESPN and the hotel television, and he had seen the coach there on the ground with the speakers and like a microphone, talking to other coaches that had a vantage point, and also even talking to players on the field. So what Bob Wilmer said was, hey, Hansi, why don't I give you a communication device? It's a one-way communication device. So all it literally looked like a small hearing aid. And Hansi would put it in his ear. And Bob just said, often as a leader, and it was a great business example, often as a leader, when you're at the coalface, it's difficult to sometimes step back and see the bigger picture. So in the days before IPL, there was no dugout on the ground. The vantage, you should sit and wait for your turn to bat in the dressing room or just outside the dressing room. So it was generally at a vantage point. So Bob said to Hansi, if I see something, I will just let you know quietly in your ear. You don't have to use it. It's just for you. But because we didn't want to break the rules of the game, obviously, I mean, we didn't want to seem to be cheating, we looked at the rule book, the rules of cricket. Now, those were drawn up in 1820. So obviously nothing there about communication devices in the rules. So we felt, okay, we're not breaking the rules, so we should be fine. But just in case, Hansi taped over, with a piece of plaster, he taped over his hearing device, or his communication device. And unfortunately for us, Alan Donald was an absolute gadget freak at the time. He grew up in a very small town in South Africa, not many gadgets or things that were happening. And if it plugged into the wall and it turned on, he had to have one. So unfortunately, or maybe fortunately in the long run, the communication device came in a set of 2. And Alan Donald put one in his ear. So come to bowl the first over against India at the Hove, and it's summer in England, and everybody is freezing cold, because summer in England, it doesn't really happen, unless it's a heat wave, and then everybody just swelters. But he had his cap, and he had his 2 jumpers, which he gave to the jersey, and to the umpire, and then he starts digging in his ear like this, and he hands the umpire this brown thing at the end of his finger, and the umpire goes, "Whoa, what is that?" You're thinking Alan Donald was literally cleaning out his ear and giving it to the umpire, because that's what it looked like, a little round brown lump. So Hansi by now had come across, and he was talking to the umpire, and the umpire said, "Hansi, what's this?" So, well, it's a communication device. So the umpires got on their communication devices and spoke to Mr. Clive Lloyd, who was the match referee on the day. And Clive Lloyd, again, Mr. Lloyd, the South Africans have communication devices. Can they continue? So Clive Lloyd went through the rule books, the same one we had been through, 1820. Nothing there about communication devices. So he said, "Hansi, you're not breaking the rules." But he felt it was not within the spirit of the game, because nobody else had a communication device. And we said, that's the whole point. We don't want other people to have they didn't think of it. That's not our problem. We thought of it. We want to have it. But obviously, Mr. Clive Lloyd says something, you listen to it. And that was a case of us again, feeling that by just embracing change, like we try to do with the Sri Lankans in 1996, you were only keeping up with the opposition. But it's when you're initiating that change is that you stay ahead. And I think that's really important for me, is that it speaks it resonates with me so much in this audience. Because this change that we're a part of today is so necessary for everybody, not just for a better profit but for a more productive workplace for people, and a more enjoyable and a healthy life is so important. And I think just to back that up, though, is that the example of the Sri Lankan players is that had they gone out and been instructed to just smash every ball like they did, they played with absolute freedom, which is what you see players now do in the T20 game at the end, or even in the power play. Some batters are told just to go and hit the ball. But can you imagine what the morale would have been for the players themselves and the whole team if after 2 games, and Sanatha he'd skied one and got caught, and Kalu had chopped one on for 10 or 15 runs. After 2 matches, they hadn't scored past 20 with this new style of play. Can you imagine what damage it would have done to their morale if they had then been dropped, or if they'd gone back to the other style of play? They had freedom to fail. And that sort of support is really, really important. We're looking for people to step out of their comfort zones, to embrace something that is very, very new. And how do we do that? Because we all have egos. You don't have to be an ex-cricket player to have an ego. We all have egos. When I work for the bank, my report card at the end of the year, I want to tick in every box. I don't want a negative result or a negative outcome, but they happen. They do happen. Because some of my gateways were responsibility of home loans, were responsibility for vehicle and asset finance. I had to introduce the lead and then leave it. So it actually wasn't up to me. And I think that's been such an important lesson for me, especially now as a coach, is that you can't afford to really put all your focus on the outcome. We have to look at the process, because how do we back people up on a daily basis? How do we arrive at a self-motivating team like Hansi Cronje had created, where the players feel like the captain, no matter what the outcome is, captain has your back. And the great thing about an organization, you don't have to be the CEO to be a captain. You can be a leader within an organization, within a group, within a work group, without having to have a designation or a title. I had no title, but I was the captain of fielding. just because of the example that I set, not on the field. Because that was an amazing thing. It was the way that I had practiced was something that I found out from Herschel Gibbs. And again, to go back, my father as a teacher in South Africa was also a sports master and a sports coach. So he coached rugby, was his game, and a bit of cricket, which wasn't really his game. And he never coached the first teams because myself and my brother were sort of good players, and he didn't want people to say conflict of interest. You know, you guys are on your own. But my father, coaching the 9-year-old boys, because we had a school of 600 boys, just said, Jonty, watch these players here. They're here for 2 hours. They're having a great time, but they're actually learning nothing. 2 hours, they've learned, and he was very much like that, physical literacy. They have to enjoy. The engagement has to be fun. There's no way they're going to come back for 2 hours on a hot day and play cricket if they're not having fun. But he said, you have to understand, Jonty, that your teachers and your coaches will tell you that practice makes perfect. Throughout your school career, throughout your playing days, that practice makes perfect. And he said, no, it's only half the story. Because it's perfect practice that makes perfect. And that was interesting because my preparation for a game, we didn't have a fielding coach. So I didn't have the luxury of taking somebody down and working for hours on my fielding. We had cricket, we had our practices, and then literally for 10 or 15 minutes, I would take a batting partner, Gary Kirsten, because we weren't bowlers. We weren't all-rounders, we were just batters. And he would come hit me catches, which is also why I ran and dived into the stumps to get Inzamam out. I didn't trust my throw. I played to my strengths. My strength was my speed. Accuracy wasn't my speed. We needed a wicket desperately. So again, that's pretty much physical literacy. Being able to understand what is required next, what your body needs to do. I was going to run up to the stumps. I knew I wasn't going to throw. Suddenly, I saw that he was getting back closer, and I felt the fastest way to cover those last 2 meters was to go airborne. And it worked. So that physical literacy, I'd never practiced it before, and I never did it again. It just was the right thing at the right time. And we all have that physical literacy within us, because we all played as children. And that's what we need to keep encouraging, keep going back to. But just go back to my story. The interesting thing, Herschel Gibbs and I went to go coach for a weekend, the young South African Academy players in Pretoria. And the coach introduced Herschel and myself and said, yo, Jonty's done this and Herschel's done that. And Herschel just said, guys, I want to tell you one thing about Jonty that the stats and things will never tell you, because there were no cameras, there were no journalists to record it. He says, the one thing that will stick with me as a colleague, a teammate of Jonty Rhodes, was the way that he practiced. And I kind of went, what are you talking about? You didn't even see me. Now, he was up in the nets batting and having extra batting. And he said, this guy used to throw himself around at practice, not just in the game. And that for me was not important because my career had ended. But it was interesting to note because we can't be leadership that tells people what to do. Because that is not sustainable or consist over a long period of, or consistent at all. We have to do that. We've got to build a team culture that we believe in, that resonates with people because they see it in us, not just us telling them that this is the way they have to be. So a really important, and again, I'm grateful to my father for having done that or given me that message so early on in my career. And the fact that I loved to field. Maybe that came across in the game. I really love to field. So finally, just as I'm running out of time here, is that we as a South African team, we talk about chokers. We played in a few World Cups in my time. And as a fielding coach, I keep talking about the importance of one run. Because in a T20 game, the result often comes down to the last over of the game. And often, the last ball. So if you're the poor bowler who has to bowl that last over, every run that you have at your disposal is gold dust. Every single run that you have is gold dust. And I ask the players in the game, everybody, save me, run. Just one run. And that includes a wicketkeeper in the field, so that's 11 runs. If we save 11 runs in the field, a single here, a double there, save a boundary at backward point, that is awesome. But every single run that we save is a step forward to us achieving our goals. Because that poor bowler in the last over is going to be grateful for every run that they can get. And why is that important or relevant here. I think in organizations in India where sometimes there are 1 lakh employees, pan-India, globally, too often, and in a country of what's the latest count? 3 or 4 billion? Yeah, nearly 4. I mean, that was a funny thing, not the funny thing. My wife and I, we came and we had children in India and they said, thank you, but take them and go. We have enough. No Indian passports for you. We don't count you in the census. Off you go back to South Africa. So India, Nathan, that's as close as they got to being Indians, was being born right here. And India eating palak paneer because that was Melanie's favorite dish for the last month of pregnancy. I think India came out green. She's the one child in the family that literally will lick a bowl of spinach clean because her mother had palak paneer for the last month. But anyway, so coming to India where you say 1 run, 1 person in your organization, because too often we want to do the sexy stuff. We want to hit the last ball for 6, preferably with a helicopter shot. Or we want to defend that last over and take 2 wickets or defend 6 runs. And everyone sees it and everyone celebrates it. I mean, I still remember Hardik Pandya's his over against Bangladesh in Bangalore. That last over, and Dhoni got the last wicket run out. I mean, that's the kind of thing that makes a star or breaks a player quite often. People want to see that and be that. But that one run, if somebody slides into the boundary, pulls the ball back, and they run 3, that for me is huge. Because it's often in an organization that the small things are not recognized. We take them for granted. The people who are doing that, we take them for granted. And all they're looking for is just a pat on the back, an email saying, thank you, I saw that. I love what you're doing. Because it's making a difference. Because just an example, 99 World Cup, South Africa versus Australia semi-final. We tied the game with Australia. They had a better net run rate. Out we went. They went through and beat Pakistan. We tied the game. 1 more run is all we needed to win the game. 2003, we tied with Sri Lanka in Durban, the World Cup. We were hosting, not for very long. We tied the game. We needed 1 more run. They went through, we went home. We were home already. Real waste of time. But South Africa then played. I was working for Standard Bank. I was also now the sponsorship manager. And we played against Australia in Johannesburg. They scored 434. At the time, no test playing teams had gone beyond 400. So it was like a record score. So now we have to go and bat, and there's no chance. No one's ever scored 400. Nobody. Herschel Gibbs smacks 175. Graham Smith hit 90 off about 60 balls. The game was incredible. It just went boundary, 6 a wicket, it's just crazy. Got down to the 50th over of the game. We were 8 wickets down. Mark Boucher was batting on 44, and Andrew Hall. He was a bowling all-rounder, he could bat. But he's facing Brett Lee. We need 6 runs to win, but we are 8 wickets down. Next is Makaya, so we're actually in trouble. Andrew Hall hits the first ball for a boundary. Ricky Ponting's the captain, he brings everybody in to prevent the single and getting Mark Boucher back on strike, or at least tying the game. He wants to force Andrew Hall to hit the winning runs. He's a good captain, he's a smart and crafty guy. Andrew Hall tried to hit the winning runs. He got caught. But because the players were in close, the batters could not change or swap ends. Mark Boucher still stuck on the non-striker's end, and in strides Makaya and Tini. A bit like Arjuna Ranatunga. Not sure where to look. Because Makaya was #1 ranked bowler at the time, but could not bat. Sadly, we tried really hard. But anyway, so he's a bit scared because he can't bat, and Brett Lee bowls at 150, so Makaya's rightly scared. He backs away slightly, and he manages to hit this virtually perfect leg stump Yorker down to third man. The only 2 players they had out were third man and fine leg, because they were expecting Makaya, if he hit it, to edge it. So it went down to third man for Ek run. Now Mark Boucher's back on strike. The next ball he hits for 4. We win the game. The greatest one-day game they called for a while. The greatest one-day game ever. 4-3-4, we scored 4. The South African team scored 438. Now I'm about to hand out the trophy for Standard Bank to the winning captain, Graham Smith. It looked like I was giving it to Ricky Ponting for a while, so luckily I was giving it now to my friend and former colleague, Graham Smith. And at the end of a prize giving, there's always a lot of sponsors and people on the podium, and I'd ask Cricket South Africa, I've had my time in the lights, I'll sit quietly with the players and then hand over the trophy. So I'm standing next to Makaya and Tini, and now I'm teasing him. He's got this huge smile on his face. I said, Makaya, why are you smiling? You bowled your 10 overs for 90 runs. It's like the worst day at the office you've ever had. I'm joking. But anyway, so he looks down and says, hey, Joe, my 1 run, it won the game for South Africa. I said, what are you talking about, 1 run? Herschel Gibbs, 175. Graham Smith, bang, he smashed them, 90 runs. I went, of course. Without your 1 run, we would have lost by 1 run. It would have been an amazing game. It still would have been the greatest one-day game, but we would have come second, which is not a great result if you're a cricket team. You want to be coming first. And that 1 run was an impossible target. That 1 run that Mackay and Tini scored allowed us to achieve that impossible, never been done before goal. And I think that's the importance in an organization, to appreciate people making that 1 run of a contribution. Because that is, you can do consistently. That is sustainable over a long period of time. And you can build on that 1 run, as opposed to looking for the sexy stuff that happens once in a season or once in a career. What is that 1 run that we can recognize and appreciate? And that's your job. Good luck with that and have fun. Thank you very much for having me.
Wow. Thank you so much, Mr. Rhodes. I'm sure there are a lot of questions that the members of the audience want to ask, so we could take questions. Thanks for sharing such wonderful stories.
Hello.
We have it at the
Yes.
back.
Hi. I'm Pooja. My question was essentially that there are days where we're all feeling down, we're not at 100%, or there may be some setbacks that, we are not able to work through. But how do you stay motivated? How do you persevere through that phase?
Pooja, thank you. And firstly, sorry, Mr. Rhodes is my father. I am just John T. So thank you for... Pooja, I think what's important, and it's, I spoke early on about I've always been a part of a team. And when you're trying to, in isolation, inspire and motivate yourself, if I go on tour, my wife, as I said, is a yoga teacher. When I'm at home, we drop the children at school, we walk 45 minutes back, we've just stopped swimming in the lake in Sweden because it's actually iced over, so we've stopped doing that. We would have a self-practice yoga because I have a partner, a training partner. If I'm on my own, I often don't exercise for weeks at a time, and I feel really bad because I've always been in a team environment. So I think that's the importance of what we're trying to achieve. And it's certainly something that I am striving to take forward into corporate India going forward from my perspective, is that when you answer, not answerable is the wrong word, but if you have a training partner, if you have somebody who can, because if I was working with Gary Kirsten or Hansi Cronje from a batting point of view, I also understood his game. And if we're doing things in isolation, it's really tough, to pick ourselves up all the time. So I think what's important, Amit has spoken about it, how do we get into small teams or groups where we can support each other? Because to do it and as I said, I'm here talking about daily discipline, and I have to put my hand up. If I'm on my own, my discipline sucks. But if I know that my work is going to affect the team's performance or the team's productivity, I'm giving off my best all the time, every single day. As I said, I'm not worried about the outcome. I'm more focused on the process because I'm not going to be successful every time. I know that. But did I give everything today? And yesterday, more importantly, yesterday, not just when there's a meeting or there's something that there's an opportunity that is coming my way. I need to be prepared before that. So I think from that point of view, that practice makes perfect was something that I held on to very closely. Because with cricket, when you bat, you have a chance. The umpire then could get it wrong. The bowlers could bowl a good delivery and you could play a bad shot. So does that make me a failure? According to the statistics, yes, I had a bad day, like Mackay is bowling. But in a team environment, firstly, I know that if I just give it up, I dropped catches. I missed balls in the field. And Hansi Cronje was the first guy that would come to me and say, hey, John T, team needs you. Because he could see. It meant something to me when the ball went past. It would even worse if I stood there and watched the ball go past. If I dived for the ball and I missed it or dropped it, I would get a bit upset. But he would just call me in and say, John T, that team needs you. So I think as much as possible in an environment where, there's going to be hybrid work situations. People might still be at home. Not everybody's in the office every day. So how do we stay connected? The human side of business is something that we really need to focus on, a great deal, because we can't do it on our own. We really can't. So I can't give you the answer, this is what you do to fix it, because we haven't won a World Cup and I still don't know how to fix that either in South Africa. I wish I could just flick that switch. It's not a switch that gets flicked. But having been in a team environment and understanding the benefits of having somebody, as I said, not answerable to, but who depends on my, me being fully committed to the job on hand. But that is the human connection. And I think that is something that COVID, the pandemic, has shown us, the importance of community. And it's not just at home. It's community within the workplace. Because without that community, you will struggle every day to pick yourself up. But if you're in a community, we identify with others, we can feed off other people, we can support the people in our organization. And again, that's something that I'm looking to push forward into India. I mean, I had a choice. I was a tennis player. I hated singles. I loved doubles. Only one other person next to me, but it was like a team. That was my best thing for playing tennis, not playing singles. I hated being on my own. So again, in the organization, what can we do, whether it's movement, whether it's sport, whatever the activity is, that we can feed off each other and support each other? Because that community, as I said, that's what the pandemic taught me, is essential.
Okay, ladies and gentlemen, we have time for just one more question, so to the lady.
Hi, it was a lovely session to hear you live. I've heard you before, but it was more virtually. So I have a question here. In a corporate scenario or on a field as such, how do you get an unaccounted or an unproductive, laid-back player back to the field in a perfect practice?
Yeah, that is interesting because thanks for the question. How do you get somebody to be productive if they slightly laid back? And the amazing thing is, and I said early on, we are all unique. The beauty of a team is that everybody brings their different skills. And we need to celebrate that. But the teammates, I mean, Lance Klusener, he virtually won us that World Cup single-handedly in 1999. Now that guy shared a room with me for 3 years. We shared rooms in those days as players because he and Sean Pollock had been roommates. Sean Pollock took over the captaincy from Hansi. Lance Klusener probably said 3 words to me in 3 years. He just wasn't a team guy. He was a fisherman. He was a hunter. He did that on his own. Cricket, he was exactly the same. In fact, if he had been a team guy, he probably would have gone to Alan Donald and said, "Hey, Alan, Aramse, I have this under control. Just wait. I will hit it for 4. No problem." But then there was panic. So I think the key there is just, and Hansi Cronje had made me the captain of the fielding. And I never went and said, "You've got to be like me. You've got to do this, you've got to do that." I mean, I worked with Munaf Patel. There's no ways I'm going to ask Munaf Patel to be anything other than the best version of Munaf Patel, which means don't stop the ball like that. So my role as the captain of the fielding was to, if I found a player that I believe wasn't quite pulling up their weight or didn't go for a ball that possibly they could have, all I would just say to them in the field was, "Now we'll never know. So if you don't go, you'll never know." But I always had that example that they never said, "Oh, what are you talking about? Who are you to tell us what to do?" We all understood. I think we all put egos aside, and we all had roles and responsibilities. But if it's your role to speak to somebody, there's also ways of doing that. So it was never, I don't want Lance Klusener to be anybody else than Lance Klusener, because he was the best version of himself for a long time that was just almost impossible to bowl to. So and he was laid back. He was very quiet, very shy. People find him quite rude, but they don't know him like we do. They don't know that he's actually a shy. He could not speak English when he started school at age 6. He was a farm boy. He spoke an African language, Zulu, which is why it's called Zulu. He was fluent in Zulu, could hardly speak English at home. His parents spoke Zulu. So from that point of view, we didn't try and change him to be anything other than Lance Klusener. So that's the difficulty, and that's the challenge that we have, is that to do that, we need to understand everybody. We need to understand the people in your team. Because then you can say, well, some people need a kick in the backside. Sometimes, like Hansi would come to me, you just need an arm around their shoulder. But you need to understand, we need to understand the makeup of the people in our team. There is no shortcut. There is no shortcut. It requires time. It requires a genuine effort to understand people within your team and your organization. Cool.
John T, requesting you to continue to be with us on stage. You know, we're all mesmerized with your storytelling, and I think we're definitely taking back the one run. At least I am. I'm going to be celebrating that and looking forward to that in my life as well. Can we please have Basuri join us on stage? I know you've got the beautiful memento, John T, to make sure that you remember your time here with us when it went from being -7 degrees Celsius to being more than 30 in Mumbai. Thank you. Thank you. Thank you for your presence. Ladies and gentlemen, John T. Rhodes. Thank you so much, Basuri Datta, for joining us on stage and facilitating the questions. And now, ladies and gentlemen, your final feedback call. Go ahead, scan the QR code behind the... I heard somebody say agenda, that's right. Behind the agenda. And go ahead and give your final feedback of the day. And while you're doing that, if you want to just stand up and walk a bit, that's a good thing, because we've got the top three walkers or step collectors today who are going to be showcased on the leaderboard of Step, Set, Go, walk away with prizes today. So we've got, all right, we're at, all right, let's hide those for just a minute. And I'm going to welcome onto stage Mr. Parthanil Ghosh to join us from HDFC ERGO. Everybody in the house, you can put your hands together, you can put on a big smile, you can get ready, because right now, Parthanil, if you are ready, we're going to unveil the names. Can we have the names on screen, please, once again? I can see... Well, maybe you really walked this morning, sir. With all right, and Step, Set, Go leaderboard. We've got Rajesh Manik joining us. Where is Rajesh? Rajesh, more than, don't go down, can we go back up, please? Up to the #1 spot. More than 12,000 steps is what we saw. Everybody put your hands together for Rajesh, and I think it was 12,237. Wait with us on stage, Rajesh. Where is Alok? Alok joining us right now, more than 10,000 steps. Where is Alok? Are you still walking? Please walk on the stage then, sir. Where is Alok? Alok joining us, last 5, 4. Let's go back to the top of the screen. Alok Bhargava, 10,622 steps. And we've got Abhishek Mangar. Alok, welcome. Thank you so much for joining us. You know, this is a live screen, which is why it keeps shifting every time people are walking. Thank you so much. And where is Abhishek? Abhishek Mangar, 9,574. We'd like for you to mention, let's have the prizes. We'd like for you to put your hands together for all of you collected steps today. Congratulations, gentlemen, Rajesh, Alok, and Abhishek. Let's go back up again one more time. And remember, this is going live, so please make sure that you keep collecting your steps. And who knows, more prizes could come your way. A big thank you to Step, Set, Go. All right, thank you very much, gentlemen. And now, ladies and gentlemen, we've pretty much come to the end. We've got one group photograph, lots of walking happening on stage. We always enjoy the steps, don't we? But with this, we come to the end of the Health and Wellness Summit. You saw the unveiling of the logo, TWC. The Wellness Confluence. When I say the wellness, you say confluence. The wellness? The wellness? Much louder. The wellness? All right, we're going ahead. This is a movement that has just about started. Let's build up the energy because you saw so many thought leaders join us on stage. And the beauty of the session today was that it wasn't only the magic that unfolded on stage, but all the sharing that came from all across you in the audience. So thank you very much for being here with us as we unveiled the Wellness Confluence, the Health and Wellness Summit. And with that, I hope all of you were able to grab some nuggets of learning. I'm hoping that you can implement them in your lives and have found these sessions truly thought-provoking and deeply insightful. So I'm signing off for the day. My name is Keisha Lobo, but I'm going to now hand over for the closing address. Please put your hands together once again, Mr. Parthanil Ghosh, making sure that the evening gets closed correctly. Sir.
So, good evening, ladies and gentlemen. Thank you from HDFC ERGO and GPTW for your participation in starting of a movement. The Wellness Confluence, I think that is so apt, this particular, the logo and the wordings, because post-pandemic, if there is anything good that has come out from this pandemic, and day before yesterday, we were speaking to our chairman of Munich Re, and he was saying that it is 1 in a 200-year catastrophe. So if in 1 in 200 years catastrophe, something good has come out, the good is the health and well-being, wellness has come to the center stage. Today, when in the morning we were looking the entire, this hall full, and of course on the virtually, there are so many leaders, CEOs, corporate citizens, they are watching these sessions. It shows that yes, health and wellness has really captured our mind because whatever we have seen in the last 2 years. Of course, you have heard all the leaders, all the experts. The only thing that when in the morning Dr. Shetty was addressing us, one of the topic that he said that no one is fit till such time you have done these 5 tests. And those are the 5 tests he said. So we will talk about the Wellness Confluence, health and wellness meetings. But before that, all of us individually have to certify ourselves that we are fit. And those 5 tests, and we know that in our organization, Anuj was mentioning in the morning, that though we take the initiative to have a employee health checkup schemes, but not more than 50% of the people actually come forward and take those tests. And we know, I personally know about 2 or 3 examples when these tests not being done, how people have suffered, and not only suffered, they gave their lives. So I think if anything that has come out of this meeting and this movement, which has actually started from today, this is not the end, that this particular topic has come to the center stage. The CEOs and the leaders have agreed that it will become a very, very important and critical topic when we discuss our organizational KPIs, the success and the failures, the P&L, the profit and the losses. If 25% of it or maybe a 10% of it, we take it today, and you said that 2023 is a tactical decision you have to do and 2030 is where you should aim at. But to start and to go to 2030, we have to start now. And I can't start only in 2029 to say that, oh, I have to do something in 2030. If this conference has achieved that much, to think of ourselves, think of our colleagues, the communities, to drive the health and wellness part of it, I think a large part will be done. One great initiative that I would like to talk about it, and I was doing my scoring on that QR code, and I fared very, very badly. So, but that's the reason I saved it on my documents. Is the workplace index benchmark. It's a very simple, comprehensive tool to start this practice of having wellness and health in the mind. So the physical wellness and also the mental well-being. And we as an organization, have collaborated with IIT Bombay, where we are developing a mental health platform, which as a part of our incubator, we are developing that. We are trying from our way how to help to the society, and thank you, Great Place to Work, to partner with us to create this benchmark, which I believe will really be a movement. And next year when we are here, I think a larger part of the community, the corporate world will be participating. I have to, of course, thank a host of people, the organizations who have worked, I know, months after month when we first conceived this. And first, our guests, we thank you very much to be a part of this conference today. All our esteemed speakers, thank you very much for taking your time and to be there for the full day. We know how busy you are, not only by way of your calendars, but the way you are contributing to the society and to this very, very critical topic. Our partners, Step, Set, Go, for supporting the movement and making the summit a wonderful experience for all. Our production partner, Max Mudra, and our venue partner, JW Marriott Sahar, for helping us a seamless organizing the summit. Our amazing host, Kisha, for wonderfully anchoring the whole day and actually motivating everyone to walk this 12,000 steps, and Alok was trying very hard at the back to make that 2,000 steps to become #1. Thank you very much. And all the session anchors and moderators, and last but not the least, the Great Place to Work team and HDFC ERGO team, my colleagues, to create this entire wonderful event, and before that to design this entire confluence to making India a healthy place to work for all. And thank you very much for starting this movement. I think in history it will be well scripted that on this particular day a movement got started, which going forward will be a huge movement to make India a healthy place. In the morning, Dr. Shetty was mentioning that not only mental well-being or a physical well-being, but you have to be spiritual as well. So I was reminded by the quote of Swami Vivekananda, and with that I want to end this conference. So he said, as long as the body lives, there must be strength in the body, strength in the mind, and strength in the hand. You must all pay attention to your health first. The one who actually succeeds in making himself believe that he is having a good time is the man of splendid physical health. Thank you, ladies and gentlemen. Thank you very much for attending this conference.
Thank you very much, ladies and gentlemen. With the words of Mr. Parthanil Ghosh, we've come to the end of our session here today. Thank you for joining us for the first edition of the Wellness Confluence. We look forward to seeing you next year. Thank you very much and have a safe journey home.